Good morning, ladies and gentlemen. Good morning to those of you who are attending online. I'd like to welcome you to this year's meeting of the Regional Growth Conference, touching upon a sector, the health sector, that has been affected gravely over the past years. I believe this is one of the most interesting fields of action and a sector with a lot of growth potential. So before we start, I would like to take this opportunity to thank the organizers of the conference and the Peloponnesos newspaper and Mr. Karvelis personally, who is giving us the opportunity to engage in such interesting debates about public health and about the future of the system of public health. The pandemic has tested our resilience, the resilience of the hospitals and health structures in general in our country, and the efforts of the health system to create a safety network, and it forced those involved to move rapidly and swiftly to meet the needs in every sector and for every group of our population. So there have been a lot of actions, a lot of applications. There has been an emergency, and we, the citizens, have also been trained in the matters of public health. And an example of all the above are the actions of the health authorities of the region. And we will hear more about it. We will hear more about what has taken place in the field of mental health and public health in general. So we will have Mr. Yanis Karvelis, starting administrator of the 6th Health Region, Peloponnese, Ionian Islands, Epirus, and Western Greece. Good morning. Thank you very much. Thank you for your kind introductory words. What you have said clearly shows that people do understand and do realize the work that has been done by the Ministry of Health and by our region in the field of the pandemic and public health and dealing with the crisis. We have managed the crisis, and we have laid emphasis on children, on a very specific group of our population in need of special care. So to tackle this international, this global phenomenon we were all faced with, and namely the pandemic, we cooperated with everybody, and we mainly cooperated with the scientific community and with the people operating in the field of education, with the primary, with the first grade education authorities, and of course with schools and students. We identified all fields needing our intervention. We collaborated with the competent authorities and with the teams of the health system authorities in order to be able to have the exact, the necessary data of the virus. I'd like to thank the representatives of LD, and I'd like to thank my dear friend, Mr. Yorgos Panagiotakopoulos, who is originally from Patras, and we have been friends for years, and we cooperated closely. So we visited the students, we did sampling, we took samples, and where it was necessary, in order to be able to identify the footprint, not just of young children, small children, but also of their families, because we had to trace, to be able to trace domestic diaspora, domestic contagion, and in order to be able to intervene in a timely manner. And then we informed the schools. The health professionals went to schools and provided information, starting from the very basic things, such as washing the hands, keeping a distance, avoiding crowds, and so on and so forth, because these are all elements of what we call public health. Public health comprises everything, and it is about the need to keep safe, to keep citizens safe. And so, on our part, as the 6th Health Region, with a team, seeing the participation of Mr. Vandarakis, of Mrs. Papadakis sitting next to me, and of other people whom we have included in a book. Anyway, well, we created this booklet, this book, which is of high quality, and we will have the opportunity today to give it, to present it to the Ministry of Health, because we believe that this is indeed a book that can reach every child at every school, and so students, children will have a guide that will help them deal with any viral pandemic in the future. And we did many other things. Last November, we organized a meeting on the mental health of children because of the lockdowns, due to domestic violence. So the mental health of the children was disturbed and was tested, and through a European program, Achaia, which we have adopted, well, we had the opportunity to do many other things to tackle social inequalities. I do not want to take up much of your time. I'd like to point out, however, that the professionals of our 6th Health Region played a very important role, and I'd like to take the opportunity to thank them for their contribution. And the primary care, healthcare, first-level healthcare authorities, they also played a very important role. We were in close and constant contact with them. We were also in constant contact with the school headmasters and the personnel of schools, and trying to abide by the rules and regulations of the scientists. And we tried to be efficient and effective and guarantee the highest level of safety to our children. And what was the reaction of the citizens, of the school community? Was it positive? Yeah, the reaction was very positive, and this is also thanks to the cooperation, the level of cooperation that we managed to achieve with, starting with kindergarten students and the families, because the sampling that we did saw a very large participation also from parents, and there has often been an interactive approach, cooperating with associations, rather unions, school unions, parents' unions, who would come to us and ask us to do things that were important to them. So, undoubtedly, Public health is also a very personal matter. It is also a matter of personal responsibility, a matter of mentality, a matter of skills that need to be taught at a very young age, because it is important for certain things to become a kind of second nature. So yeah, this book moves towards this direction. It is an innovation. It addresses children of younger age groups when they start going to school, and when they start learning basic things, important things, and when they start shaping a mentality. And with the participation of Mr. Apostolos Vandarakis, professor at the Public Health Laboratory Department of Medicine at the University of Patras. Public health for children, teaching children prevention, and this is a major investment of our country in the public health care. So the project will be presented by Mrs. Irini. So let me give the floor to Mr. Vandarakis. I'd like to thank the organizers and Mr. Karvelis for their support to publish this book. Because, I was one of the co-authors, and I believe that it is innovative and a very pioneer to be addressing the elementary school, students of the elementary school, because prevention needs to start very early. So it is a book, I believe, that it is very illustrated, and there isn't much text. It doesn't need to go to the bookstore. It needs to be distributed at schools so that students will see it with their parents to read it and study it and go through it. So I'd like to thank my team. It's been a collective work, seeing the participation of many scientists. And once again, Yanis, thank you very much for your support. Mrs. Papahadzi. Good morning, ladies and gentlemen. Thank you very much. I'd like to thank Mrs. Agoridi for the coordination and Peloponnesos newspaper for the invitation, Mr. Vandarakis for his introduction, and Mr. Karvelis for the opportunity he offered to us to talk about this book. I will be presenting Public Health for Children, which is a booklet addressing elementary schools and students of the elementary schools. This is it. We've saw it for the first time illustrated and ready today. Public health has always been a priority for us. However, given the pandemic, it is even more topical. A few words about the writers, Mr. Vandarakis, who was also the coordinator, Mr. Skoutsuri from Karamandani, and Mrs. Markopouli, social worker at Ektipe. I'm a pediatrician in Patras, Mrs. Tsagri, and Mr. Tsapalos. They are both nurses, and Mrs. Psarouli, who is a nurse at school. So I'd like to thank all the writers for their help, and because they worked to finish this book on a voluntary basis. Let us say a few things about health. Health is mental and physical well-being. It's not just about the lack of illnesses. Prevention has been an issue for people since the ancient years. According to Democritus, people would pray to gods for health. They didn't know that they could safeguard and protect their health themselves. At a social level, according to Hippocrates, it is beneficial to take care of the ill people to recover, because this is an issue of responsibility, and we need to teach people what to do in a coordinated and programmed way, thus allowing people to make decisions about their health while being informed. So health education is a top priority of our country, comprising prevention and the measures of our country be those legal and health measures to prevent and promote health. So what could we do to influence the behavior of children? According to the social ecological model, what influences the behavior of people is the person itself, depending on the age and the education level, then the family, then the school, and the society and the culture. School age constitutes the ideal period to lay the foundations for certain behaviors, because at the elementary school, children start to know themselves, they are called upon to take decisions, and they shape their social psychological profile. Certain things are best taught at an early age, so we need to start early. The aim of this book is to be children friendly, and we need to make children familiar with the terms and the rules of the public health. We aim at training students and teachers, promoting interaction and reducing stress, which peaked over the past months. So these are some illustrations. I eat with my family when possible. I eat without looking at a screen. So through such illustrations, there are 80 pages in our book. I think the illustrations are excellent. So we offer examples and we offer explanations both for children and for their parents and their students. These are the contents. They are based on 5 chapters: a healthy diet, physical exercise, preventing accidents at school, at home, personal hygiene, and viruses and how to protect themselves or ourselves from them. So what did we want to actually cover? Let me tell you a few things about children obesity, which is a pandemic itself. More than 40 million children and teenagers are obese. The tendency to obesity has increased over the past years. Of course, we had less data in the past, but in 2016 we had more than 124 million obese children in Europe. Obesity is on the increase in countries of middle and lower incomes. And so it is on the rise, unfortunately, as a phenomenon. The consequences are disastrous for the early age, for children at an early age. 60% of obese children before teenage years will continue to be obese in their adulthood. These are the results of a meta-analysis of a study which comprised 103 studies with more than 500,000 children, and we see that our country ranks more than negative countries. Greece, Italy, Malta have the highest obesity rates in Europe. We have another unfortunate negative situation. We have a prevalence of severe obesity among primary school children. However, obesity is an illness we can prevent. According to the FZIN project, which is a program to promote health, we noticed a reduction of obesity. When children are informed about personal health diet and physical exercise, obesity and prevalence of obesity is reduced. How can we actually prevent it? With a healthy diet. Unfortunately, there is a trend to abandon healthy diet and the Mediterranean diet. The Mediterranean diet is associated with well-being. In Greece, 34% of children follow a Mediterranean diet. We know what the benefits of physical exercise are. 40%, however, of our children in Greece do not have sufficient physical exercise. So here are some images of daily physical exercise and healthy diet. Then the second chapter is about accident prevention. Accidents are a major issue of public health for children. They are the first death case, and accidents can be prevented with the information of the parents and teachers and the students, of course. At home, at school, in the car, a safe environment is a prerequisite for a healthy country. This is an example from our good book. I'm a clever child. I know how to keep the rules. I think whenever I don't know, I ask an adult so that I will live with safety and I will do the right thing. A few things about personal hygiene. It is important in order for children to become self-confident, and it allows children to acquire lifelong health habits. Children unfortunately die of illnesses that could have been prevented. Now, viruses and the children, we teach children what germs and viruses are, but we don't want to confuse or stress children, parents, or teachers. We simply want to educate them and teach them how to be safe. It's not just about providing information, it is about providing incentives and creating the conditions that will allow everybody to be educated. An effective intervention at schools may constitute the most important investment of a state to improve education and health in general. Thank you so much for your attention.
Thank you so much, Ms. Eleni Papahadzi. I fully understand that this manual is an effort of yours of equal access for all children to information which is proper to develop a personal hygiene and consequently enhance public health likewise. However, Mr. Vantarakis, this equal access in health-related issues is not always self-evident, nor should it be taken for granted. On the contrary, as you shall describe, access of people to health, illness and death sometimes, at the end of the day, it is an issue that still remains pending. Mr. Vantarakis, we'll have the floor straight away. Thank you. Well, first of all, allow me to tell you that we have a close cooperation with the 6th Health Region through this European project, which was run for the previous 3 years. I hope that shortly there will be a positive reply for the next European project that will be coordinated by the 6th Health Region. It will be about the main part that is child obesity. To understand how serious this is, we might focus on COVID right now. COVID will come to an end. There are serious issues of public health through prevention, that is, limiting down the age threshold, and of course creating some circumstances for equal access, we shall deliver. We delivered this project 3 months ago. We ended up with an activity that should be supported and should be implemented directly in our country. We have discussed about it many times. The 6th Health Region wants to undertake it as quickly as possible. Am I right? Yes, yes, of course. Apologies for taking this initiative, but I'm quite passionate to discuss about it. Well, this is an interactive initiative, so I understand. Inequalities, the issue of inequalities was quite intense within the pandemic. So inequalities might be obvious between countries. We also saw that in the European countries, imbalances in the framework of COVID. We see that in a country which is very different across its different points. One of the first issues that we should tackle is how we're going to record the different health problems in the country and see what inequalities are created so that we can approach them in financial terms, that is, not waste money in places that might not be needed or actions that might not be needed by these places. To do so, first of all, I should see inequalities in the population. Thus, we do suggest to create an observatory of inequalities. There is in Italy such an endeavor in North Italy. There is the Observatory of Inequalities. In the UK, it is quite intense. One observatory of inequalities that will record substantially the problems of the health-related issue amongst the population, the differences in the population. These differences, how should they be approached? The sixth health region, why? Why there? Why not in another health region? As a professor, I have been wondering, why should I approach Mr. Karvelis? Why should we form together this observatory in the framework of this project? Because this is the largest health region and it has the majority of inequalities. There are many differences in it. These differences should be approached and mitigated. If it becomes a good pilot, this observatory, then later on it can be a significant action for peace. Thus, this observatory will work in the cooperation of some academic branch, which is not innovative, as I describe it. This is being done in Europe. So our model is all about good practices. The actions of this observatory, mainly, which is very important, will be to collect, process qualitative and quantitative data, systematic research when it comes to the access to health, systematic record of problems and tackling obstacles, support of different institutions for issues related to access to health institutions, political proposals towards the Ministry of Health, because politics will be led by data which shall be real, not data by Eurostat. Why am I saying so? Because this data will be fixed. As conditions change, either we're related to COVID or anything else, this data will be given a feedback, and thus there will be a foundation so that we can form good practices. The different activities, how the following organization and update of indicators. Let me give you an example here. In the framework of this project, we've been one of the few countries with no indicators, not because we don't want to, not because we lack the know-how or the economics, because diachronically, as in the past, we were never interested in indicators. That is, let us see, what are the indicators? There are indicators collected by the sixth health region. All health regions might have indicators. But when we form an observatory, this is a prerequisite to take measures. I keep saying that in my master's degree where I teach, we need data to get to specific measures. Beneficiaries, of course, first of all, the vulnerable, hence the decrease of inequalities through the observatory, and of course, the vulnerable geographically. Let me give you an example with the sixth health region, and I keep on talking about the sixth health region because we joined forces. Yes, we are in close cooperation from scratch, and we delivered a lot. I think that we had presented that in last year's conference. We shall continue the footprint of the previous year. Yes, because there is another issue, there is a huge imbalance, that is access to mental health problems in the population, in the elderly, who are in remote areas. What are they doing? Do they have a psychiatrist? No. Can we send a psychiatric unit, a mobile one? Will anybody enter there, a psychiatric unit in a village? Because there is a stigma issue in Greece. What did we think with the sixth health region? In the framework of this project, we thought of training the Voithia στο σπίτι, assistance at home project. So, since populations are approached, there can be an added knowledge of an initial questionnaire. With this initial questionnaire, there can be an initial diagnosis, and later on, a psychiatrist or a unit might visit them. This decreases inequalities from scratch. Imagine these people to be able to help in the information of the observatory. In other words, it's not as difficult as we think. The sixth health region is a region with the biggest geographic coverage, so participating in the sanitary issues of our country, we can take a first step. I believe that the sixth health region is the best place, and of course, due to your will, due to the director and the whole team, we shall have the opportunity to build it. It's not costly. It is a matter of will and view. So target groups, you can see them here, all the vulnerable, disabled, mental health problems, elderly, disappointed people. We need support in public health related issues. So gradually stepping on that, recording the real conditions and not the ideal scenarios, we can take measures for the population that will be targeted, and in essence, they could provide the population with a sense, with a feeling that the state and the sixth region are close to them, even where they live. Thank you so much for your attention. Thank you indeed. Thank you, Mr. Verex. And with Mr. Vandarakis, and after his speech, after having listened to inequalities and access to health, many steps should be taken forward. Let us stay to the same topic. I would like to thank you all. And now let us talk to a person. You might step down. Thank you so much. You might step down. Thank you. Now, for the last 2 years, more than 2 years, we've been discussing about public health. I'm not pretty sure whether we have a full picture of what public health is. That is why we have with us the competent person, the Vice President of EOD, the National Organization of Public Health, Mr. George Panagiotakopoulos. Good morning, sir. Thank you so much for being here. Good morning, and I would like to thank you for this invitation, Mr. Lewis, personally, and his team. Prior to us starting, I would like to congratulate Mr. Vantarakis for his endeavor, which is impressive. I would like to thank you for your care. Publicly, I would like to deeply thank Mr. Giannis Karvelis, my dear friend, for his huge effort amidst pandemic. I don't mean to be kind. I'm quite truthful. At the beginning of the pandemic, our knowledge was decreased. We were trying to find a pace. When something happened within the Sixth Health region, we had the feeling of relief because we knew that Mr. Karvelis would solve any problem. Mr. Panagiotakopoulos, what is public health to you? Well, public health, huge chapter, which of course was highlighted, was enlightened through the opportunity of the pandemic. There is a book which I love. It's a bit pessimist, but it's quite meaningful. Schopenhauer, the word as a will and as a spectacle. If I have an extrapolation, I could argue that the pandemic could be seen as a bad scenario, but also as an opportunity. It had a dual side. On the one hand, an opportunity, the opportunity for self-awareness, self-reflection, and for self-criticism. The opportunity of the pandemic, we were all able to realize, not just with the specialists, the wider public, the journalists, and the ones responsible institutions, all were able to see what public health is. It's not just about care. Care is related to private doctors, to a hospital, to the health center. But public health is the health of the whole population, both when they are well or not, in order not to become sick, to alleviate any burden from hospitals and live in a prosperous way. This is a framework, it's a huge framework of public health, which surrounds us all. You talked about an effort of reflection. You gave us a feeling, you gave a personal tone, I would say. Public health, is it a personal matter? How is it different from personal responsibility on the personal health? Well, there are institutions for public health, the Ministry of Health, the National Organization of Public Health, which is a surveyed organization. We are surveyed by the Ministry of Health. The government overall has a major portfolio, which is health. There are different directorates of public health in different regions. And right now, even the health regions got some directorates. So in essence, there is a number of stakeholders which move within this field. And the big bet to us, to use some modern terms as a speaker, is cooperation and coordination of all these to deliver. And I imagine not mess each one with the other or overlapping, so gaps. You know that overlaps are a flaw for Greek administration. But I think that these things become better and better. The pandemics and crisis management is an exercise towards this direction, an exercise for institution, an exercise for people, because people have to work out. People have to get to infrastructure that they lacked before, so they can be more ready in view of the next crisis that they should tackle. In your view, you talked about the pandemic as an opportunity. It might sound weird, but what did the pandemic teach us about how we can tackle public health related diseases in Greece? The pandemic taught us a great deal of things. I cannot finish, and I cannot exhaust my list. Let me give you two or three examples to argue. Innovation. Mr. Vadarakis was here, one of the main pillars of the waste surveillance system, a network which was surveyed by AOV. It is an innovation. Few other countries with such a network. We have not made it public yet, but our small Greece is pioneering. We aspire that through such a network, in quite shortly, there will be indicators for many types of information and many different problems, not just on COVID, but for other infectious disease, polio, for instance, or resilience to antibiotics, toxic factors, the consumption of psychiatric drugs or narcotics, all these through waste. Here you are, there is an innovation that is under portas and will be established through the pandemic. First, then, rather, we realized something that we knew deep in our hearts, that there has always been a gap in primary healthcare sector. We have never taken that for real, and we have not dealt with that in a serious way as they are doing in Western Europe. Right now, there is a new bill tabled by the Ministry of Health, which aspires to cover this gap through the personal doctor institution and so on and so forth. Moreover, we saw an upgrade of hospitals. At the beginning of the pandemic, in a nutshell, we had 500 beds of ICU, which were tripled throughout the pandemic. And here we have Mr. Kotsiopoulos with us, the Secretary General, and I know his big effort towards this direction. So these are not few examples, and there is a plethora of many more towards the direction. We saw the gaps among all institutional efforts, and then there is a meticulous effort to cover these gaps, which were covered, not all of them, of course, because we can always do better, but there were some improvements which are very important, and we shall see them shortly. To you, is it the biggest obstacle to overcome, that is the implementation of effective public health-related politics? Is it mindset, obstacles of the system, flaws of the system? Well, you talked about mindset. Let me tell you. Mindset and attitude are important. Let me give you an example. One of the thorny issues in public health, but overall in health, is about resilient hospital infections. It is a problem that we have yearly. There was in the agenda of the specialists. Right now that we come to the end of the pandemic, these will emerge, and some measures should be taken. There are projects, there are programs and initiatives by AOV or by other institutions which are in the hospitals to contribute to the surveillance and the mitigation of the hospital infections. Is it so difficult? If you ask a student, a second-year student of the medical school, what should we do to decrease hospital infections, they will know the reply. Then why don't we implement it? Well, the reason is simple, because we must establish and promote the relevant mindset in the field. That is why there are these projects of surveillance and enhancement of hospitals, so that culture should be taken for granted, and in a mid-term situation we can see the fruits. Deaths from resilient infections, resilient intra-hospital germs is a yearly wound for our country. We have Mr. Karvelis with us, so I would like also your view, Mr. Karvelis. What do you think? Many things have been taken about the different pieces of the puzzle pertaining to the sixth health region. You have a multifaceted district Yes, because you're the director of a very particular region, mountainous regions, highlands, insular areas. When it comes to public health, what was the biggest obstacle to overcome, and where did you focus on in your region related to public health, of course? First of all, the sixth health region has many aspects. It is a multifaceted region. Basically, we should approach in different cases humans themselves. We should get as close as it gets to basics and see what should we do, take the thread from the beginning and create a safety net. And then we should also update people, prevent all bad scenarios to establish this whole endeavor named public health. Let me also tell you that it was not just about the organization of primary health care which should take place. We intervene through specific operational plans in the secondary healthcare, but also in the tertiary healthcare. As George said before, we tripled the ICUs. We tripled the beds in ICUs in the sixth region, as it happened throughout Greece. Moreover, let me tell you that we were concerned with specific issues so that we can control at any moment in specific areas what is the status of the epidemiologic burden, mainly in the gateways of our country. Because when we left the very narrow lockdown, this was a critical point we had to focus on. Let me also tell you that a significant factor, which is a novelty, George, is the lab of sampling and research that we have established here in the sixth health region in collaboration with the University of Patras, which constantly gives us new data pertaining to the qualitative characteristics of any positive samples spotted. Furthermore, let me also tell you that for the last 1.5 months, George, the sixth health region runs a European project adopted, approved by the Ministry of Health, especially on infections in hospitals. There is a research team having as a head a professor of the University of Patras, which right now is investigating in-depth issues which are related to infections, are related to pharmaceutical treatment, which is recommended to every patient. And quite shortly, there will be useful conclusions that will be available to the Ministry of Health so that we can take specific decisions on how we can tackle this specificity that is in hospital infections, which, why shouldn't we say so, many times can be lethal for some of the patients. In other words, we're doing our best to get close to the root cause of the problem and face exactly this problem. Okay, give the data to journalists because this is always useful. I'm talking here personally. You mentioned the individual, Mr. Karvelis, and Mr. Panagiotopoulos alluded to that. Public health. What portion of public health is related to personal responsibility? I would like the view of both. Let us start with Mr. Panagiotopoulos. So, what about personal responsibility? Thank you.
Well, this has been one of the positive things we learned from the pandemic because personal responsibility became apparent and we realized what we need to do as individuals, that it is not just about this type of responsibility. There is yet another concept that was brought into the fore, and this was solidarity, which is even more important than responsibility, because the pandemics and the public health crisis influence all of us. A poet said, when a person dies in somewhere in the world, well, the bell is also tolling for you as well. So, this is about personal responsibility indeed. During the pandemic, when we had to face diaspora cases, contagion cases, either domestic or in the working environment or in the social environment, well, what we tried to convey to all individuals was indeed the notion, the concept of personal responsibility. There were cases when people knew they were sick and they wouldn't take measures. They would go on circulating, moving freely. They would go to shops and they would pass it to other people, and then the state was called upon to correct it. So we tried to convey certain messages, and when not possible, we used certain oppressive, suppressive measures. I will never forget the close cooperation with the Greek police for cases where we had people who would move in stores, in sanitary hygiene areas, and they knew they were sick and they wouldn't take the necessary measures to protect themselves and the other people. This is the quintessence of public health, the personal responsibility of every one of us when we move around. Okay, Mr. Panagiotakopoulos, we spoke about the pandemic, we spoke about obesity and children obesity. We spoke about hospital infections. Are just these the only challenges that are alarming, or are there any other challenges? There are two more infections ante portas. The hepatitis, children hepatitis, and the virus of the apes. And the stakeholders, all parties involved in the field, are trying their best to avert their spread. Children hepatitis is not exactly a new virus. It is most likely a new type of it or a new condition of it. It is, however, the virus of the apes is a well-known virus which reappeared in European countries, and now through traveling we have the first case in Greece. It's not as contagious as COVID or as lethal as COVID, but it remains a very alarming factor in terms of public health. So, with the teachings and the learnings of COVID and the pandemic and the climate crisis that exacerbates pandemics, what are the main points of your plan for public health in the future? Well, the question is very general and it is multifaceted, but let me tell you something simple. For the hepatitis of children and the virus of the apes, we as the public health sector, I mean the system of surveillance, the laboratory tests, and so on and so forth, I mean, the whole system with the experience of the pandemic, we created it within a couple of days, and we knew because we were trained and we had the experience of COVID. There is something else, though, the international health regulation of WHO, which is a kind of agreement or pact between states so that they exchange information on perils, on menaces, So more information and more exchange of information is necessary. The international health regulation is a very important regulation, of crucial importance rather, for public health and public safety, and we all need to equally participate in it. And we all have to abide by the rules and the provisions rather of such resolution at an international level. And to sum up, if you had, what would be the main takeaways, the main messages rather, that we have learned, the main lessons that we have learned from the pandemic for the future pandemics and crises? The strengthening of the structures and the infrastructure in the field, cooperation, which is of overriding importance, so that we don't lose the potential and we fully utilize the possibilities, and then education of the population at a very early age, like Mrs. Papagantzi Panderakis said. We need to start at an early age. When people realize what is at stake and cooperate, and they cooperate, then you don't really need to convince them. You don't need to start from scratch. And we saw that during the pandemic. After a few months, we all learned our lesson, and society reacted better, because at the beginning we had a lot of resistance. Well, with all the things that we've seen and that we've been through over the past 2.5 years, there is knowledge and there is experience, both in the scientific community and in the population, general population. So I believe that we are more organized at all levels, starting from the personal responsibility and moving to the primary care, which is a pillar of major importance. We have all understood that primary care can be indeed a wall of protection, and that the ministry is trying to reshape and further strengthen primary health care. Our hospitals are fully organized, equipped and coordinated at a level of automation of all the things necessary from an administrative point of view, the nurses, the personnel, from every level and every person involved. So there is more organization and more structure. And I mean, everybody is important. Even freelancer physicians are important to promote prevention, because the healthcare system is about everybody and involves everybody. Thank you very, very much for your presence. Good morning, ladies and gentlemen. Again, we will continue this very interesting debate of ours on the lessons we've learned from the pandemic and on the new era opening up ahead of us. I have the pleasure of hosting Mrs. Mina Gaga, alternate Minister of Health, Mr. Ioannis Kotsiopoulos, General Secretary at Ministry of Health, and Mr. Karvelis, Administrator of a 6th Health Region. Well, we said that we've spoken about many things. How were hospitals organized? How were structures organized? What methods have been followed to organize this safety network for the pandemic and the population? Mr. Karvelis. Well, the pandemic over the past 2 years and a half, like you said correctly, has been a case study for the future, hygiene crisis, health crisis rather, in the future. Yes, and we aimed at an organization based on the primary health, then the secondary health level, and the tertiary health level. For the very first time, the primary health care embarked upon an unprecedented procedure. All health centers have been reinforced with personnel and with technical equipment, especially the health centers in the cities. We saw that we made sure that health centers could operate almost like hospitals for patients to avoid referring patients to hospitals. Then the organization of hospitals, third level, second level, and third level, was strengthened with intensive care units when necessary. We tripled the beds of intensive care units through and documented an updated plan tabled by the Ministry of Health. We've had lots of meetings. The Secretary General, Mr. Kotsiopoulos, right next to me, he was by our side constantly so that the plans designed were effective. And I need to also say that the primary healthcare system had to monitor patients who were ill but were not in need of hospitalization, but had to be monitored via the phone, so that we could have monitored the evolution of their illness. Freelancer physicians contributed significantly, and this is something we must not forget. And they were by our side. They would follow patients from their offices and through the primary healthcare system. So I will keep saying that the healthcare system is made of all professionals, health professionals, be those in the national system or private professionals. Well, the pandemic showed that we need a flexible system, a modern system promoting new technologies, utilizing new technologies, and so on and so forth. And so how can we achieve such a healthcare system? I'd like to take this opportunity to thank the newspaper, Peloponnesos newspaper. This is a better conjuncture. The pandemic has been reduced in a way, and this is an opportunity for us to think about our future organization. We have to organize our healthcare system better for the future. And what we understood, both in Greece and at a European level, is that healthcare systems need to be strengthened and they need to be sustainable and durable and resilient. So we need to find ways to fully utilize technology and digital solutions to create a better healthcare system. We have the recovery fund ahead of us, and we have the money, and we have the ideas, and we have the know-how, and we have the learnings of the pandemic. And so we already did that during the pandemic with the electronic meetings, the business intelligence tool of the Ministry of Health, and we could know how full the hospitals were, and we were in the position to design and to strategically design our steps. And so technology really helped us take the necessary decisions. Now, with the recovery fund, we have enough money, 350 million for digital solutions and technology, and more than 300 million to strengthen the equipment of our hospitals, devices, equipment, and the areas where the patients will be hospitalized, because it is of crucial importance to do such things. So we are shifting to modernization and high quality hospitalization. So we will use technology to have even more data, to build teams with doctors, and keep improving our healthcare system and transform the national system. So primary and secondary healthcare, I mean, they comprise many different aspects, and the national system, the national healthcare system, has to deal with emergencies and challenges, and of course, funding is an important opportunity. And Mrs. Gaga, what are the priorities and what are the obstacles that we need to see to? Thank you very much for the invitation. I believe that the crisis has taught us lots of things. It showed us that the national healthcare system is here, despite the problems of the past. However, to date in Greece, we didn't have indices in the past. Now we do have them, and we need a charter of health, a map of health. From the medical center of Inoussas or in Agrafa, we provide the healthcare needed in this remote area to deal with emergencies. And then if there is a need for further care, then we also see to the transition, to the transportation rather, from the specific healthcare center to the hospital. And the upgrading of structures is of crucial importance, because it is indeed of paramount importance for a patient to be in a room with a bathroom, with a toilet. There are three things we need in our national system. Cooperation. No one can do things alone. No one knows everything. So cooperation between the different specializations, cooperation between the various teams involved in the healthcare system, physicians, psychotherapists, nurses. Then, secondly, the respect for the patient. I do what I do for the patient, and not to, just because I have to do it. And then problem solving, respect, and cooperation. These are the major three things that we need. To date in Greece, planning is done by the different units, healthcare units. Then they submit their proposals to the ministry, and the final decisions are taken. At a certain point, we need to see how to connect all such things. I may not be able to have excellent orthopedical centers in every village, for example. We have to connect the services more effectively and create a network providing safety everywhere and to everybody, providing healthcare everywhere and to everybody. Referring people when necessary, telling people what to eat, providing psychological support, and so on and so forth. And education is also lies in the very heart of all such approaches. We need to change the objective of education. To us, it is very, very important to deal with emergencies. It's very important to know that first aid will be effective and efficient. And this is very, very important, a very important challenge. And we create emergency units now. So the basic things are emergency units that are effective and good and proper hospitalization conditions. These are the main two things that will be funded through the Recovery Fund. And we have telemedicine, which is also very, very important. Because, for example, we have a new doctor needing help via telemedicine. He can contact major hospitals and get help. Thank you very much.
Mr. Carvelli is a totally different NHS than the one we've heard. In this puzzle of sixth health region, how can we implement all that? What about things? Are you doing things? What are the tools used? What are the challenges to have the hospitals of this health region to work in such a way described by the minister? Well, look, let us be truthful. Let us not beautify things. There are issues with the staffing of the HR in some hospitals, mainly at the regional level. But these should be tackled, these should be covered. The plan implemented, the one that we are still implementing, based on what the minister has just said, what are we doing? We enhanced all hospitals, mainly the regional ones, when it comes to the medical and technological equipment. We want them to be as organized as possible, mainly the ones in islands, when it comes to tackling a problem at that exact moment. Then, in spite of the effort made by the Ministry of Health, with continuous tenders for permanent personnel, since right now we haven't fully encountered the issue of staffing, we have created a framework of clusters with metropolitan hospitals of the 6th Health region, with main pillars being the Hospital University of Rio, but also the University of Ioan in so that we can offer to all our doctors in the small regional hospitals the scientific coverage when needed. No smaller hospital rather is left alone. There is a metropolitan above it, and I should say that there will be the scientific safety needed to tackle a case, but also through the National Coordination Center, there will be a transfer of a patient when needed, so that this patient may visit a bigger hospital, either at the second or at the third level. So there is the cooperation also of the private sector. We talked about freelancers, but broadly speaking, what about synergies? Synergies, are they extended for some other parts of the private sector? Well, look, to us, we want to enhance it even further. Yet, let me tell you that there were freelance doctors who partnered with an NHS. There were direct contracts with them. They helped. Allow me to give you a characteristic example that was carved in my memory. A freelance doctor, a pneumonologist in Agrinio, was the one who, during the pandemic, were responsible for the whole pneumology clinic of the hospital, but also assisted with the ICU. He is a person who impressed me for real. This example should be multiplied. Yes, the hospital of Agrinio was a bit troublesome. Let me stay to cooperation, especially between public and private sector. This was deeply highlighted amidst the pandemic. How was this cooperation highlighted, Mr. Tsipoulos? How can this become better? We have been listening about PPPs, public and private partnerships. Well, what was highlighted amidst the pandemic was that there must be a central planning from the state, from the Ministry of Health. I think that this was highlighted by the minister. Nobody may work in an autonomous way. This was one of the things that helped us a lot during the pandemic. The fact that there was a central planning, some measures were implemented in the hospital through a central administration that was monitoring daily. In this central planning, necessarily, we should have thought that we could use all our forces to tackle such a phenomenon like the COVID pandemic. So, in our operational plan, we included individuals, rehab centers, freelancers. Everybody joined the game of the central plan of the Ministry of Health. Yet there was a Ministry of Health which defined what everybody should do. Thus, we could coordinate, and there was a framework of a clear collaboration. We implemented that, it turned into practice, and many hospitals were assisted by the fact that we could forge these partnerships. Let me remind you that Erikos Dinan was the biggest private hospital that during the crisis was alert along with public hospitals successfully. We should congratulate the director of the first health region, who was the coordinator, Mr. Stathis, but also all the different executives who made that a reality. What does this mean? We had new different ways for a partnership between the public and the private sector. Quite successfully, we can use the pandemic for such a success, not just in health services, maybe in the construction and the real estate sectors. The new hospital of Thessaloniki will follow the PPP example. We shall collaborate with the private sector to build the biggest oncological hospital in northern Greece, following the latest technical prerequisites, of course. We can also partner with the private sector in many other things when it comes to research and technology through clinical trials. We have been working that intensively in the ministry, and quite shortly you shall see improvements in how clinical trials work in the hospitals. Already we were able to see that through research and technology we got a vaccine which was recently available for the public. I'm talking about COVID. The field of cooperation, not only should it get broader, we must break taboos and bias. We've already done so. We have all understood that this partnership gave solutions where there was none. And this partnership model, in my view, it is a new model that we want to see becoming operational in the next months. Partnership with the private sector across all spectrum, which may give solutions. This sounds quite interesting and aspiring. I have one question. Do we help ourselves or not? An obstacle, why am I saying so? An obstacle, I don't know whether this has been overcome, is related to the interconnection of hospitals electronically, how systems speak one to each other in the framework done for the development of the personal folder. These structural problems, have they been resolved? To talk about the remodeling of the significant part that is clinical trials? Well, the real, the real problem when we go to a hospital with a bag of exams, then yes, there should be interoperability. In the health folder designed with the Ministry of Digital Governance, these questions will be solved as the National Health Folder will allow for all systems in the hospitals that will be upgraded through the RF to be interoperable with the national folder and work one to each other. What does this mean practically? When we go to a hospital, our exams will follow. So no need to repeat MRIs, CTUs, blood tests. All these will be with us in our health folder, and our doctors will have that available when we visit a health unit. They can see our record. It has been described in the proposal tabled. We are moving forward in order to take the next steps, like the ones of the clinical trials, which of course need more mature digital infrastructure, but we have taken this pathway. For all that to be operational, I understand that the leadership of the ministry has highlighted the importance of evaluation of the health system. And I would like to ask the minister about it. In what way do you think that the evaluation framework will contribute substantially to the improvement of the system itself and also to the journey of the patient within the NHS? A very good question. I think that it is very important, and the other two speakers talked about it. Mr. Carvelis mainly, we need data for each hospital, for each health structure. It is different when we have a hospital that works 3,500 interventions in orthopedics, 5 doctors, and each one 10 interventions daily. It's a totally different way. The results are good. If people do recover shortly, this is data that we must have at our disposal so that we will be able to see what are the points, what are the clinics, the hospitals that work pretty well, and then we also need education. What are the hospitals that should be supported even further? We must see all flaws and problems now. When it comes to the electronic reality, already Pachni and Evangelismos, two Evangelismos may deliver exams, may deliver tests electronically. We have just announced it with Evangelismos. It's pretty important because we didn't have that up to now. And shortly, all hospitals will follow. Already great with Kechechni does perform all that electronically. We can have data straight away so that we can tell where we can assist, where can we deliver, thus we can see our strong and weak points. This is very, very important in my view. So we need data, and then we also need a second thing, which is partnership. That is, if I am on an island that has a small cardiologic clinic, maybe understaffed, we can have a link with a big center, LPs, for instance, or a center that might assist me either to perform the same job in my hospital if trained, or have the possibility to give directions, to give instructions. Very important for young doctors, many of the ones who go to smaller hospitals, to have this interconnection. For telemedicine, we can deliver, and this is very important. So evaluation helps us. Evaluation helps us on the one hand for the employees of the NHS to become better, and on the other hand, improve infrastructure, and patients should have the best result. Evaluation, will it mean also impact and influence? Does this mean that we need to wipe out the flaws of the NHS? Will there be this kind of intervention? Well, let me tell you, if somebody delivers, then this person should enjoy more benefits. Already, it happens with people working more for the NHS. We give them other possibilities of employability and at the financial level. Moreover, there must be a sanction if a person does not deliver. I think that this is the model to follow, and thus we can have a brighter future for all. I imagine that all of us, when we do work a lot, we need to see a better understanding of something more. And yet, if others do not work, this is troublesome. This annoys us, and we must bring back to the framework, this person who doesn't work. What about the patients? Will they have a say? Yes, because the majority of teams within the Health Council do play a key role. We are with the minister in different patient associations. They can get into the consultation process of drugs. It's always important how patients feel. The end user, the end recipient of the NHS is the patient. If we skip them, this would be an error. And I would like all three of you a final question, because we're running out of time, says the moderator, starting from Mr. Carvelis. We've been through many things lately, and in your view, if you were to prioritize in one or two things, what would this be? Well, look, having said that, and understanding what has happened, what was unprecedented to us, I believe that there is knowledge and experience. There is also planning, organization coming from the political leadership of the Ministry of Health to tackle any added sanitary crisis. My personal view is that we should start and focus on the basics. What do you mean by that? Primary healthcare. I believe that this is something to be adopted by the Greek government and the Ministry of Health through the new bill on personal doctor. We shall fight so that there can be the proper update, the proper training of our staff in the primary healthcare sector, but also we must continue what we have started, at least at the level of the 6th health region, that is the enhancement of our health centers when it comes to medical equipment. It is very important. Let me tell you an example about Patras. We have a health center in Patras in the northern sector, which is fully equipped with modern tools and machines needed by somebody, so that there all lab tests can be performed, and of course there are all different specialties needed to face at the primary healthcare level a patient. I would argue that the soundness of this center is such that it could also offer a coverage at the secondary level. At this level, especially for urban-like health centers, there is where we must focus on. We should struggle for a new or vis-a-vis a new crisis that might come to us. Mr. Kotsikopoulos, same question. I think that we are in front of the biggest project ever undertaken by the Greek government, which is the RRF. It's a big project that we have a duty to absorb quickly. When it comes to healthcare services, where I'm the head, that is the secondary healthcare sector, it is very important we do have the amounts allocated to projects that could be understood by people. Already we have enhanced many projects throughout the country. We have doubled the ICUs. There is medical equipment either from own resources or donations. However, money ahead to be used from the RRF is too much, and we must do our best to absorb that money as quickly as possible. So through our strategy, through our vision, we shall be able to use this money to build something much better, more sustainable, more resilient, so that it can be ready for future crises, maybe. Ms. Gaga, well, let me tell you, the RF is a very good opportunity, but our main capital lies within the HR. I believe that we should turn to people. Let me tell you something else. The whole government altogether, starting from Niki Kerameos with volunteers at schools. It is very important what a cooperative spirit we have. I came back from Israel. I was jealous of what they have managed there. Their state started in 1948, but indeed their quite advanced compared to us because they work together. One of our main problems in this health region, but also in the fourth one, Thessaloniki, the problem lies within the lack of specialties in medicine. We have very few anesthesiologists, and there are some structures that have many small hospitals with 11 anesthesiologists or private hospitals with 26, and big hospitals like Hippocratio in Thessaloniki with 7 or 8. Karamadhanio here. This week there was the problem that we all know. We might solve it as a government up to an extent, but what we mainly need is a culture of partnership. I don't like orders. I don't like speaking ex cathedra, but I believe that each one of us, how should I put it, says the speaker, we should follow a specific mindset. We must be open to collaboration and helpful to others. Doctors right now in the NHS, they had to face the crisis of the pandemic, and they did face it. They get into the bed, so through fear, through difficulties, and they saw the patients. Now, in some specialties, we need more people. There is, in some hospitals, 1.5 radiologists. We have problems with radiologists or anesthesiologists. This is a culture that cannot be only solved through patchy works. We need a spirit of volunteers and a cooperative approach. We'll do whatever we can for education, training, retraining, reskilling, upskilling. It's a difficult moment after so many tiredness in the NHS because the effort is really huge. The final result was good. People were quite tired. However, we need people from exhausted people. I would like to deeply thank you, all three of you, for this very interesting discussion. And thank you for the very nice images for the next day of the NHS. We do hope that shortly we will get there. Thank you so much. Have a nice day. Thank you.
Hello, ladies and gentlemen. Welcome once again to this session touching upon health. The national healthcare system is gradually exiting a crisis, a pandemic, which has tested its resilience, but this situation can also constitute a starting point for a new era and for the achievement of the well-being of citizens. How can we utilize and valorize the lessons that we've learned from the pandemic? I'd like to give the floor to the Minister of Health, Mr. Thanasis Plevris, for him to talk to us about all such issues, about the future of healthcare in Greece. Good morning, ladies and gentlemen. This is the first time I participate in the conference, and I'm very impressed. I knew about it, but now I am here for the first time, and I'd like to congratulate the organizers for the high level of organization and the interesting themes you're touching upon. Well, the pandemic is not yet over. However, following 10 years of crisis of the national healthcare system because of the memoranda and the pandemic, we now know what the things that we need to do for the public health. We need to start by accepting that we have to see healthcare in a holistic manner. What has happened in our country for decades was that we would deal with healthcare in a fragmented way, and we would do certain things in one sector without taking into account the consequences it could have on other sectors. We could pay a lot for therapies, for example, but we wouldn't pay a lot for prevention. So, a policy that would lead to higher funds for prevention, in the long run, it would also positively influence the fields of therapy as well. So, following the pandemic, we need to see what are the necessary interventions in the short and in the long run. What we are now starting, and this has been a very important pillar that has been legislated about the primary healthcare sector, was to try to keep citizens healthy. The Prime Minister presented the other day the Fofi Genimata project for breast cancer prevention. And this is and prevention is inextricably linked with healthcare, and it is of primary importance. There are certain things in the recovery funds, certain projects in the recovery funds that we wanted to try to extend even beyond the recovery fund, because the most important thing about prevention is that we need to guarantee that it will go on, that it will be constant and timeless in a way. So we will start with 4 main exams of prevention: breast cancer, uterus cancer, colon cancer, and cardiovascular diseases. And the beneficiaries will be 1,300,000 people for breast cancer and up to 2.5 million for the other categories. There has been a debate recently that shows the distorted image that we have for health. Even people who work in the field of health, when they hear public health, they feel that it has to do with the management of the national healthcare infrastructures and structures. No, it addresses the citizens. There had been a debate about breast, mammography, whether it is compensated or not. Well, it is, and I mean, want healthy citizens to take an exam, to take exams as well, and to do tests as well. We want them to. We want to have a full image, a full idea of the epidemiological situation, and everything, all things are interconnected. There has been a debate on digital technology. Digital technology is indeed essential, but it needs data. So, with prevention and with the data, we gradually start shaping an updated and documented patient file. And this is very important because you spoke about a journey. It's not just about a journey. The journey is about something pleasant, usually. It's like an itinerary because every patient has to find out what to do. There is no guidance to date. I mean, healthcare should not be based on the initiative of each one of us. It should be something organized, something that is seen in a holistic manner. Okay, we know a doctor. We call the doctor, regardless of his specialization. We tell him our symptoms. He will try to guide us and refer us eventually. And this is how the itinerary starts. And what is the role of the country? To guide the citizen. So the data of prevention are of paramount importance, and we have to have physicians of reference, and this is a very important step in the reform of the national healthcare system. So we say that the general family physician will be the first point of reference and the first contact for the citizen. Have there been any efforts towards this direction? Yes, but efforts and reforms are judged on the basis of their results. And the results will show whether we have been successful or not. In 2014 and in 2017, the efforts did not succeed. When we had 1,900 general physicians in 2017, and then they were reduced to 900. Well, this is an indication of failure. But why do we feel that this time we're going to succeed? Because we are not obliged to do that today. We believe that there needs to be a general physician, family physician as a point of reference for free. And since we've spoken about inequalities, the vulnerable groups of our society will benefit from it, because the people who can pay for health, and we pay a lot of money for health, 35% from the pockets and the wallets of the patients. I mean, the person who will pay for health will find their way out. But what about the ones who can't pay? So we mainly address people who can't pay. And because they can't pay, they have learned that because they don't have a point of reference, they need to go to the emergency units. And 15% of, or rather a large percent of people who go to emergency units shouldn't go to emergency units and shouldn't stay there to wait there for like 4 hours for an answer. And the nurses and the doctors in emergency care are there to deal with emergency situations. So we believe that it is going to succeed because we are determined to invest and pay the doctors. We will have ministerial decrees in the coming week, very realistic, very detailed. And how many general physicians for families we have? Well, how much do they get? Are they paid 2,000 euros regardless of the number of patients that they receive? I mean, this is not a solution. But when I know that I will be paid for every case that I will be dealing with, then I will be more active. And so we give the opportunity to certain people to earn up to 60,000 euros per year, and without being exhausted, without feeling exhausted, because the doctors who will have few patients will be paid, and the program will be realistic. If a doctor will have 2,000 patients, it will be more demanding, but the money will be more. And then we have the structures of the primary health care, and with the recovery fund and 250 million years, we will support them at every level, and we're going to have an integrated system of primary health care with the structures, with the necessary equipment, We have sent a questionnaire, and we are expecting the answers for 150 health centers that will be integrated into the recovery fund. And so this is how we're going to move onward. So the prevention exams and the first type, the first form of the digital file of the patient, and we will have an idea of a healthy citizens as well. They will also have a digital file, because this will help us in the field of prevention. We rank first or second in children obesity, and this is an indication that such children will have problems as adults as well, and they will burden the healthcare system. And so we're trying to focus on the issue. So we believe that we are building a framework within which the private sector plays a crucial role, and the public sector, of course. And this is where the distortion lies, and this is where the conflict lies. The public sector is not necessarily a state sector. The good of public health needs to be guaranteed. Now, whether this good will be guaranteed by a state structure or by a private structure, when the patient doesn't need to pay, well, this is how we serve this important national good. So we have primary health care now because we have private structures and the clawback and so on and so forth. So we want a holistic method, a holistic approach, and this is why with the recent draft bill, we gave the opportunity to have cooperation between the private and the public sector without clawback rebate and so on and so forth, but we tried to facilitate the process. And here, and let us now see the role of the AOP, of and we reach the very heart of the national healthcare system. And the alternate health minister has visited more than 80% of hospitals. Yannis Kotsiopoulos as the general secretary with Yannis Karvelis, and they have shouldered all the burden of the design and the planning for the pandemic, and we reached the very heart of everything. The national healthcare system, like Mina said, is mainly people and then funds and resources. The resources and the funds are guaranteed 350 million for infrastructure, 220 million for digital upgrade. So we have the funds for the national healthcare, and we are already starting at the ministry to try to allocate in a targeted manner these funds. But the map, the health map, the health chart is the other issue. It's not just it's about restructuring services for services to meet the needs of the citizens. Because it's not just about nurses or pharmacists or the pharmaceutical industry. It's about the patient. So this map of health map or health chart, it needs to be created on the basis of the needs of the patients. And when the patients and when the citizens rather understand that the structures and the infrastructure, the health structures are being strengthened, they're going to embrace and to accept and to welcome all such changes. No structures will close. And the human beings, the people are a very important, a very crucial step. Wherever we go, wherever we go. And I see many friends present here today. We have some very elegantly dressed friends here today. Anyway, people, members of the parliament, mayors, we always talk about what we like, about our gaps. When the health chart, the health map will be created on the basis of the people, well, the people will be when and where needed. But this has to do with incentives. Because the nurses and the doctors are not paid the way they should, and this is why the national healthcare system is not attractive, and they go abroad or they choose to work in the private sector. So we need to change that. But interventions, it's not just about doubling the payroll or the wage, the income rather, of a doctor, because if the proposal of the opposition is just about money, it's not just about that. It's also about the realistic resilience and the limits of an economy, because regardless of the money that you're going to pay, it may never be sufficient. Of course, you need incentives, growth incentives, financial incentives. And the alternate minister of health, they all spoke about the interventions needed, and at a certain point, yes, we need to talk about labor relations as well. This shouldn't be a taboo. We started with the primary health care, and we gave the possibility for evening surgeries and operations. And this is to the benefit of the patients, because you guarantee the necessary quality in the morning operations, and then you provide an alternative, a more economical alternative in the evening, and you thus allowing doctors to increase their income. So we started with the idea to use private doctors at the national healthcare system, which was a difficult equation. It started in the pandemic. But if this happens in a more legislated way, then the results will be better. And then doctors of the national healthcare system should have more possibilities. And we can tell the doctors, this is the money we can pay you, but you can have other alternatives and other possibilities, and you can earn more money if you wish. So we have, we have to shift to a new era, to strengthen the national healthcare system and to have a more holistic approach. When I have islands where doctors choose to be private doctors because the national healthcare system is not attractive, we can't possibly not pay attention to this issue. So we have to give such people the possibility to have more alternatives, and we have to make the national healthcare system more attractive for private doctors, with evening surgeries, with contracts with private doctors, with part-time work. Gradually, with gradual steps, we can move towards the next day. We can make this transition. And Mr. Yannis Kotsiopoulos and myself, and with Mina, these are. We can't close our eyes to certain things. we are at a crossroads, and the pandemic showed what the role we should play is. But certain people read things differently. Some people believe that because the national healthcare system supported the whole pandemic system, we need to eliminate everything else and only rely on public health. Some other people believe that synergies should begin. It's high time synergies were launched and started. We're here to shift to the next day. We're not going to reinvent the wheel. We will start from prevention. We will pass to a structured primary healthcare system with the doctors and the structures as protagonists. Then the national healthcare system, which will be supported with funds and with incentives, providing incentives and opportunities to the doctors, both those in the system and out of the system. We digitalize all such procedures to achieve a full coverage. This will be the new era. So I'd like to take the opportunity to thank the doctors and the nurses who worked in the national healthcare system. And many believe that it wouldn't have made it. And there were doctors who said, we're going to be intubate people in parkings or in parks. Yes, we had some people like that outside intensive care units, but we saw to the appropriate therapy. Of course, we went beyond the limits. Of course. But the national healthcare system made it. And if we had to go back, and there was a lot of fear about the resilience of the national healthcare system, but it was supported with 12,000 people. The intensive care beds were doubled, but the big thank you goes to the doctors, of course, and to the minister, to Mina, to Zoe, to Yanis, to Maris, in the Irini. Well, we are all ready to lay the foundations so that we will have a primary care and a national healthcare system as they should be, the ones that we deserve and that our citizens deserve. Thank you very much.
Hello, good morning once again. Welcome to the Regional Growth Conference 2022 and this section related to health. Having heard about public health, different infrastructure and primary health care, it's high time we touched upon another piece that indeed was deeply touched throughout the pandemic. Literally, some more, others less, but everybody, we had to tackle our own anxiety, our own fears. These years of the pandemic, everything became bigger. Now, mental calmness and balance, inner balance, was a stormy journey, but there is a way out. There are tools, there are ways to exit that, there are methods. Next speaker is going to elaborate on that. Dr. Achaia Grigoris is an author, a bestseller author, #1 Amazon best-selling book, 7 Paths to Lasting Happiness and 7 Keys to Navigating a Crisis, your second book. These pathways, these keys will be developed here in the next minute. And of course, I'm looking forward to your speech, a very useful speech. Thank you. Thank you very much. Please come forth because we are not so many. First of all, I would like to tell you that to me, it is very touching the fact that I talk live before a Greek audience. I left Greece when I was a small child. I didn't even go here in Greece at elementary school. We went to the US. I deliver speeches throughout the world. And the second time I speak in Greece live. The first one was the other day in Athens at a Hellenic Customer Service Conference. Patras to me is something very, very important because my family comes from Galaxidi. They are very close and they came from there directly. We are neighbors, practically. Now I will switch it to English and I will deliver the speech in English to the speaker.
When the pandemic hit, early on in the United States, I had a very strong impression, I would say, that I needed to write a book about the pandemic, and I needed to write it down now because I felt there's going to be a mental health crisis soon after the pandemic hit. And the prompting that I got was very specific. It was, you got to get this book out in 45 days. Just to put it into perspective, the first book, 7 Paths to Lasting Happiness, took me 4 years to write. So getting a book out in 45 days, ridiculous, right? But luckily, I called my best friend, who's also Patrinos, he's from here, Konstantinos Apostolopoulos, and I said, my brother, I'm writing a book about the pandemic. I'm starting tomorrow. We got to get out in 45 days. I need your help. I can't do it by myself. And thankfully, he said, I'm in. And for the next 45 days, we sat down and we wrote this book. And it was the first book to market in the entire world, specifically about the pandemic. And as the world has faced a multitude of crises, obviously COVID-19, the mental health crisis that soon came after, just if you listen to the United Nations, we have truly billions of people with a B suffering from depression, anxiety, stress, post-traumatic stress disorder, and so on. And then, of course, you add the financial, initially so many people who lost their jobs, were unemployed or underemployed, or just feeling financially insecure. And if you bring it now to 2022, we have inflation that we haven't seen in at least 40 years. Everything is much more expensive, electricity, gas, and so on. Another crisis, and then you add into it the geopolitical crisis that's happening, obviously, right next door here in Europe with Ukraine and Russia. So human beings are very resilient. We can handle 1 or 2 crises at the same time. We cannot handle multiple crises that never seem to end. And when I speak about those 4, international crises, I'm not even talking about people's personal crises, like maybe having a relationship issue, going through a divorce, taking care of a sick child, or an elderly parent that suffers from Alzheimer's. We're not even counting those, right? So that was the purpose of the book. And one of the things that we discovered was that when people deal with challenges in life or crisis, they typically fall into 4 categories. And the first one we like to call the victim. And the victim approaches this challenge and the crisis by saying, why is this happening to me? Like, poor me, as if it's only happening to them and not 7 billion other people, right? It's all about me. They get down, they get depressed, they get sad, right? The second one is the critic. And the critic, of course, they get mad, they get frustrated, they're angry all the time. And that's how they reflect back when they face a challenge. And I'll give you a silly example. Ilya, you should wear a mask. Well, that's stupid. Criticizing it. Okay, Ilya, never wear a mask. What are you trying to do, kill me? It doesn't matter which way they go. Their modus of operation is they always get mad, and that's how they deal with stuff. The third one is, we like to call the bystander. And the bystander is, mind you, a decent fellow or person, but they're so overwhelmed by the changes that are facing that they just don't know what to do. And they're scared. They're fearful, and they're frozen in fear. And of course, what all three of these personality types have in common is they don't offer a solution. Mm-hmm. They don't move the needle forward to some kind of resolution of anything. Either they feel sorry for themselves, they get mad, or they're frozen in fear. And then, of course, we have the fourth personality type, which we like to call the navigator, which is the whole premise of the book. And the call to action for all of us is to be navigators, right? But before I share with you what navigators do very well, and the first half of my career, I was a clinical psychologist in the United States, so this is my psychology hat wearing, that all four of those personality types exist within each human being. In other words, it's not like, well, I'm the navigator and you're the victim and you're the critic, and it's not like that. All of us have these personality types. It's normal for us to react that way. But here's the key ingredient. If I want to feel sorry for myself, poor me, let me feel those feelings, do it for half an hour, get it out of my system, and then move on and become a navigator, right? It's normal to get frustrated and angry from time to time. Let's say I'm angry with the government's response to the pandemic, whatever. It does me no good for me to stay angry and frustrated for 6 months and, just veins popping and my face turning red and all that stuff, because what does that do? It does nothing for the government or the entity, the World Health Organization, United, whatever. But it robs me of my own personal happiness and wellness, right? And the same thing with fear. So I want you to think about, even in your own personal lives, what is your first reaction when you face a challenge? Either a personal challenge or an international, global challenge like we've been facing the last few years. And what does it take to go from being either the victim, the critic, or the bystander to really pivoting and moving over and becoming a navigator? So what do navigators do very successfully? The first thing that they do is they practice great self-care. Αυτοφροντίδα, right? Great self-care, meaning that they take care of themselves physically, emotionally, mentally, and spiritually. And I will talk specifically about this topic when we do the workshop at 2 o'clock. How do we actually practice it? Not in theory, but in practicality. Αυτοφροντίδα, that kind of self-care. The second thing that they do is that they're in tune. They listen. Just like I was in tune to, you got to write a book and you got to get it out and you got to do it now. Listen to that still small voice, which means we have to get very quiet. Whether you call it your intuition, your higher self, whatever you call it, the spirit, I don't care what you call it, but pay attention to that voice. Because in my experience, I've been listening to that voice for at least the last 30, 35 years. Every time I've listened to it, then acted upon it, it's always worked out. But because I'm not a perfect human being, there have been plenty of times when I heard it and I ignored it, and I've always paid the price. that's how it is. So listen to that small voice. Now let's talk a little bit about resilience. Navigators are masters at flexibility and adaptability. And I will give you an example we like to use the example of the oak tree and the palm tree. So the oak tree, as you know, is this massive, big, tall tree, has been around for 100 years, right? Strong, majestic. But if there's enough rain and enough saturation on the ground and then enough wind, guess what happens to oak trees? They come crashing down on people, cars, homes. We have a hurricane season in Florida, every year. This is what happens to oak trees, right? Palm trees, on the other hand, which are kind of tropical and cute and adorable and finicky. At the peak of the storm, and now I want you to think about the storms of life. At the peak of the storm, the wind is howling, the rain is coming down, pouring. Palm trees bend, and they continue to bend. Sometimes they bend parallel to the ground. But when the storm passes and the sun comes out again, like every storm, including the pandemic, including, the financial storm, everything eventually does pass in life. Guess what happens to palm trees? They raise up and they survive. And not only do they survive, but they're actually stronger than they were before the challenge, before the storm, because the roots had to dig down deep into the ground to hold on for dear life. So I've shared, this story to audiences throughout the world, and people say, Dr. Elia, that's a cute story. I'll remember that. Be a palm tree, don't be an oak tree, blah, blah, blah. But they say, what does an oak tree look or sound like in human form? So this is an oak tree mentality. Well, that's how we've done things around here for the last 40 years. I'm not going to change now. This is who I am. That's it, right? And because they have that mentality, whether you're as an individual or as an organization, oak trees break and they come crashing down. So the call to action for us is to be flexible and adaptable. Let me go back to the 4 personality types and show you an example. When the first lockdown happened in March of 2021 or 2020? 2020. In 1 week, all my speaking engagements across the globe got canceled. All public speakers, email after email, in 1 week got canceled. So that my first initial reaction was, I was in shock. Like I was frozen in fear. I didn't know what to do. Like my whole world just collapsed, right? I was supposed to give a talk in Barcelona in October of 2020, and that got canceled. So I felt like the victim. I wanted to go to Spain. I wanted to go to Barcelona. Never been there. The conference happened, but it happened online, which I did it, but it's not the same thing as being in Barcelona and giving in a live audience, right? So I did feel like a victim for a while. And had I been critical of the government, even in the United States, the previous government anyway, of the initial handling of the pandemic? Absolutely, and I think rightly so, because they mishandled it initially. However, if I had stayed mad at that government for 6 months, I'm only robbing myself, like I said before, my happiness and wellness. So I decided to pivot to become a navigator. So I can't speak live anymore. Everything is shut down. I'm not a technical person. I didn't even know Zoom very well. I mean, I'd done 1 or 2, and now I'm a Zoom expert. And you know what the funny thing is? The last 2 years, as a result of becoming a navigator, and besides writing the book, I had no intentions to write a book that year. My plate was full. So I couldn't speak live, so I wrote a book. I couldn't speak live, but I decided to open up the platform and start working through Zoom. I probably spoke in front of 40 to 50,000 people. That would not have happened. I know speakers who stuck to their guns in an oak tree mentality and said, well, I'm a keynote speaker, I'm a big deal, and I only speak to live audiences. You know what happened to them? Their speaking practice is gone. Some of them, unfortunately and sadly, committed suicide because their whole professional career ended. So the key to life is to be flexible and adaptable and show that kind of resilience by being that way. The other thing that navigators, I think, do very well, they prepare for the challenge. They see things, they can feel things, and not only do they prepare, but they also move into action. Knowledge without education, knowledge without application is just education. Meaning that you and I can go out and read the top 10 books on happiness, bring them home, highlight them, underline them to death, and then when we're done, what do? We put them out on the bookshelf, never to read them again, of course, right? And now we know more about happiness and wellness, but we're not any happier than we were before because we're not doing anything differently. As a matter of fact, I think we're more frustrated because we have more knowledge now, but our life still sucks. I don't you know what I mean? So the key to life is not what we know. The key to success in life, what do we do with what we know, right? It's the application of everything that we do. It's not enough to say, I do this. And I have a program in the United States specifically for the healthcare industry, like the minister just spoke about, called Self-Care for Healthcare. For doctors, nurses, the true heroes of the pandemic that were on the front lines, a lot of them lost their own lives in trying to protect us and so on, right? And by their own admissions, nurses, doctors, hospital administrators, and so on, suffer from PTSD themselves. They know that they need therapy themselves, but they didn't have time to do it. And when I speak to those audiences, they're like, Dr. Elia, we like what you're saying. We know this stuff. It's not like we don't know. We just don't do it. because we're busy. We don't have the time to do it. And these doctors and nurses are completely burned out. At least in the United States, people are leaving the medical profession, I can't even tell you, because they're just they're done after 2 or 3 years. They have nothing left in the tank. And a big part of that is because they don't practice self-care. The other thing about navigators that they do very successfully, they have a positive attitude. Meaning that, yes, this pandemic has kicked our butts, basically. And humanity has been brought down to one knee, and it's been very hard. It's lasted much longer than anybody had expected. Every time we think we're out of it, we loosen, some of the control systems. There we go back again. And even myself as an expert, I was mistaken. I really thought this was going to be over fairly quickly when it originally happened. 6 months, it will be over. It's not going to be a big deal. So I've been mistaken several times. Every time I think we can finally relax, something else happens. And even though it seems like we're getting over the pandemic right now we have the inflation. Now we have the geopolitical stuff that are happening where you have an actual war, and even the talk of a nuclear war. I mean, if 4 or 5 months ago I told you there's potential of nuclear war, you would say, Leah, you've been watching too many science fiction movies. I mean, that's basically it, right? So there's a lot of insecurity and a lot of uncertainty in the world, from the financial to the health concerns, the geopolitical stuff. But navigators truly believe that no matter what happens, these too shall pass. In other words, they have the mentality that things in the end work out. And, Winston Churchill, a long time ago, said, you know what the difference between an optimist and a pessimist is? An optimist feels that there's a solution to every problem, like navigators do. A pessimist finds a problem in every solution. Exactly. And I'm sure, and I find that a lot in Greece. I mean, obviously, people say, you have a funny name, where you're from. I'm like 100% Greek. Like, I'm the greatest Greek ambassador in the United States. I mean, like, Greece all the way. However, we have to be honest with ourselves. Greeks like to criticize.
Yeah.
You can offer 3 solutions and they'll find 3 different problems with your solutions, right?
Or more.
Or more. Yeah, exactly. So, where navigators are like, no, there's always a solution if we just keep working it. And in a lot of ways, they're like the palm tree analogy that I used. Like, eventually we're going to rise above it. And, here we are, we're still standing. So as long as we're standing, we're doing good. The final thing about navigators and navigating a crisis has to do with kindness. And I know kindness is kind of a, what does this have to do with, navigating crisis and so on? I will tell you this, navigators, because they practice great self-care and their batteries are full, because they have learned how to take care of themselves specifically and consistently. I'm not going to go and exercise once and then I'll see you the Kabadavus, I'll exercise again in a month. No, they do it on a daily basis. They eat healthy and so on, right? So, because their batteries are full, they're able to offer kindness, love, and so on. And I'm a happiness expert. I mean, that's my expertise. And I can tell you that happiness and kindness are interrelated. First of all, happy people by nature, because their batteries help somebody else. But on the flip side, when we perform acts of kindness towards another human being, that makes us happy. Mm-hmm. There's something that happens to us innately. There are chemicals that are released in our brains which is a free drug, by the way. You don't have to buy it, doesn't cost anything, and you don't get arrested. You have a happy thought, then all of a sudden you're like, so I share with people, be kind to your fellow human beings. In the middle of the pandemic, doing television interviews in the United States and so on, I had some people that pushed back on that. And they actually said, well, Dr. Leah, it's nice for you to say that, but what am I, my brother's keeper? And I said, no, you're not your brother's keeper. And this was on Zoom. I got my face really close to the camera. I'm like, no, you're not your brother's keeper. You're your mother's keeper, and your sister's keeper, and your neighbor's keeper, and the homeless person down the street. Because in the end, we're all connected as brothers and sisters in this world, right? We're all, right? So that took care of like 90% of the sycophants, the critics, right? You can tell the critic personality immediately. You say something like they find something wrong with kindness. Who the hell finds something wrong with kindness? Like, what's wrong with them, right? But some of them said, well, you know what? I'm unemployed. I'm locked up in my apartment. I can't go anywhere. I can't help anybody. I don't have any money. So I'm relentless. Like, I push back again. I'm like, wrong again. if you listen to that still small voice inside, and this is a specific example, in April of 2020, when you guys had the first lockdown here, I'm living in Colorado, 10,000 miles away, and I got this prompting. I have a real good friend. Her name is Eleni, who lives here in Athens, educated in the United States with a PhD from USC. I went to UCLA. We're kind of rivals universities, but very dear friend. We've been friends for 40 years. And I got that prompting, Ilya, call Eleni. It was like midnight here in Greece, like we're 9 hours apart. And I called her up, and she says, why are you calling me? I said, I don't know. I just feel like I'm just checking in on you to see if you're okay. And she said, it's funny that you should call. This is what happens when you listen to that voice and you act on it. She said, I have asthma. Yeah, she has breathing issues. And this was at the very, very beginning. This is before the shots, but this was before everything else, right? She says, I had to leave my family and my kids, and I'm isolating in an apartment in Piraeus by myself. I've been here for 9 days. She said to me, have you ever been alone for 9 days where you haven't talked to another human being or touched another human being or hugged another human being? And I'm going to be here for at least the next month or 45 days. And honestly, I thought about it. I'm like, Eleni, I don't think that's ever happened to me, in all honesty. And which would be horrific. I'm an extrovert. I love to hug people and kiss and hug, very Greek, very animated, right? So I was very, very surprised by that. But she said to me afterwards, she said, thank you for checking in with me, right? I really appreciate that you thought and you reached out from across the Atlantic. Now, that is a very small act of, you could say, kindness, right? What did it cost me? Nothing. 5 minutes conversation, but how did it make Eleni feel, right? It made her feel like somebody cares about her, somebody's thinking about her. And these things happen all the time. Performing acts of kindness is not some grand thing that we have to spend tons of money and market everything and all that stuff. Is listen to your intuition, listen to that still small voice, and then take action. And if you do those things, there's a benefit for the receiver, but I think there's also a benefit for the giver.
Yeah, of course.
For us as well, right? Like I said, the chemicals are being released in our brains, and we're happy, and it's the freest drug, and it's the best drug in the world when we do something kind for somebody else. And that exists even in the middle of a pandemic, in the middle of a financial crisis, in the middle of geopolitical issues that we're facing right now, all this stuff, and even our own personal crisis, we can still help somebody else. All we have to do is look around. And if you can hear the sound of my voice, I guarantee you that you are better off than somebody else in your community. Maybe even in your extended family, in your neighborhoods, Gitonia, right? There's somebody else who really could use your help. And that's how we transform cultures, that's how we transform societies, that's how we transform the world, but more importantly, that's how we transform ourselves. So, a couple final thoughts. I know time is running out. People have said, Dr. Ilya, what is your biggest takeaway from the last 2 or 3 years of the pandemic and everything that has done to humanity? You know what it is? It's simple as this. Do not procrastinate your happiness. In other words, do not wait. We're all living in the future. When I'm in the right relationship, when I get married, when I have kids, when the kids grow up, when the kids get married, when I become a grandpa, when I get a raise, when I'm in the right job, when I'm retired, then, you know what? Forget all those things. Because there are no guarantees any one of us will be here next month. That's one of the beauties about the pandemic, actually. It's a gift. Because none of us know if we're going to be here next month. We could all be gone, right? So as a result of that, live your best life now. Don't procrastinate your happiness. And as a result, be an example to those around you. Practice great self-care. Like I said in the workshop, I'm going to go into that in great detail about what practicing self-care actually looks like, how we take care of ourselves physically, emotionally, mentally, and spiritually. And let's live our best lives now. We live in this amazing country. I know you guys take it for granted, and you criticize it all the time, but when you're outside for decades in another country and you look back, I have to tell you, even the way Greece responded to the pandemic from a governmental perspective and so on, se σύγκριση, if you compare it to how the United States did it, we did it so much better here in Greece. And I'm not bragging about Greece. I'm too old, I got gray hair. When I speak and I tell the truth, that's the truth. America totally mishandled it. Especially initially. I mean, we had over 1 million people that have died as a result of that. A lot of them that didn't need to happen. where Greece, I know the lockdown was hard. I mean, obviously I have family here and lots of friends and so on, but we did it better. So from time to time, it's actually good to say something positive about this country, to say positive about the government, and to say positive about one another. It's not going to kill anybody if there's a little bit of a, if this is the positive psychologist in me speaking, be a little bit positive. Thank you for your time, and it was great being here.
Thank you so much for this very interesting, excellent talk, Dr. Gourgouris. Thank you. Ευχαριστούμε πάρα πολύ.
Να είστε καλά.
Thank you, Dean. I wish you all the best. I have many questions. I believe that I will sneak into the workshop because I have many questions. The workshop is between 2 and 3. The other door, next to this room. It will be in Greek. It will be in Greek, and I would like us to have interaction because I like give and take. It was my pleasure. Thank you. Thank you. Have a nice day.
Γεια σας, hello, can you hear me? Αγγλικά, hello, hello, hello. Με ακούτε, με ακούτε? Hello, hello. Ελληνικά ή αγγλικά? Αγγλικά. Okay, hello, hello, hello. Can you hear me? Hello, hello, hello. Test, test, test. Ακούγομαι, ακούγομαι. Ακούγομαι, ακούγομαι, ακούγομαι. Ναι, ναι, ωραία, ωραία. Ελληνικά.
Εδώ το μικρόφωνο να κλείσουμε.
Good morning again. Good morning from Regional Growth Conference, and let us resume with a very interesting discussion, which I think that it will become an umbrella for the health-related policies in the future in Europe. A notion that has started being prominent in the public debate is well-being. In Greek, there is the proper translation. We translate it in Greek as prosperity equally, either in English or in Greek. This notion encapsulates a totality of factors affecting human experience and is in favor either to happiness or sadness. Health and mental health, one part only of this umbrella, and it is about the social structures, justice, our status. This is related to the environment as well in which we are living. This emerging and multifaceted approach will be discussed with the eminent speakers that we have in this panel, the MEP, Ms. Telis Kouperopoulos, Ms. Irina Calderon, who is Policy Officer, Policy Health Innovation Ecosystem, DG Connect, European Commission, Mrs. Lara Fleischer, Policy Analyst on Wellbeing, Data Insights and Policy Practice Unit, OECD, Dr. Evi Hatziandreou, Senior Global Director of Genesis Inc., Mrs. Christina Bikou, President of the Mental Health Association, and Mr. Dimitris Ballas, Professor of Economic Geography, Faculty of Spatial Sciences, University of Groningen of the Netherlands. This discussion will be on well-being, and this has been highlighted more and more within the European institutions and within the international fora. Let us start from what is general policies to be implemented, but let us set the framework. I will ask the assistant of Mr. Ballas, to what extent prosperity, the well-being of everyone, the happiness of everyone is affected by the social status and geography, because to some these might be incompatible notions. What allows us to be happy?
Thank you very much. I'd like to take this opportunity to congratulate the organizers on the organization of the conference. Thank you very much for the invitation. Though my mother tongue is Greek, I will switch to English because I prepared my speech in English. I'm used to speaking in English.
Say a few things about my background. I'm an economist by training. I studied in Thessaloniki at the University of Macedonia in economics, and then I moved into geography. And I'm a professor of economic geography at the University of Groningen, and economic geography engages with social and economic phenomena in space. And happiness and well-being is one of these phenomena, how we feel. A key question is, does it matter where we live, or is it just personal? There was an excellent keynote lecture just before this panel where there have been a lot of very fruitful thoughts for how we could live a good and happy life. But one of the questions that I didn't get a chance to ask was, does geography matter? Does where we live affect how we feel and why? And I'd like to joke at that point, I live in the Netherlands. The Netherlands is one of the happiest countries in Europe. And I like to joke that being an expert in happiness, I choose right. But is it why? Is it the weather in the Netherlands? Probably not. I'd like to say, just to address your question, we could look for things like other factors, environmental quality, but also social environment, the social weather, if you like, social cohesion, territorial cohesion. So the European Union, one of the key values is social and territorial cohesion. And I think there is increasing evidence suggesting that well-being and happiness and subjective happiness, mental health, is strongly affected by the inequalities at different levels. So in the keynote before our session, it was suggested that the sense of neighborhood, γειτονιά, what does this mean? How caring for each other, having a cohesion. And we can monitor these things. So we can monitor inequality at different levels, social and spatial inequalities, and consider what we have and the extent to which we engage in status symbol competition, doing more for the sake of it without thinking whether do I need another car, do I need more material goods, or is it interpersonal relationships? So my research agenda, and I think there's a lot of work in policy in recent years in regions and OECD has also been working on this, is to what extent geography matters. And we could argue that, of course, it matters in terms of the weather, as I said, environmental issues such as green parks, blue zones, and so on and so forth, but also social cohesion is key. So I think I would like to just close these opening remarks by saying that it will be very interesting to see what my co-panelists have to say about issues of determinants of well-being and happiness, and then we can link it to geographical determinants in the sense of the type of area we live in. If we live in an area where there is a lot of social exclusion, this is a bad social weather, if you like. It's bad for your well-being, even if you are well off. It's not a nice thing to see poverty and social exclusion. So we need to reconsider the agenda, social policy, and geographical dimensions of social policy.
Thank you so much. Ο ΣΑ το ανέφερε ο κύριος Μπάλλας, μελετά το well-being.
Spoke about Sata, who studies the well-being.
To well-being, with the purpose of generating data and approaches for the improvement of people's well-being, people's lives. Which are the main dimensions of well-being, and how can we measure them efficiently?
Yeah, thank you so much. Also from my side, echoing the thanks for the invitation and congrats for organizing this conference. So indeed, this panel is about well-being, and I think it's important just to take a step back and define this term, because many people use it very differently. Some people think about it in terms of individual wellness. Some people think it's only subjective well-being or happiness. The way the OECD thinks about well-being is as a very multidimensional construct of all the things that matter to people, kind of the key ingredients of a good life. And those are, by the way, also the things that when you ask people themselves, what matters to you, those are the things they list. So those are, their material conditions, if they have a job, if they have good housing, their income and wealth, but also quality of life factors, education, security, access to green space, environmental quality, and importantly, as you also said, this kind of social cohesion determinants. So how do we relate to others, to other people, but also to our institutions, and with whom and how do we spend our time? Obviously inequalities in all of those outcomes, and then also sustainability aspects. So, the well-being of the planet and the well-being of future generations also plays a role in that. So the OECD has developed a well-being framework, and actually many OECD countries themselves have followed. So today more than half of OECD countries have their own well-being initiatives that they use to monitor and assess well-being in this multidimensional way. The next step kind of on this agenda that we are also working on is to kind of take the next step to go from beyond, we know we're trying to define what is well-being, and then we're trying to gather frequent data on that. The next step now is to actually apply that to political decision-making. So how can such complex information be used to identify trade-offs between those different well-being outcomes, and what difference does that actually make? I'm happy to give a few examples on those, including relating to mental health. When it comes to mental health, we know that the healthcare system is important, and we need more investment there, but it's not the only thing. We know that people's social, environmental, relational, political experiences really matter for their mental health status as well. We have seen that in the pandemic. The groups whose mental health has been affected the worst, women, racial and ethnic minorities, young people, have been hit. Their well-being has been hit in other ways disproportionately as well. And any strategy for promoting good mental health or well-being would have to take those kind of well-being determinants or risk and resilience factors into account. And OECD countries have tried a few different ways. I'm going to keep them up for follow-up questions or the discussion in order to not overstep my time, but happy to share experiences. Thank you.
Thank you. Ωστόσο, αν δυσκολευόμαστε, γιατί μίλησε η κυρία Φλέσσερ για τις πολιτικές.
Mrs. Fleischer spoke about the policies, but if we find it difficult to apply, to implement policies of well-being and a better healthcare system. So, if we find it difficult to implement certain policies about the healthcare system, then it will probably be even more difficult to apply policies to promote the well-being. very much, Mrs. Arguridi. I'm very happy to be participating in this panel, and I'm very, very sorry I wasn't able to be there with you. Health issues have kept me here in Athens, but I'd like to take this opportunity to congratulate the organizers on this important organization, on this important event, which, to my mind, touches upon very important issues. We are talking about a very important subject, which is the well-being, which goes far beyond health. Health shouldn't be defined as the absence of a pathology, of an illness. I think I will use the example of Mr. Wurwuris, who spoke about the issue of the palm tree and of the oak tree. At a certain point, he said that the oak tree breaks. So we need to create a social safety net which will protect the oak tree so that it won't break, so that it won't break because there will be a safety net that will support it despite the strong winds. So in the field of self-care, we need to take into account what happens at a national level, at a European level, because human beings are social beings and they are part of systems, and the system needs to protect them. And we are witnessing an era, a period when there is a horizontal policy of the European Union. The European Union sets horizontal objectives. The Green Deal, for example, this is a major objective. The sustainable objectives, rather the objectives of sustainability and growth, they also include well-being. And these are issues that not only the European Union but the United Nations consider of crucial importance. And when we talk about well-being, we also refer to health issues and to growth rates and to a proper and effective sanitary framework and healthcare framework, the environment, equal opportunities, mental health, and many other things. And when we talk about labor issues, for example, the right to employment is important, is a main right. The right to minimum wage is an issue creating well-being. The issue of mental health in the labor environment, in the work environment, does increase the level of well-being. The system of housing, of home construction, of house construction, and is indeed an issue of well-being. So we see that the processes that are being launched currently are targeted, and we have targeted policies for well-being. We want an education, and we want an inclusive education, and inclusive schools comprising all citizens. We haven't yet achieved this objective, but we are trying to achieve this objective, and this is a major issue of well-being. And we've recently heard the Prime Minister mention the programs to protect our children, to protect them from becoming obese, because we unfortunately rank among the first countries in terms of obesity, and we have to deal with this problem to increase their level of well-being. So we need to approach matters in a holistic way. We do have this possibility now because our politicians and our policies move towards this direction.
Collaboration with regions. As it is well known, Europeans, we are an aging population. And with aging comes additional challenges for societies, for economies, for health systems, but also for people and their well-being. What are the bigger challenges we face, Ms. Lival, and are they common in every region? Guessing how.
Hello.
Okay, we can hear you. It's just you have a frozen image.
Yeah, I see that my video is frozen, but I'm happy that you can.
Well, we can hear you clearly. You can go ahead.
So, hello, and thank you for the invitation and for organizing this conference and also this particular session. Indeed, we in Europe, as you know very well, are facing a very big challenge of an aging population and of demographic change. And the consequences of it has been made quite also evident during this last crisis of COVID in the EU, but also all over the world, because demographic change is a challenge that is faced by population all over the world. And it has affected older people to a much greater extent in the EU and abroad. And with it, however, come another opportunities related to how we could use, for example, the digitalization of our societies to better promote health and care of individuals and to promote active and healthy aging and active and healthy living. And also in particular in regions, because as you rightly said, so aging affects regions in different ways, and in particular sparsely populated regions and areas tend to be older and to face a lack of health and care professionals and provision in general. So we in the European Commission promote the use of digital technologies for better provision of health and care and well-being, and also, of course, to improve mental health of older people, also in particular in regions through different partnerships, interregional partnerships, such as the European Innovation Partnership on Active and Healthy Aging, or the Active and Assisted Living, but also through the various current policies that are really standing ahead of us, such as how to promote better integrated care for individuals, how to promote better care for older population, but also for carers and also for children and young people, so that we could start the prevention of complex diseases from early on. You mentioned at the beginning that we are talking about well-being, and well-being is not a value itself for the individual, it's also a value for the whole society. And the European Commission adopted Council conclusions on the economy of well-being already 3 years ago, when Finland had the presidency of the Commission, to make sure that member states include a horizontal aspect of economy of well-being in all their policies, and take into account how well-being is important for the growth and sustainability, and also for productivity, of course. So, of course, there are quite a lot of challenges ahead of us, but we are planning a lot of different policies and funding mechanisms and programs on how to help regions also to collaborate together and exchange best practices on promoting active and healthy lives and active and healthy aging. And of course, if time would permit me, I would be happy to go deeper into that. Thank you.
Thank you so much. Ευημερία όμως χωρίς υγεία.
However, well-being without health is not a target we can achieve. So what does this mean? Mrs. Hadjiandreou is avoiding illness and having access to self-care, to healthcare systems. Do these suffice? And what is the relationship between health and well-being? Well, to begin with, thank you very much for the invitation to participate in such an exciting panel, which is about the future. With the slide I have prepared, I will help you visualize what we have been talking about. There is an inextricable link, interaction, interdependence, you name it, between health and well-being. Naturally, well-being is more than health, or health is more than well-being. Well-being is associated, Mr. Kipouropoulos spoke about it, with the interpretation we give to our health. It has to do with longevity. He said that he spoke about the social environment, social weather, the social weather and the social factor which is linked with productivity. And it is a much broader concept. Then let's see the social drivers that impact our health, that influence our health, from education to the neighborhood, to our working environment, to whether we are employed or not. Well, these are all interrelated. These are all integrated in the initiative of the United Nations for the 17 Sustainable Development Goals, one of which, number 3, is health. So the objective is healthy lives for everybody, not just well-being for everybody and for all age groups. So these are all interlinked. We have lots of policies, but let's try to be practical. I was informed yesterday that our country participates as a volunteer in the presentation of the objectives for the SDGs and health, more specifically. And we need to measure certain things to be able to know where we stand. And I'm very happy to see this shift in mentality in our country, in my country. So health is a fundamental pillar for well-being, but it's not just about health. I tried to visualize certain things. Health per se, care per se, is just one part of what health means, and it contributes to the level of health to a lower extent. 25%, 1/4 of the whole thing has to do with care and hospitals. 15% has to do with genetics and biology. The natural environment 10%, and then the remaining 50% has to do with socio-economic conditions. So we do see interdependence, and the policies that have been launched, and I'm very happy to have the OECD with us. They've done an excellent work, and the Better Life Index they have started creating for every country. We see the little trees. These are the countries members of the OECD, and where certain factors are being measured, and we can see where our country stands, also if compared to all other countries in terms of well-being. Well, we are participating in a regional conference, and maybe this could be done at the level of the regions in the future. And Scotland, for example, does that in a very specific way, utilizing very specific tools. So they do that at the level of the regions there. So maybe in the next round, I will be even more specific as to how new developments in technology and medicine will help us achieve such targets in health and well-being and healthcare. Another important pillar is mental health. We can't possibly be talking about well-being without mental health and mental balance. And we need strategies for mental health. Where shall we lay emphasis on, Mrs. Beku? Good evening. Thank you very much for the honor to participate in your panel and find myself among prominent scientists. I am a mother. I am a caregiver. I am a caregiver of a person with mental health issues. So I will share my experience as a caregiver, but I would dare say that most of us, when we experience 20 or 25 years, when we experience mental health issues in our homes, well, we are also beneficiaries, receivers rather, of services of mental care. I'm the president of the SOPSI of Patras, which is a very dynamic association, 300 participants. Up to 2018, we were funded by the Stavros Niarchos Foundation as a daycare center. Then the state trusted us, and we received the state funding. And I believe that in the future we will continue to have this daycare adult center. I would like to talk about 3 axes now. Firstly, I often wonder, Yannis Ritsos, the famous Greek poet, well, he wondered, how is it possible to understand the obscure mind of his dear sister Lula, for him to be able to understand and to read what is hidden in there, to understand her psychological pain and ordeal. Do you know what this means? You don't have the possibility to help these people, certain people. You don't know how to help them. Can you give them a painkiller? No. Psychological pain, mental pain doesn't go away like that. It is an ordeal. And psychiatrists know about it, and all therapeutic teams and groups and networks know that. I believe that prevention is essential for mental health. But what do I mean by prevention? I mean that from the kindergarten, even from the age of infants, parents and then teachers and then the university, they should be able to recognize, to trace, to identify the early signs of an illness, of a mental health problem. This will be the only way to avoid having chronic mentally ill adults. Why create constantly new mental health patients? We could prevent. Instead of having to find a therapy and intervene. And then another issue would be to create the possibility of a therapeutic community in a crisis at home, without having to put people into institutions. And this is something that takes place in our country up to 70%. This is absurd. In England, this is only 4 to 7%. You know, people who are taken to institutions, mental health institutions, on the order of a judge. And why is the rate that low in other countries? Because they have therapeutic communities at home. Then another axis has to do with social services. I believe we're lagging behind. There is no cohesion in our society. And public social services, I'm very sorry to say so, they stay until their working hours end, but mental health doesn't end at 2 or 3 o'clock in the afternoon. We're talking about 24 hours per day, 365 days per year. With the appropriate staffing and the level of staffing and the appropriate structures and infrastructure, we could have prevented 3 deaths of mentally ill people. There was a lady, a woman, who was dead for a month in her home, and the social worker who took care of her stated that, well, I called her, but she wouldn't answer. But a dead person can't answer the phone. And 2 brothers died alone in their home with a difference of 3 days. And the primary care, I mean, nobody cared to bury them. The neighbors buried them. And they were mentally ill. Then think about the suicides. The other day, a 20-year-old boy committed suicide. 3-4 people fell from the bridge of Rio Antirio. There are suicides all over Greece. We should try to thwart, to preempt such cases. All human beings are useful, be these people mentally ill. I mean, they should have equal opportunities and equal access to all services, and then the right to work, self-confidence, self-dignity, and the possibility to lead. To have to live on alone, because parents at a certain point, may die. So these people should be integrated into the majority society and into the labor market. The legislator has provided for the possibility to work, but no one hires people with mental health issues. Is it because of fear? Is it because of the stigma? Well, these are real problems in our country. Allow me to say that the dignity of human beings and the possibility for them to have a life and work and make ends meet and be able to smile because they prove that they can, that they are capable of doing things, that they are not useless. So I am sorry. Our society buries the souls of human beings. Instead of burying them when they should, they bury them much earlier, unfortunately. So I'd like to ask the people who are here listening to us and people who listen to us via streaming, well, mentally ill people are a highly emotional cell of our lives, and they deserve many things. They deserve to love, to be loved, to work, to move on. And I'm convinced they can do it. So please, let us all together try to accept them the way they are and give them the possibility to have what they are entitled to equal opportunities, justice, and dignity. Well, having heard Mrs. Biku, Mr. Ballas, I can't help but wonder whether we can intervene, to what extent policies can be designed not with a top-down approach, but with a bottom-up approach. And how can policies influence the lives of people? Is there any other way to intervene?
It's very, very important to first of all stress the imperative to support resources that are already in place, like Ms. Biku said. It's very important to put funds for people who need the help. But before that, we can also do things environmentally, social-environmentally, to minimize the chances that people will need mental health support. So again, I think here we can learn a lot from evidence in social epidemiology, from researchers, for example, like Richard Wilkinson and Kate Pickett, who have worked in social epidemiology and published a book, The Spirit Level, το αλφάδι στα ελληνικά, which is about social balance. So they demonstrate how inequality at after a certain level of GDP growth, they argue that it doesn't matter to have more growth, you need to have more cohesion. So they look at the most affluent countries around the world, including Greece, and also they look at the different states in the United States, and they look at inequality in relation to the number of social and health problems, including well-being. And they illustrate how the psychosocial processes of inequality lead potentially to health problems and mental health problems. So more unequal places are more likely to introduce status competition between people. So even if you are well off, so for example, Dr. Hadjiandreou mentioned the very nice linkage of different domains, and also the OECD, one of the domains is a work-life balance. But work-life balance is also linked to inequality. If you have an unequal society, an unequal region, and you compete for status, you don't have work-life balance because you work more to have more of something that you will not need. In the end of the day, you won't have time. We know the happiness science says that one of the key things is in interpersonal relationships, caring for others, spending time with friends and family. We need to have a work-life balance for that. But if we care for status symbol, which is driven by inequality, then this doesn't work. So, and a key argument by social epidemiologists is that we can do a lot good by reducing income inequality. We save resources by not having mental health problems because people are more likely to have a right balance. And I'd like to also conclude, going back to the weather analogy, there is currently a lot of weather alerts in Greece for extreme weather conditions. We could have extreme social weather conditions. We can have monitors, we can expand, build on the excellent work by OECD and the European Commission, but have social weather monitoring of what's happening in different regions and look at the inequality and cohesion and try and prevent things and put in resources for where they are needed.
Thank you. Κατά τη γνώμη σας, κύριε Κυμπουρόπουλε, ποιες θα πρέπει να είναι οι πρώτες πολιτικές που θα προωθούν το...
To your mind, Mr. Kimbouropoulos, what are the policies to promote well-being? Should they come from the European Union? Is it a matter of the regions? Is it a matter of the countries themselves? Is it a matter of coordination and synergy? Well, I am concerned, very concerned, because Mrs. Biku touched upon a very important thing, and I was touched because, well, she is a mental health professional, and I am I organized recently a day on the new European care strategy, and I had the pleasure to be the rapporteur on behalf of the European Popular Party. And this is a strategy that we can adopt in order to protect those providing care and the ones receiving care at the level of the professional caregivers and at the level of the non-official caregivers like Mrs. Biku. So we need the European guidance, of course, but I believe that even at a national level, there is a significant effort underway, and I will speak about the government of Kyriakos Mitsotakis, which understood that mental health is an essential, a crucial issue, and the government created at a national level the Ministry of Mental Health to start building the necessary policy, like Mrs. Biku mentioned. And I believe that Mrs. Hanziadreu touched upon the policy needed. Well, she's put it in a very right framework, comprising all the things we've touched upon previously, all the things needed. And you do see that it is a multifaceted approach, and we need many different interventions and approaches in order to be able to guarantee well-being. I will give you two examples and I will conclude my intervention. Let us imagine that in the policies that are about to come, well, they have to be human-centered, and they have to involve humans, and humans have to be re-educated. And the European Commission very correctly said that we will be using the technology, but remember that the average person needs to be trained. If we don't train them, if we don't educate them, if we don't help them, they will be excluded. And we don't want people to be excluded. We want everybody included. So we need a digital policy for everybody. And Mr. Varnas said that GDP is not that important after a certain point. Yes, we need policies that go beyond the GDP. We need to create more social indices to try to understand how to improve the well-being. We need horizontal policies, not just deriving from the European Union. I mean, Greece is improving, but there are other countries where they don't really follow certain policies, and they do not take care of their citizens. So imagine that a kindergarten could also apply a policy of well-being. Imagine a kindergarten that is created on the basis of specific rules and regulations to have inclusive toys, for example, to include children with disabilities. Imagine a kindergarten who are excluded, who exclude, rather, children with disabilities who are excluded from kindergartens. So, I mean, if the state doesn't do that, then the European Union should provide a directive stating that kindergartens should be built in a specific way. Because if such if such playgrounds don't exist, then children with disabilities will be excluded, and this will be a reason for stress. This will be a reason of a lack of well-being. So playgrounds should be designed in a very specific way, and there is a need to talk about public health for everybody, an all-inclusive public health, starting with children.
Could you give us those examples, those good practices you mentioned of promoting well-being?
Yeah, sure. So I'd like to, I think one of the issues that every panelist so far has kind of alluded to is that we need an integrated approach. Well-being is multidimensional. You know, there's many social determinants of health. But then in practice, I think what often is the challenge to then acting upon that is that our kind of governmental systems are organized in silos, right? So the Ministry of Health does this, the Ministry of Labor does this, Ministry of Environment does this. So the structures are not really set up to have this holistic system. And that's kind of where we think that well-being can be a lens to change the incentives and kind of facilitate beyond silo cross-government working. So two ways to do that very simply are, one, how are resources distributed, and do they take well-being priorities into account? So that the one very central way to do that is to target the budget process. A couple of countries in the OECD have looked at that. So Italy is doing some very interesting work. New Zealand had its first well-being budget in 2019. Canada and Ireland are looking at well-being budgeting very closely at the moment too. So that's kind of the area where we see the most movement and interest among countries to go towards. And then there's just very practical tools to redesign policies at the intervention level, and to have a kind of well-being cost-benefit analysis applied to decide how you even do whatever you are planning to do anyway. So to give one example from the United Kingdom, but increasingly also elsewhere, we have social prescribing there, where the healthcare system actually has a kind of network of so-called link workers that are linked with community organizations. So someone with a mental health or other problem might go to a doctor and might actually be prescribed officially a walking workshop with the neighborhood, or a training program otherwise, depending on the needs. So that's something that wouldn't have happened if there hadn't been placed an explicit price on the kind of promotion value in the healthcare system. And I'll stop there.
Thank you. Ms. Lival, I want to focus a little bit on the role of new technologies and digitization on improving well-being. How can they help? And also, can you share any good practices that regions are implementing that could be implemented in other areas in Europe also?
Thanks a lot for this question. Yes, indeed. When it comes to technologies, they have a huge potential to help, first of all, promote health and well-being, but also to prevent more complex diseases. A very important aspect for that is also, of course, the possibility to have more data of healthy individuals, also in order to be able to create technologies that are smarter and can more quickly diagnose a particular health issue, and also alert better health professionals and caregivers into what are they supposed to do further on. So when we have more data of healthy individuals, but we can design better policies, health and care policies all around the union in case, and this is also why we have been working very hard in the last 2 years on the proposal for the European health data space, which is currently negotiated, with the hope that this will unlock the sharing of data. And I believe that this has been very strongly also seen through this last crisis, how important it was to be able to share data in order to model a spread also of COVID, for example. But we are not. We are also talking about, of course, non-communicable and communicable diseases. So this is one important aspect, and we are working quite hard on that, given, of course, the fact that health as such is not a complete competence of the European Commission. As you know, this is a member state competence. The call for having a guideline on how to do things is currently not so simple to implement, but nevertheless, we promote a lot of member states partnerships. For example, the upcoming partnership on health and care transformation, which is written and implemented together with member states, and they're part of it, and also together with regions, because as you know some countries have very different health and care systems, but also different challenges that depend from their regions. Some very good practices that we have had is in the context of the European Innovation Partnership on Active and Healthy Aging, which is a bottom-up partnership, meaning that it comprises innovators, health practitioners, associations, citizens, patients, and they come together and work on challenges together. And we as a commission, we support them, but we also listen to what they have to say. There have been two very good practices. One is the twinnings, which is exchange of a best practice from one region with similar characteristics to another region. So, for example, if a very good practice in a Greek region has worked for adopting a particular health and care solution, and another region interested to implement it, we in the Commission have supported and continue to support this exchange of best practices from one region to another, and the adoption of this solution in a different region, in a different country. And the other good practices that we have the so-called reference sites community, and today this is a network of over 100 reference sites all over Europe. Those are local communities and regions, sometimes only a city, where there is commitment to work together towards a better person-centered, holistic care, and where all stakeholders needed to implement this, such as government, care or informal care providers, citizens, patients, they work together. And we support this network, and currently this network is also expanding much to the east of the Union, where also they come together and exchange best practices on how this could be done, because for a certain solution, whether it's a digital or whether it is a more holistic health or care solution to work well, it is very much needed that partners with different competences come together and commit for it to be then adopted. Thank you.
Thank you. Dr. Hadjiandreou,
Dr. Hadjiandreou, innovative technologies, you have an extended experience on that. Could they be a part of the solution? Please give us an overview about it. Thank you. There's no doubt about it. This is the optimistic message to convey. In a nutshell, first of all, allow me to tell you that we listen to Mrs. Biku quite cautiously, because this is true from the field. We are all here to improve this reality, the one that you have described. So I will give you one example. First of all, there are policies, there are laws. So these should be implemented. Public services that you mentioned should perform their task in a better way, or take 2 or 3 steps forward. And I will come to the end with one example. In our next conference, we might refer to that in our convenience. Right now, there is a gene test, a genetic test, and if you do it, you can identify for mental diseases from the existing drugs, which one will work, and what will be the proper dose of that. You might direct that, you might make the treatment more effective from day one. In the world of mental diseases, it's very serious because normally it takes 3 or 4 times more in order for you to find the proper treatment. Now, think of what you save vis-a-vis the cost, the courage, the effort. And by way of conclusion about mental illness, let me tell you that they absorb 3% of GDP. How hard should we work? It would be a benefit, it would be an added benefit for the GDP of each country. Thank you. Mrs. Biku, let me come to the end with you. An optimistic tone, please. And please tell me, what is the most important thing in your view? What should be done to improve this word? In my view, I do believe that, as I mentioned before, people who are the recipients of mental disease services, even Mr. Kibouropoulos will agree with me, have a high IQ. Very often, we see children at the very early stages of their university pathway. We are in a university right now. And since we do have the experience to visit in our association, in our mental health association, young people, students come to us to receive our services because in the university they're afraid of stigma. They are afraid of being pinpointed. Unfortunately, in Greece, we still have that. We are not like other countries abroad. I am confident, I'm optimistic by nature. Why am I saying so? Because my child was able to finish his studies. He had a master's degree and then a PhD. He works, and next month he will get married. So, if there is a proper therapeutic team along with the alliance of a family, the consent of a patient for the drug treatment and the psychiatric treatment as well, results will be remarkable. I truly beg us all to stop this rotating door, as we say it in our jargon. That is, when we hospitalize the patient for the first time, then when he exits the hospital, parents, when they hospitalized their child, may not understand, may not realize the chronic nature of it. They're under the impression that it may take them a painkiller and then this person will be all right. But then starts the chronic nature of the disease. Drugs are stopped, not concerned with the treatment. I don't like the word compliance, Mr. Kibouropoulos. That's why I'm talking about consent. And then this comes back. This is a rotating door. There must be a continuous therapeutic approach. The day center, for instance, and even beyond whatever is needed. Furthermore, my last point, I would like to invite us all, I would like to invite the political leaders to listen to the carers and the recipients because they have a say and they can be quite eloquent, they can talk and say that decisions taken should not be taken without their view to be taken into account. I'm optimistic. I said so before. It is the best HR that we have, and I believe that they can truly be included in our society. Our society is in need of them as well. Thank you. Thank you so much. Thank you. And having said that, with this optimistic note, the fact that we are all part of a society, there are solutions for all problems, provided that we can collaborate. Let me thank you all indeed.
Very interesting talk.
And I hope that in the next conference we can expand that even further, because many more questions were raised compared to the answers that were given. Thank you. Hello, good morning, ladies and gentlemen. Welcome to the Regional Growth Conference. This session is how the regional agricultural sector can ensure food supply stability. It is about a very difficult conjuncture as we have the war in Ukraine. Russia and Ukraine are two of the major countries producers of wheat and cereals, and many things have been said about a food risk or a food crisis. Today, we shall see with our guests how we can tackle this crisis, and I would like to start and to present your panel. We have online the Minister of Rural Development, Mr. Georgos Georgandas. Minister, good morning. Good morning to all. We have Mr. Ioannis Latoudis, political advisor in the parliamentary group of the Socialists and Democrats European Parliament, and Mrs. Principato, researcher marketing and sustainability, Deputy of Business Administration, Roma Tre University. We will start with the Minister. Your view, Minister. You have the floor. And yes, yes, of course. Would you like to start with some introductory remarks, Minister? Yes, for sure. From the airport of Thessaloniki, good morning to all. I wanted to tell you that not only this topic is very important, it is quite symbolic, the area where this is taking place, because this point, or the region where you are, Western Greece, is a region with great agricultural production, and I would argue an agricultural production which is combined with many different services in tourism. It's an exquisite combination because we can complete these two actions. Pertaining to your question vis-a-vis food safety or food crisis, as we call it, the debate has become more intense lately, and this is due not to the energy crisis, not due to war. There was the pretext to make the concern more intense. The phenomena of climate change and, of course, the increase of global population are phenomena that go back some years ago, and they are of concern for the many, because climate change affects productions with a very awkward way. We know pretty well that we cannot cover a productivity which is being decreased. There is a concern about what will come next. Then there was also the war in Ukraine, which deteriorated the situation, which was not easy. We all know that they are key players, both Ukraine and Russia are key players in wheat and cereal. A debate has started in the EU, but also in the international fora, vis-à-vis the necessities, the initiatives, the new interventions that should take place to avoid that risk. We're doing the same in our country, and the same will be done shortly overall. I wouldn't just talk about a question of food adequacy. I am talking about a topic of boosting the agri-food sector in the economy. Because likewise, not only can we cover this substantial need, but we give some potential of financial growth and social cohesion. In the framework of the Council of Ministers in the sector of agricultural policy, we are channeling interventions to facilitate our farmers in production. For example, the measure announced in relation to the farm adequacy, some farms should not be used, but since we must use all different surfaces, this limitation of fallow does not exist. One might get the subsidies from fallow program with a simultaneous right to cultivate any possible cultivation that can be fruitful for that area. At the same time, we see some new cultures, apart from the existing ones, that we might add in the connected enhancement of talking about the wheat that is important to decrease our dependence on exports. Many are the different interventions, but I can elaborate on that during my second intervention. Yes. Now, let us come to Mr. Latoudis. Mr. Latoudis, a first comment by you as well. I think that the minister set the framework. The war came and it highlighted the existing problem. So there is a one-way street. And this makes us face the actual situation. At the same time, though, to face the deeper problem, we must not neglect it. I believe that the minister is participates rather in the Council of the Minister, where they are having this discussion. We could categorize debates in a threefold dimension: safety, stability, sustainability. Because food safety is related to the effort made by the EU, and here all institutions are fully aligned, one helps the other. There is a common understanding on that. That is, we must alleviate hunger from North Africa. Why? Because this will create political instability, this will possibly create new inflows of migrants, and we can tell the results. How are we doing so? Point one, we increase our productivity through different measures, we increase exports. Point two, we're trying to find ways to commercialize 20 million wheat that are stocked right now in Ukraine. I'm talking about the solidarity lanes, and it is another way to transfer production, not the ideal one, but right now there is no other choice, to be frank. Furthermore, there will be an extra benefit. Not only will it mitigate concerns in the markets, but at the same time, it will create more stock place for the new sea, for the new yield, rather. Sustainability, as the minister said, right now there is stability, especially in Europe. We are self-sufficient, but this does not mean that we shall continue being so. The big problem now is not accessibility, but financial affordability. I'm talking about crisis. Greece and other member states have created a very good framework of choices that might go from the reduction of VAT, assistance through projects, direct enhancements. And let us come to sustainability, which is here to tackle the problem that the minister alluded to. How are we going to make it happen? How can this continue? And here we're talking about transition into sustainable farming. I will stop here and I will come back later. Yes, and now let us go to Mrs. Principato. Please tell us, how can we do that? That is, in other words, how can we create an agri-food system that will be ready and sustainable for any potential crisis in the future? Thank you.
That's a really, I will turn this off, sorry. So, okay, yeah, that's a very good point and a tough question in some way. So during these past few years, we have seen that our food system are not resilient to shock. So we are facing with three very important shocks. One is the climate change, then the COVID-19, and the war. And for all the three, we have different type of issues. So for the climate change, we can see that, and we can say that the food system are in some way victim and perpetrators of climate change. So they are victim because the raising of floods or heavy rain can impact the agriculture, and in some way we know that the food system have a lot of greenhouse gas emissions on the planet. And then the COVID-19 was very tough, especially for the most vulnerable part of the population. So we know that between 2020 and 2021, we have plus 180 new million people that are suffering from severe hunger. And this is becoming even more impressive, this data, because of the war in Ukraine. So we know that, as we said, in Europe now the problem is more related not to accessibility, not to food insecurity, but on food prices. So this is also pretty much problematic. And I mean, my idea here is that we need to diversify in general. So we know that now we have biodiversity loss, and we should take this into account. So we know that we have 6,000 species of plants that are used for food, but we just use like 9% of that for giving food to 66% of the global population. Then, as we are seeing now in Ukraine and Russia, but also in many other big countries like Brazil, Argentina, that are big food exporters, they are basically just growing a single monoculture of single food. So we should need to diversify more the food coming from this country in order to avoid shocks. So not only growing like single monoculture of soybeans or sugar cane, but trying to diversify. And of course, another part is to diversify our diets, that is trying to eat less the westernized countries, and this is a problem that affects also the southern part of the world, and try to eat more sustainable diets, and of course that are adaptable to the different local situation. And then another part is the energy, so trying also to diversify the energy that is used in agriculture. These are the main point to me.
Mr. Minister, 2 months ago you launched the platform for the declaration of the reserves. What are the first results? Well, I'd like to say that both speakers have said very interesting things and provided important data. It is very, very correct to say that it's not only about food sufficiency in our country or in the European Union. It's not just about that. The whole global community needs to protect itself. Otherwise, this crisis will affect everyone. And the countries of Northern Africa, for example, it's not just about available products, it's also about prices, and prices currently are very, very high. With reference to our country, traditionally, Bulgaria supplied us with grain, and our country also exports soft grain. Anyway, 30% of the products we imported from Ukraine and Russia has been eliminated, that is, so we had to investigate new markets, and this is something that we're going to do in the coming years as well, investigating new markets and investigating new products that could replace, for example, animal food. And because there are certain ingredients that can replace certain types of food. So there will be an improvement in the coming months, in the coming years, with the contribution of the science. For example, we need more resilient cultures due to climate change. And because of the adverse climate conditions, we need to adapt to this new situation. And, for example, India, we thought that we would be able to import grain from India, but with the high temperatures of the past months, a vast part of their production was burned. So we have to take all such elements into account. We see an increase in greenhouses and greenhouse cultures. But there is time and there are opportunities, and we all need to adapt to the new situation and to the new data. Our country, in its effort to strengthen the primary sector vis-à-vis increased costs, has launched specific projects with major investments. A program, for example, that is a program of 600 million euros inviting new farmers, and we're also investing in organic culture. These are all European projects that we are utilizing and valorizing, and I believe that more people should should opt for the primary sector to their benefit, but also to the benefit of the economy of our country and to the benefit of social cohesion, which is of paramount importance and which can be achieved through the completion of this whole process of food adequacy. Unfortunately, I will have to leave you. I would like to thank you for the invitation. I would like to tell the Greek citizens that there is no issue of a lack of food sufficiency right now. We are functioning well, and the supply chain is functioning well for now, and this is very important for everybody to know. We don't only need to strengthen the production, we also need to guarantee that the supply chain will operate efficiently. So there is no issue for now, but that doesn't mean that we need to pay attention to the future. We need to see what the impact of the climate phenomena will be, which become more and more adverse and intense. So we have to invest in more resilient cultures, and also we have to invest in providing the possibility to more young people to enter the primary sector. Thank you very, very much. Just one quick comment, Minister. Apart from the European programs which aim at supporting farmers, are there any other measures for the reduction of the prices? We have an inflation of that is higher than 11%. You have spoken about the reduction of VAT on some items and some food stuffs. Is that the case? Well, this is the competence of the Ministry of Finance. They will be the ones to decide. We have the reduction of the VAT on fertilizers and animal feed. But I believe that in the coming months, with the efforts of the government to reduce the prices of electricity, we're going to have a de-escalation of prices, and things will be better. And I believe that we will see such results as of July, and we will have a reduced cost in production and a reduced cost in the supply chain, and also in storage and of foodstuffs. I believe that the policies followed will lead to the de-escalation of prices gradually. Thank you very much. Thank you for inviting me. Mr. Latoudis, you heard the Minister. The European Union, is the European Union preparing interventions to deal with deficiencies in the European market? Allow me a few comments. The European Union is everybody. We are the European Union, the voters, the members of the European Parliament, the institutions, the European Commission. The European Union is us. That was my first comment. Secondly, I agree with the Minister, agricultural production is not facing a crisis, but it is facing a critical situation. So we need to be able to react in a rapid manner, and we also need medium and long-run policies. Now, the European Union activated a reserve of 500 million euros, which was allocated to countries to solve problems in the relations of farmers and producers. Moreover, I come from Strasbourg, and there is a new measure that will be applied. for up to 5% of use of the fund of the agricultural growth for certain farmers, and this will be a measure that will be available as of the 1st of July. It will be a new fund for producers who are faced with problems because of the current situation, be it the energy crisis or the increase of the prices in food production. Though there is efficiency in food, we depend 100% on the fertilizers and pesticides, the ones that we get from Ukraine. And so this new fund will begin as of the 1st of July, and we will see if it will go on or not. And we need a holistic approach in order to convince people to make a shift towards the primary sector, but we need to create the necessary conditions. We need to attract new farmers, but to attract new farmers we need services, health services, education services, sports services, and so on and so forth. And we could also say, and I will conclude, that some people could say that the common agricultural policy as we know it has ended, and that will change soon. It will have to have a new approach. There will have to be a new model of common agricultural policy. And how will the new model be? Will it have a more rather stricter environmental criteria? It will be more targeted. It will be more holistic, because the growth of the countryside has at its center the development of rural, of agricultural production. We have to turn the crisis into an opportunity in order to be able to deal with the problems in the future. The countries of the sub-Saharan Africa depend on imports, but in the past, for 50 years ago, they were self-sufficient. And, things change because of the climate change. It's a climate crisis. It's not just a change. Mrs. Principato, I would like to ask you whether you have noticed, now with the war in Ukraine and with the pandemic, whether the behavior of consumers has changed. Has there been a shift? What do they look at? What are they after? Is price important? Does it matter to them?
Okay, thank you. Considering the consumer behavior regarding the war, it is still kind of early to know what's going on. But for sure, regarding the war, I can tell you that in many countries, as we are facing the inflation and the income is pretty much stuck and the salary are pretty much stuck, there is this skyrocket risk of recession. So I can say, especially in my country, that after the COVID started to finally see a growth, now the sentiment of consumer is they are now afraid, because this increasing of the prices, especially of food staples, affected for sure also the propensity in general to buy, and the increasing of for instance, also the gasoline. It provides a lot of more fear than just after the pandemic. After the pandemic, we were seeing like a period of kind of excitement in people. There was a growth, but now we are kind of stuck and worried, and we are just looking on what's going on. Concerning the pandemic, so just, a couple of months ago, I can tell you, based on my research, an important aspect on food awareness. So I work especially on food waste and food waste behaviors. So what we have seen, and during the different time of lockdowns, people seem to be more aware of the food they buy, and there seems to be less food waste at home. This is why, because we were just forced to stay at home, to do grocery list before going to shopping, since we couldn't shop every single day. And this more aware meal planning really helped in reducing food waste at home. So something changed in a good way, and now we are seeing if these good behaviors last a long time. So, but for sure, now we are just waiting on what's going on concerning these raising the price for many food staples and items.
Κύριε Λατούδη, βλέπουμε ότι υπάρχει από την Ευρωπαϊκή Ένωση.
Mr. Latoudis, we see that there is a delay in the European Union in decision-making with reference to increases in electricity, in the prices of electricity. And I would like to ask you whether we are expecting some interventions and some policies to somehow hold, to put an end to the increase of the prices. I will agree with everything you said, Mrs. Principato. The pandemic is on and running, and we have to take this into account. If we pay attention to what is happening to the other countries, we are heading towards a new peak of the pandemic, unfortunately. But anyway, the delay in the European Union is not a delay. You know, it takes some time and a bit of effort to find a common denominator between 27 countries. We need time, you know. We need time because there are some countries with multi-party governments. It takes time for 27 countries to talk and to agree. And delays are not necessarily negative because delays sometimes bring about new proposals. Right now, the European Union, and I believe that we have all agreed and we're now defining the detail. I mean, we have the Repower EU, this new ambitious plan with 200 billion euros and moving on to three pillars. Reducing dependence on fossil fuels. Second pillar having to do with the improvement of energy efficiency, and third pillar having to do with mass investments in renewables. The first pillar comprises decisions such the ones taken within the framework of the previous summit that we reduce import of oil by a significant percent by diversifying imports, and we succeeded in the first month. After the war, imports of natural gas have doubled natural gas from countries other than Russia. 45% would come from Russia, though, and so you do understand how difficult the situation is. And then we need to further strengthen the infrastructures for them to be able to be utilized for the next generation of hydrogen fuels, for example. Russia stopped exporting natural gas and electricity to Finland, to Denmark. And how was this lack dealt with? The other countries had to contribute and help. Then another thing that may sound trivial but is very important is the following. There are certain investments like Execonomo, but there are other investments in the energy efficiency of buildings. The Electra project. The profit is huge. I mean, if we manage to reduce by 2 centigrades the Celsius centigrades the temperature in our households, in our buildings, the benefits will be multiple. And the minister said that we need to invest in renewables because it is good. It will be good for the climate. It will be good because it will help us become less dependent on certain types of fuel. It will be good for the economy. It will be a win-win situation all over the place. But that needs a certain state of preparedness, of readiness, that is, of preparation, of organization. And we have to involve our producers. For example, sustainable biofuel, circular economy, and you don't depend on prices anymore. You depend on your own production. So the reduction of the production cost will go through all such energy measures. Is that what you're saying? Well, yeah, we experience a very unpleasant situation. Kremlin, Russia, now use energy and food as arms. They are their arms to wage this war. So when the European Union will cease to depend on them, they will be able to define their own destinies. Of course, we need to be careful about speculation, and we need to utilize all necessary measures at our disposal. The reduction of VAT, the example of Spain and Portugal, which created a program to reduce certain prices and certain VAT prices. But this all depends on the comprehensive political approach of every country, on the totality of the policies of every country. And the Ministry of Finance knows the policies that need to be applied. And at the level of agricultural production, how will we manage to become less dependent on Russia and Ukraine? There are many ways to make a green transition. We need to diffuse expertise, know-how. For example, in the European Union, some people have achieved best practices. So we don't need to reinvent the wheel and best practices. We can find best practices elsewhere. We need to strengthen precision agriculture, meaning that we use best practices to improve our production and the life of the farmers, the lives of the farmers, the broadbandness. We use the broadbandness to improve the lives of the farmers. Then the shift to organic culture. There are some pieces in the market, rather some consumers who are ready to pay for premium price for a premium product, organic product. And these are all things that are supported within the framework of the Common Agricultural Policy. These are objectives of the Common Agricultural Policy. We need to make this transition into a greener period, otherwise we will be faced with problems. Now, about prices, I would also like the opinion of Mrs. Principato. Mrs. Principato, do you believe that we have reached the peak in the prices, and when will de-escalation and stabilization start?
I believe we really don't know. I'm afraid to say that maybe we are not yet in the peak. And what I read, according to Eurostat, the food prices are raising as twice as the inflation. So the food price is a big issue. Now we can afford, as we said, but what's happening next? Are we going into a stagflation period? Are we going into recession? So this is very important. And I can tell you also an important thing, the importance of diversify our import is fundamental, as we said, not only in energy, but also regarding the food sector. So I can tell you this example. In Italy, we have a few years ago, the palm oil big movement coming from down. So many food producers, many important food producers changed all their products, which, I mean, it encompasses a big investment in production, and remove this palm oil and they are starting using sunflower oil. But now we know that the majority of this sunflower oil imported in Italy comes from Ukrainian. So now there are these big food producers that has this big issue on talking to consumer that in all their packaging they're writing, we are not putting any more palm oil because it's bad for the planet and for your health. But now maybe some of them are forced to put it back because the transportation restriction and the production in Ukraine is stopped. So we need really to pay attention to diversify our food import. We are lucky in both Italy and Greece because we are also food exporters. exporters, but there are some food that we import. So we need to pay attention on that. And I'll also agree with what the minister said regarding the youth in agriculture. So also in Italy, the majority of our agriculture are middle-aged, if not senior. And we need to bring back our youth into agriculture. Just why? Because agriculture is fundamental for our living, and we need to kind of renew the system, digitalize it, put some innovation on it, and youth, of course, with a big knowledge on that, can transfer these, and it could be very important. And another part of knowledge, I believe it's important to start again the knowledge transfer about agriculture in the southern world, because as we have said, it's true that in some way they can afford and they can except of issues related to climate change, they can have their own production, but maybe they need some new innovation, they need some new knowledge in order to improve their production and their crops.
Κύριε Λατούδη, επειδή τελειώνει ο χρόνος μας, θα...
Mr. Latoudis, we are about to conclude, and I would like to have a final comment with you. Do you agree with with the previous speaker, that we may have not reached the peak? Well, we don't know. We don't know how things will evolve. We don't know what the duration of the war will be. But the measures will start bearing fruits, and we will keep making corrections. And I agree with the previous speaker. We need to bring our young people back and put them into farming, but we need to skill them up, bring them up and skill them up, because there is a lot of competition. And so there is no other way, just solidarity and cooperation. And there are lots of good examples. It's not just about countries, it's also about regions, it's also about neighborhoods, it's also about schools. And this will lay the foundations for future crises. There is no magical recipe. We need to be alert, we need to engage in a common effort, and we need to be targeted. Thank you very, very much for being here, and please stay with us to follow the following thematic sessions of the conference. Thank you very much.
Ladies and gentlemen, hello. Thank you for being here. We would like to thank you, the ones who are remotely. Difficult day, difficult time, but still, we're here. We are in the 10th conference, the RGC, to discuss about a very important topic, a topic that concerned us yesterday because acute weather conditions paid a visit yesterday as well. And we can tell that adverse weather conditions will not just be some phenomena, but a normality in our lives, which means that we must be prepared to tackle them. And the main thing is to avoid any human losses. We have here some eminent guests. We're going to discuss about it. Challenges of civil protection, disaster risk reduction in Western Greece. The Minister for Climate Crisis and Protection will join us shortly. He would have been here physically, but unfortunately there is pandemic. COVID still exists. It is one victim. We have another victim from this panel, Professor Ευθύμιος Lekas, whom we're going to have remotely. Professor, hello. We hope that you are well and with the less possible symptoms. Hello to all. Thank you, Professor. Thank you for being here. This has been organized by the Regional Association of Municipalities in the framework of a talk to see where we stand. 90 municipalities with Papadopoulos in our region. Let's see how well prepared we are, whether we have the proper tools to face this whole situation, the new normal in our lives. Already, we've heard that we have with us Mr. Papadopoulos Athanasios, Mayor of Kalavrita and President of PEDE, that is the Association of Municipalities and Communities. Next to him, Mr. Athanasios Karamoskos, who is consultant and expert in systems planning, local government, representative of region of Western Greece. Mr. Karamoskos, am I right? No. No. Okay. Anyway, but you are a person who planned a very important system. You are a consultant, and you built upon a significant tool in our area, and then we shall see shortly whether this tool was used or not. Next to him, Mr. Fokion Zaimis, Vice Governor of Innovation Entrepreneurship for Western Greece. How entrepreneurship is related to that? Well, innovation goes everywhere, exactly. And we are in need of innovation equally. Mr. Theodoros Baris, who is Mayor of Rimanthos, Vice President of PEDE, the same association, the one like Mr. Papadopoulos. So, welcome. Let us start by our host, the host of this table, Mr. Papadopoulos. Mr. Papadopoulos, please. Where do we stand in our region at the level of preparedness, preparation, tools, and why are we having this discussion, which has been one for the last many years, but have significant steps been taken? Are we properly prepared to face this phenomena? Thank you. Mrs. Rizogani, thank you so much for the decision to include in this conference taking place in Patras a proposal by PEDE of Western Greece, of our Association of Municipalities in Western Greece. This is related to the big picture, what we've been listening to, civil protection. We have been listening to big titles, but its implementation is huge. It is a very big issue. Implementation is a tricky thing with civil protection because there are no clear institutions. That is why we wanted to have the minister with us today, Mr. Stylianidis. Many different bodies are involved. Bodies are quite many. The minister announces some phenomena, then there is the mass media, but at the end of the day, we are talking about the role of local administration, where we're successful, where we're able to face phenomena, floods, snowfalls, cutting of trees, for instance, floods, and then rivers overflooded. Then what about summer? There is a part related to wildfires during the summer period, fire protection. What are we doing there? But local authorities, do they have necessary resources? Are there employees that may implement all that practically? Do we have the staff within the municipalities or not? Or each time that something is brought to our mind or something comes from central government to the local administration, are there issues without any specific framework? For instance, we are saying that competent for civil protection are the municipalities, but who exactly? The mayor, the vice mayor? Who will be condemned? Who will be convicted if a branch falls and kills a child? This will not be a crime of negligence, but quite more serious. Then they're saying that we must collaborate with the firefighters, with the CAV, and we have Mr. Roumeliotis, Ms. Canelopoulou with us, who shoulder the responsibility for our region. On the other hand, finally, we must think that institutionally this is guaranteed, like financing of municipalities, like CAP, like SATA, which has been cut down. But then they keep on telling us that, you know what, if you really want to tackle these issues, you go to the regional authority. Mr. Zaimis and the region, Mr. Bonanos, who has shouldered this possibility, is abroad. And Mr. Zaimis is going to have a dialogue with you. When we go to the region, they're telling us, okay, guys, we can give you 10,000 euros. 10,000 euros to do what? Tackle the phenomenon of civil protection at the level of municipalities. In municipalities, which are quite vast, according to calculators, they go up to 1,000 square kilometers. Tell me, what should we do with 10,000 euros? How will we tackle problems with 87,000 euros? May we really face all problems during the anti-fire preparedness? But if something occurs, what shall we do? We will be burned alive. But we're doing something. We can only truly support that. To what extent can we shoulder all that without any machinery, without any personnel, without people to use our machineries? When there are tenders to hire and recruit personnel in municipalities, we have never thought of the fact that we need also people who are going to use this machinery. We are hiring economists and other people, but let me tell you the following to sum it up. We have some laws that institutionalize this part of civil protection. Lately, our government passed a new law of climate change and on civil protection. What did they do? The minister could reply to that eventually. They said that there is Article 21, if I recall well, which stipulates financing for insular municipalities. But what about mountainous, small, vulnerable municipalities? We in Keta, we only have one committee. This committee in Keta, the Association of Municipalities, is about insular, mountainous, vulnerable municipalities. Why were we exempted from that? We will find financing from what source to tackle different issues that, institutionally speaking, are risks that we must shoulder. And one last thing, we go to the Minister of the Interior. We have here the Mayor of Therma with us. And, of course, we have members of the Municipal Council and the Council of Pede. Kostas, hello. Very nice of you being here. We have many different employees of Pede, as well as the director of our association and our colleagues. Hello to all, guys. Now, what are they saying? You can table a claim, send us a technical bulletin so that we can see what can we implement. There is a Code of Civil Protection 055 for the Minister of the Interior. If there is financing by Mr. Skylakakis, we can get something. There is another one, 801 for the region, but if there is money, we can get some. Shall we be beggars? At the time that we shall face adverse weather conditions, at that exact time, can we submit a claim? This was about to be my next question. Are things all set?
And one last thing. There are cases where our areas are declared following specific decisions in a state of emergency. And this state of emergency is defined on the basis of very specific decisions, which may at times take months. But on the other hand, following the decision, there is no other decision. And there is no other decision that tells us, okay, a state of emergency has been declared, but what do we do after that? The thing is that we are in danger, that there is a state of emergency, and we can find ourselves accused before the court, and not for negligence, but for felony, in a way. And many mayors have been condemned, unfortunately. Some have proven to be innocent, some haven't really managed to do so. Anyway, what I'd like to say is the following. The forestry authorities, the firefighting services, health services, the Red Cross in the area, and the region itself, they are here, but without a specific law from the state defining the funding, we can't do much. I recently went to the minister, and the minister told me, you have to go to Mr. Stylianidis. I mean, if we do have a new ministry in our country that will deal with everything, with all the above things, then let us know the details. And lastly, Mr. Lekas, the professor, he has always been a consultant of the local administration, and he is here to express his ideas. He is in Patras at the hotel, and he is recovering from. And we have Mr. Karamoschos, who has helped us very much. And the regional union of municipalities launched an interesting project and studied the civil protection area, Simprofect. It is about the efficiency of civil protection. And there is a decision, this one, I have it in my hands, stating the funding of 10,000 euros to the forestry authorities of Kalavrita for the forestry to take all measures needed to protect from fires, the area from fires. Let us pray that there won't be a fire in Kalavrita, because unfortunately the money is not enough. Okay. And remember the fires that actually destroyed the whole of Ilia. Only 10,000 years for the forestry authorities and services of Kalavrita. So when we write the forestry and we tell the forestry, you know, you have to deal with the cleaning of the specific area and so on and so forth, the forestry answers and tells us, well, we want you to know that we are understaffed and we do not have the necessary funds. And so this is a vicious circle that goes on and on. And the history, we have a history repeating in a way. So, yeah. I was a member of the Hellenic Parliament in 2010, 11 and 12, and that was a very, very negative period. And we have, in the audience, we have some prominent scientists who could take the floor eventually. Let us now give the floor to Mr. Stylianidis. We can't hear the minister, unfortunately. Could you kindly help us? We can't hear the minister. Let us move. Let us pass to Mr. Lekas, because we can't hear the minister to save time. Professor Lekas, can you hear us? Can you hear us? Yes, I can hear you, but I can also hear the minister. So let us hear Mr. Lekas. Of course. Good afternoon, everybody. I'd like to thank you very much for the invitation. It is indeed a great pleasure and an honor to be participating in your conference. I'd like to touch upon three issues. Firstly, what the mayor mentioned about the responsibility of those elected in the local government. I know this responsibility very well, and I was on the island of Kos a week ago because two governors of regions and 7 mayors were brought before the court for the floods of 2013. And there was a whole trial process since 2013 about the responsibility of these people or not. We were talking about the floods in roads in 2013, and the people accused were accused of felony and intentional felony, fraud. And can you imagine that? Can you imagine that, as if they wanted the citizens to suffer? This is absurd. I mean, this is a process, an absurd process. These people faced 10 years of a lawsuit, and you do realize the consequences. Moreover, it is a pleasure and a great satisfaction because, you know, I started my career in the field of natural disasters and in the Ionian Islands. This was a very interesting experience, but I realized that there are so many dangers in Western Greece, hydrometeorological dangers which are exacerbated with the climate change underway. And thirdly, with my intervention in the Central Union of the Municipalities of Greece, I realized, I have come to understand that the system is structured in the wrong way. And why is it structured wrongly? Because we assign competences without assigning funds and equipment. And when the funds are allocated, they are either tiny or not timely. They are not, and when the equipment is provided, then the equipment can't be effective because the timing is wrong. And these were the three issues I wanted to touch upon. And I would also like to say that municipalities, under the current circumstances, should seek a different model of crisis management. What will the model be? We're going to see that with more innovative processes, though, a new approach to assess risks and manage risks within the framework of certain phenomena that maybe it's going to be the use of technology or innovation in order to reduce the impact. There are so many nice ideas and productive ideas for us to be more effective and try to achieve the best possible result. We do have the means, but the central government and the regional government, they need to lay emphasis on prevention, on information, and on readiness. Now, when we are faced with emergencies, the consequences will be less if we are prepared. And let me also say that yet another issue is the issue of the meta-disaster stage, the recovery and the regeneration of the area. And we can do many things in that field as well. And unfortunately, regeneration is usually very urgent. And we usually apply methods that are not compatible and that are not appropriate and that do not really, in a way, take into account the emergencies that may arise in the future and the challenges in the future. So at the stage of regeneration, we need to involve prevention methods as well and prevention systems. When we regenerate, when we correct certain things to reduce the impact of a disastrous phenomenon, well, we have to take into account future risks and be preemptive and proactive. And this is a major challenge we need to take into account. We need to include in the recovery and regeneration stage certain methods taking into account the climatic change and all the changes we thought would take place in like 20 years or 30 years, but we now see that they're taking place sooner. Okay, we will give you the floor later, Professor, for you to talk to us about the future more. Mr. Karamoscos, you are an expert in local government in our region, and I'd like you to talk to us about the tools that you prepared and that you have given the local government. Have they been used? Why every time something happens, why do we lose ourselves in going back and forth and asking, trying to find who is responsible and what went wrong? Well, we could be talking about for days about such issues. Allow me to start by thanking the organizing committee for the invitation to participate in your conference, and we're very, very happy that you're here from Thessaloniki under the current weather conditions. Well, my trip to Patras has been very pleasant, apart from a small part of it. Anyway, so I'd like to thank the organizers, and I'd like to congratulate the Peloponnese, the region of the Peloponnese, on the organization of this important conference, which touches upon many interesting subjects. And of course, we have to make sure that the conclusions will be utilized, but this is another issue. You have touched upon very topical issues. We can't possibly provide quick answers. Well, the president here presented a very obscure future. Unfortunately, and I have prepared a very quick presentation, and I will make it very, very brief and very concise. So, I wanted to touch upon three important issues. One issue has to do with some basic principles that underlie civil protection. The second issue is the role of the regional association of municipalities within the framework of the civil protection framework and of a future framework, the unions of municipalities could play a very important role by increasing their effectiveness and their efficacy, the efficacy and the effectiveness of the local government, and by covering the needs of both the regional government and the state government. And lastly, let me also mention a tool that the Union of Municipalities has used and has been using for civil protection over the past years. I'd like to briefly say that there are 2 points in there are 2 guidelines and main principles in civil protection: the locality of natural disasters. We may have the perfect civil protection system. If a natural disaster takes place in a specific location, if the specific location is not in the position to deal with the problem, then the state can't do much. So the local dimension is of paramount importance. Then the issue of the effectiveness of the systems in place, the systems of civil protection in place, they have to be clear-cut when it comes to responsibility. We have to know who is responsible and for what each one of us is responsible. There has to be a clear-cut distribution of roles, of responsibilities, of competencies, of tasks, in order to achieve effectiveness. We can't start doubting over who is responsible or not in certain cases. Then there is another principle in the field of civil protection and in the field of healthcare and mental care, and this is the following: we have to prevention. We have to prevent certain risks because our system is, lays emphasis on what to do when the risk is present, when the risk is here and reaches us. No, we have to lay emphasis on prevention in order to be able to preempt the risk. I'm not going to go into detail on these local principles, if I may say so, but I'd like to say that I laid emphasis on the locality aspect, because when we talk about locality, we mean the local communities that are affected by natural disasters. When there is an earthquake, for example, or another calamity, it's going to be the local community that will be affected. So it needs to be the local community and the representatives of the local community, and namely the local government, that will need to face the problem, and that will be burdened with the whole situation, and they will be the ones to deal with the issue and to find effective ways to actually put an end to the crisis and to protect the local social communities. And the situation in civil protection in the local government has been described by the President earlier on. It is understaffed, there is no specialization. There is a legislation that envisages certain things. It says, for example, that there has to be an executive in the civil protection area, who deals with issues of civil protection. But what about the reality? This person is either the driver of the mayor or another person who does many different jobs and tasks. I mean, it's not the fault of people. I mean, we are understaffed, and I mean, these are the people who should protect us in times of need. So yeah, we do realize what the situation is, and that we are understaffed. So local communities are the ones to be affected. I mean, it's going to be my house that will be destroyed, not the house of the mayor or another person. So how am I to protect my own house, my own crops, my own farm? And let me now shift to the next slide, because I could be talking for days and hours.
A huge thing and very important. The second thematic, the second one that thing that I'm going to mention is the role of PED. What is that about? Regardless of any competences right now, it is about a hugely important institution. Why? Because they concentrate the different concerns of the 19 municipalities present in this region, and they have the possibility to express one common denominator of problems, claims, etc. in the 19 municipalities and transfer that where deemed necessary. There is this about the trade union of municipalities, the ministry, any other association. It's a matter of choices and selections. They could be paid, could play a critical role. Law 4462 of 2020, the most recent one that talks about civil protection, it stipulates that in every municipality at least 2 people will be recruited. Moreover, it stipulates equipment, so on and so forth. This is stipulated under the framework Aegis Aspida, shield in Greek, Aegis, that is, upon the financing of the European Investment Bank. Sometime we should do so. We discussed this with Mr. Lekas, who is in Athens, and maybe he has a more direct information. He said that this can take 5 years. When the President Kalavrita hires 2 people, these 2 people tomorrow, will they be able to perform all these duties? These people should be specialized. They should have a sense of belonging, understand where they are, what local administration stands for. They must learn laws and how local governments work. They should get familiar with civil protection and all these concerns. Wouldn't that take 2 years so that these people could become more productive? I believe to a certain extent, and according to plans, PED could intervene. How? Working in an auxiliary way, helping the different municipalities conveying know-how from the center or from specialized bodies, universities, for instance, channeling these know-how through partnerships, seminars, etc., conveying that to municipalities so that it can support any different staff in the municipality to upgrade them, because the ball is always in the feet of the players. Well, the only responsibility will be shouldered by the mayor. He will be the only responsible before the state. And then he will be in a problematic status. As Mr. Lekas said the other day, he was in Kos. Yes, he was in Kos. And we had 2 regional governors and 2 mayors who were suspect because a car was a victim of a flood, and 2 people were dead. What about the anti-flood projects that did not take place for the last 20 years? Should we put the blame on the actual mayor? Of course. And this is a source of fear for local administration. This is a cause of fear to mayors, so that they will not undertake any responsibility. I don't want to get involved in that because it will create problems. Mr. Karamassos, please, let us come to an end, because we have other speakers as well. The role of PED is of critical importance, because this might help municipalities in covering the gaps that can be covered in 7 years' time. Next slide, please. Yes, because we have some other speakers. Let me remind you. The next slide, please. Says the speaker.
Το τηλεκοντρόλ δουλεύει, δεν δουλεύει. Και στην επόμενη...
Next slide, please. Thank you. Anyway, let me remind you, let me refresh this unique tool. Yes, you built for our own region sales. I mean to brag myself. Still, it is a very interesting and useful tool. Broadly speaking, about public administration, either this is used right now or not. The objective back then was, when we had this digital tool, was to collect all info related to civil protection. It is related to local administrations, that is, staff, contact data of these people, infrastructure, equipment, machinery, the status of equipment, infrastructure, and make all this data accessible to all people dealing with civil protection. Give them a multiplier effect, equip them with everything necessary, so that where they have A skills, these can be multiplied, and they could render 2A or 3A. A very important tool that has not been fully used up to now. What do you think? Well, look. And I should acknowledge that, maintains that, doing its best. Nowadays, we are here to discuss with them in Western Greece. We are discussing about civil protection, because they have realized the need of that, the need to intervene. It is of critical importance. Yes, we will come back. Please, because we have some other speakers. We mapped different data. What does this mean? Forestries. For their forest maps, they have different limits other than the limits of the municipalities. You understand what this means? When the time comes to intervene, this might create multiple problems. We have lived so with the limits of the different health regions. We don't know to which health region we belong, and we are transferring patients from one to the other. We can transfer, the ambulance transfers transfer patients from one hospital to another. We managed to gather data. It is very interesting, this job that was done, and it is very useful and supportive. Now, next slide. Please come to an end. Yes, because we have to go to Mr. Zaimis. Yes, that's all, and this took place in 2015. 7 years have elapsed. 7 years is an eternity as things evolve, starting from this tool that each association should have at its disposal. There is a need to update the content, because the staff of civil protection leave every now and then, so we need new contact data, new names. The institution of government has changed, maps have changed, roads have changed, machinery has changed, so on and so forth. It takes an update of the digital infrastructure. Yes, Mr. Zaimis is going to elaborate on that. There's another software some years ago. Now, PED should buy a server. It's not a tremendous cost to transfer this tool in each seat and be able to manage it fully and solely without any risk. Well, anyway, I would say that this software might be enriched with other tools. Thank you so much. Mr. Zaimis. innovation in prevention. I will try to go from the general to the specific. Now, first of all, what the mayor said, I salute what he said, and he was quite short. He has a big experience as a mayor and as an MP. When we delivered the region, the situation was tragic, and by tragic, I mean it. A service which was staffed by one person, and even this person, I know how he ended up there. Some plants, second row, second basement. This was civil protection back then. There was an overlapping of competencies. No competencies apart from some rivers or streams with some contractors that we managed to set in order before rains took place and after them. I believe that largely we were successful. Forests belong to the decentralized authority, and today they are under the Ministry of the Environment. It's a good step. But forestries are disorganized, without staff, without vehicles, without a cleaning service. If you don't clean up the forest, it will be burned. With or without climate change, the forest will burn other way. Then there are interventions in the coastline due to humans, tragic interventions since the 80s, tragic errors during the 80s and the 90s. We built houses on streams, wrong marinas, see Puerto Rio, for instance. Yes, of course, you're right. So through climate change, we are trying to perform serious studies, update the old ones, and find money, which obviously comes from the central authority to remodel the actual situation. What did we do as a region? Obviously, the situation was not that good. The fact that the Ministry of Civil Protection, of Climate Crisis and Civil Protection, it's a good thing to have this ministry. But what about practice? This is the gist. You are right. Right now, we were here to implement two big studies. Erosion of the coast. Corrosion of coast. Yes, we ended up with a complicated study talking about remodeling of streets and a bike lane. A similar study for Vrachneta. Two projects amount to more than 10 million euros. And right now, we shall earmark this budget so that contractors can have a job. Second thing, we set things in order when it comes to the different contractors and contract awarding in rivers and streams, because this is our main competence. When it comes to forests, no competence lies with us. If we mean to intervene in forests, our own services will tell Mr. Zaimis and Pharmakis, you cannot do so because you're not the competent people. You cannot even perform a study. So we have a serious problem. Let me give you some places we focused on. Alikes, Kato Achaia. We have proposed at the level of study what should be done. We have found resources, but we have not much yet to get in contact with the infamous TAD just to sign a document, in order to give to the municipality of Western Achaia all the competent areas. This has been announced, it has been published. All citizens do know about it because we do work for citizens. Apart from that, though, apart from pinpointing the problems, what else have we done? Let me bring you an example. May we see the slide, please? In 2019, early 20, there was a strategic plan for, rather under the framework of an Interreg, there was a balance that we could use. Where could we channel it? Civil protection projects, of course, focusing on the environment, but we broadened horizons and we said that we should include into that firefighters, port authorities and the police. We moved on with discussions with these three different bodies, tell them what we want, because what matters is what our service wants and how this can be included into the operational design for the next day. We moved on with a protocol and a memorandum of understanding with all three different bodies upon the approval of Athens, because you know this takes time from Athens, Patras and back and forth. And right now we do have a tender for the provision of drones, unmanned airplanes. The first region in Greece that will have drones, 300,000 euros is the total amount of it. Many people were saying that we will not make it. We managed to make it, and there will be the awardee. We shall start some pilot projects. Why? To have them for free for the port authorities, the Coast Guard, and the police force to fight natural disasters. When we started in 2019, do you know what they said? Well, this is the responsibility of the ministry. The other will shoulder this role. I told them, no, let us do our job. If the ministry says in all 13 regions we give you 5 million euros, then we could have paved the way through innovation in a practical way. Why? Because these will be gotten by the different bodies within 2022. And a final word, because I see that we're lagging behind. I could talk for many days about civil protection. Let me tell you that since we're dealing with European projects and European law, you cannot imagine what lies ahead for municipalities, how many new competences will come not from the central state, but from Brussels. Brussels, that is, the EU law, sees new competences. Let me give you an example about drones. We should be the supervising authority for drones as well, not just civil aviation, but also municipalities. And by way of conclusion, what will be our staff? What will be our resources? There is a huge issue here. We have to tackle it, and through our few financing tools, like the European ones, we're trying to find solutions in order to mind the gap. Yes, Mr. Barris, what about you? And the final word before that. Along with the mayor, we had a big campaign when it comes to the trees disease, a big disease. And, there has been a pan-Hellenic effort. We have informed all different municipalities. We have informed the Ministry of the Environment. We want to see what will happen to different trees due to this disease. Let us hope that you will get timely to the ministry before the disastrous effect. Mr. Barris, what about you?
Okay, so you have the picture of 19 municipalities of our region. What's the situation that you see? Good afternoon, everyone. First of all, I'm so happy we have this session here today, and would also like to thank the Peloponnese, the mayor, chair of PEDE, nagged a little bit in the beginning, and we judged him saying that, we could have done more. Anyway, I'll undertake part of that. So you're sitting at two edges. Well, anyway, we had a short heat wave during the last couple of days. And you understand from which part we went from arsons to floods and different phenomena that struck our areas. At the same time, we're wondering who's responsible for that. Who is to blame for having all those phenomena? And I know you know it so much better. Mayors and municipalities are to blame. You know that. But I'm not saying this to scare ourselves and the colleagues around here, but we need to see that this is where the answer lies. Since we're awaiting from the municipality, this is where we have to search. We have a new law of 2020.
Ότι μάλλον θα έπρεπε να είναι μέσα εκεί και το Υπουργείο Περιβάλλοντος.
The Ministry of the Environment should have been there. You can see that we have many deficits. If the region has one employee, you understand that the mayors, the municipality should have a few more. Anyway, we were on an emergency situation recently. We need to have more staff. Let me stress that. I can't possibly stress that enough. We are asking to have more people. There's clear violation of the way we are entitled to have more people. We ask for 5 posts and we only get 3, but we do not get an approval of the specialty of the people that we really need to hire. These people cannot cater for our priorities, what we have asked for as number 1, 2, 3. Anyway, there's also a question about the different plots of land. And already GEDE has come up with specific suggestions, and we can see that in all municipalities and in big regional or smaller regional municipalities, there's a question about clearing up the plots of land. And we're running the risk of catching up fire, and we might find ourselves heavily exposed. Now, finally, regarding the institutional framework, I think that in many different ways we have not been treated right. It has to do with how mountainous or insular a region is, and these two go hand in hand. And I do not mean any offense, but we have very much lagged behind. Mountainous regions have to get more help. I don't need to argument a lot in order to show that we need more civil protection. You understand the issue of arsons and floods and snow. I think it's quite straightforward. And Western Greece, since we're here as a regional association of municipalities, we are ideal for some work to be done. We have everything. We have floods, we have earthquakes, we have emblematic targets that could be used even as a pilot in order to try out several things. Financing should include at least 2 levels, although we know that civil protection needs increase. Funding remains the same, and in a distorted way as regards being declared at an emergency situation. Well, if not so, what civil protection are we talking about, and what can we foresee, and what can we deter as incidents? And it should be something that will run throughout the year. 72,000 is given for 600,000 streamers to a municipality of Erymanthos, where interventions are needed throughout the year. Let me mention that in collaboration with all bodies of our area, we have cleaned the streets, and we've had floods, and new needs come up all the time. 72,000 are not enough in order to cater for the needs of civil protection that you have throughout the year. Okay, and can we wrap it up, please? Yes, let me bring forward a point that I think is very important. Mr. Karamoskos mentioned earlier that regarding the destructive stage and the need for municipalities to run faster, we have had consequences of it coming out of a phenomenon, but at the same time we have to move fast. All areas that were at an emergency situation are asking for extensions more and more, again and again, in order for interventions to become more mature. This is where exactly municipalities need an immediate help. This could be also done through PEC or through the ministry, so that the very next day, when the municipality does not have the possibility to even document the needs, not to mention to intervene. And this is quite crucial. Mr. Mayor, we need to wrap it up here. Yes, it's very, very interesting. Everything is interesting, but we cannot possibly exceed the time. One last point, please. We need to conclude here. Yes. Regarding urban planning and where to put the RES. I think that new approach is needed here to the benefit of self-government, municipalities and citizens themselves. Please, Mr. Zaimis, let us disengage Professor Mr. Lekas in charge of Civil Protection Agency. We keep hearing you talk about a type of normalcy. What is worrying you? What's your main concern? There seems to be... Okay. All right. We can hear you now. The forecast is not very optimistic, and it has been described by the United Nations and different international conferences and meetings, also from the University of Athens, where with Mr. Kardalis we have developed a collaboration on issues of combination hydrogeological and geodynamic risks. The results that we have are not very ominous. We will be dealing with larger scale catastrophes at a larger time span than in the past and greater areas. And mainly, we're dealing with a combination of risks. That is to say, there will not only be one main risk in an area. On the contrary, there will be a combination of them, which allows for new approaches and operation plans and new plans of joining forces between the three levels of governance. A significant issue that we should attach particular attention to is the collaboration between scientific bodies that will be feeding with new data, all operational bodies, and many times with field data, while something is still running, while a natural disaster is running. And at the same time, there should be a connection between scientists and operational bodies with local self-government. So these three bodies will have to collaborate very closely at all levels so as to mitigate the consequences of all those phenomena that require to be brought to normalcy. Thank you very much, dear Professor, for being with us. And let us hope that after you have identified all these risks, politicians will listen to you and will prepare the competent authorities as quickly and as beautifully as possible.
First of all, I'd like to ask you to thank you very much for inviting me here for a short speech at this very important conference, and I'd like to thank all those organising this conference. It's a great initiative that mainly aims to promote the great challenges which the regions of Europe face. Unfortunately, due to some other work-related engagements and a COVID case I suffered, I'm sorry I can't be with you today, but at least in this way I'd like to address a short speech. Ladies and gentlemen, the climate crisis is here in reality. Those who have tried to project that it's not something that's very real have are just now seen as people spreading fake news. And I see that a lot of people have tried that, perhaps too much so, and now nobody actually believes them, given circumstances. Now, given the reality of climate change, which is becoming now a climate crisis, actually, more and more we see extreme weather events across the globe. I just want to say, for example, that a few days ago, California, perhaps the richest state in the US and one of the richest places across the world. It had mega fires. We saw these last year in Greece as well. And now in California, they're talking about an anti-fire season which is now becoming an anti-fire year, 12 months. So as you understand, this is what we're seeing now, extreme weather phenomena, which we're experiencing in Greece as well, such as extreme heat in last year's summer. For many, many days, we had temperatures above 40 degrees, which led to mega fires, and also, at the same time, severe snowfall in the winter, more than 70 centimeters of snows in Athens. We've never seen this kind of weather before in the eastern Mediterranean and to such intensity. So this is what we're called to deal with. And clearly, this climate crisis is leading to such weather, such extreme weather, more frequently, and this needs a different kind of approach, because these natural disasters that are caused by such weather are creating tremendous impact for the environment, the economy, daily life, society, and sometimes, unfortunately, lead to loss of life. For us, this is a priority. We want to avoid this at all costs. So this is the harsh reality. And of course, the region of Western Greece is also affected by this. So in order to manage this difficult situation of the complex challenges and risks of climate change, at the Ministry of Climate Crisis, we believe that one of the prerequisites is to adopt a holistic approach. A holistic approach based on a triangle: prevention, readiness, preparation, and resilience. This is a kind of famous triangle, is used throughout the world, and it's important to see how we can apply this given the particular features of each country, of Greece in this case. So this approach, which is our main aim, obviously, should be applied not only on a theoretical basis, but in each action and initiative that aims to manage climate change and to handle, to meet the risks that are related to climate change. As I've said, this is what we are trying for at the Ministry of Climate Change and Civil Protection, and this combines the traditional theory towards risk management, not only in Greece but in other countries, which placed emphasis on interventions and management, and it didn't emphasize prevention and preparation. Obviously, this could not be done in a country like Greece, which was going through a horrible financial crisis. Now, with this combination, more prevention, more preparation, these are the main tools and infrastructure we have to manage such extreme weather events. This cannot be done overnight. Obviously, this is a simplistic approach to things, but this combination should develop over time following a strict methodology. So at some point, we can have preparation and readiness, having this as a core of all the actions and of our holistic approach. So Western Greece and Ilia, the prefecture of Ilia in particular, has often been faced with very difficult fires, and this happened last year as well, last summer. To mitigate the risk so that we we can have a better summer period, we adopted this approach of prevention, preparation, readiness, and direct response in the region of Ilia and the region of Western Greece in general. So, we proceeded to large-scale preventive actions, which include the cleaning of forest ecosystems in Ilia, which is undertaken in the context of the Anti-Nero program, which is the largest program for preventive cleaning that has ever been adopted and is being implemented in the country. This program represents a collective effort and is the result of our collaboration with the Ministry of Environment and Energy, because we have the fire service, the forest service and civil protection together jointly, and they formed this ambitious plan. At the same time, based on this logic of prevention, we are putting emphasis on the archaeological sites across Greece and in Ilia. We together with Mrs. Mendoni and other executives from the Ministry of Culture and the Ministry of the Environment, we had a large-scale drill to see how a fire would be managed in the archaeological site of Olympia. So we're talking about very important global monuments that we have to protect. And if something happens, we should not allow any visitors to these to face any risks. So, in case there's a fire or another risk emerging. So, as part of this prevention approach, ancient Libya was set in as part of a program for the creation of fire protection zones together with another 11 archaeological sites. All this is done in collaboration with the Ministry of Culture, the Ministry of the Environment, and we believe that we're creating a set standard for the protection of all monuments in our country, and most of which are within our natural environment. So this collaboration was not something that was created this year alone. It's something that needs to continue over time so that we can have the best possible result to serve the needs of the natural environment and our archaeological sites. Ladies and gentlemen, risk management is a complex procedure that, as you've seen, requires collaboration and synergies, not in theory alone. It means that we must join forces towards a common goal, the protection of human life, property, and the natural environment. In this effort, where synergies between ministries are a prerequisite, the local government also plays a very important role. In my opinion, and given my experience, it is the main tool that we have in this protection mechanism. Without the local government, we can't have protection. It is. It cannot function properly. So, with this collaborator and with the collaboration of the Ministry of Civil Protection, we are attempting to renew this relationship at all levels and mainly as regards prevention and preparation. And let's not forget that we should continue with issues regarding direct response and management when we have an emergency. And this is what we saw. This is what we saw last Sunday here at Olympia. We fought against a difficult fire, and we managed to mitigate its effects as much as possible. So, the local government should be a part of this, not only as a partner, but as a main pillar, because they know better than anyone else the particularities and needs of each area. So its volunteers are absolutely crucial for when we have such difficult battles with fires. I don't want to take up any more of your time, but to sum up, I'd like to stress once more the concept of collaboration and synergies in tackling the climate crisis, and to say once again that we need preparation, and management to be able to head in the right direction. But we also need collaboration at all levels with the local government, the region and the municipalities. We insist that this is the right approach. We will continue to insist on this, and I think that as time passes, we will build an ever more efficient system to be able to serve Greek citizens in the best possible way. This system is being created to overcome undirected approaches. If we don't have a system, we won't have the desired results. Thanks once again for your collaboration over all this time. And on behalf of the Ministry, I want to say that you will have a dedicated partner. Okay, I think they're going to kill me. So
the minister said that local administration is not enough. It's deficient in order to achieve political citizens' protection. Anyway, so the self-government cannot be the scapegoat for tragic deficits. Yes, Mr. Papadopoulos says we have to go, gentlemen. The SMS system had been there 20 years was the time it took in order to have the 112. 200 million was given for the study regarding arsons and fire protection, and we needed to double the fleet of airplanes, firefighting airplanes. Thank you very much. Thank you very much. Money goes to the region, as Mr. Zaimis said. Municipalities that are the scapegoats get nothing. We do not have any resources because we do not have any direct DAO, if I may mention that. Please let us not start like that. I agree that if we expect from certain government, we will not achieve anything. We need to do something here at the within the region, in collaboration between regions and municipalities. Need to do something. Otherwise, we'll get to 7, 8, 9, 10 years, and these things that are urgent. People need to see immediate work. Mr. Lekas has given us a warning. It's a little bit scary. Mr. Romaliotis and Ms. Kalamepoulou did receive the message. Let us continue and let us collaborate as bodies. Thank you very, very much. Thank you.
Καλησπέρα σας κυρίες και κύριοι. Σας ευχαριστούμε.
Good afternoon, ladies and gentlemen. Thank you very much for being here. Hello to both of you who are watching on Streamline and those who are here by physical presence. Our distinguished guest, Panagiotis Dimopoulos, Professor, Vice Rector for Research and Development, Department of Biology, University of Patras. George Papatheodorou, Dean from the School of Natural Sciences, University of Patras, Professor of Environmental and Geological Oceanography, Geology Department. Mr. Ioannis Kokoris, Forester, Environmental Scientist, Professor of Department of Biology, University of Patras. Erotheos Zacharias, Professor of Environmental Engineering, Department of Civil Engineering, University of Patras. And Mr. Christoforos Kapopoulos, Founder and Managing Director of Aquaterra, to which I hope we get some time to refer to. Mr. Dimopoulos, a solution based on nature for national and sustainable development. There was a previous dialogue by self-government people, and all this is related between them. So we would like to hear from you in a very difficult era, as the ministers said earlier, with combination of risks. Thank you very much, and I'm very happy to be at this panel. We're talking about our country by referring to the European or global part. We have 27% of protected areas, and the rest is at maritime environment. And at European level, we'll talk about employment, boosting of competitiveness, and all this has to be done by keeping the rule of sustainable development of natural resources. And we want to improve competitiveness in our economies. However, the counterbalance has to be such that will allow for us to deal with social challenges, that is to say, biodiversity crisis and climate crisis. At the same time, we're talking about solutions that are based on nature-based solutions, because ecosystems have a huge significance. We're trying, and it's not easy, nor should we attribute numeral values to the value of ecosystems from 1997 up to 2021, up to $20 trillion is what we would lose if we didn't have these ecosystems. And let us say what it means to take actions that are based on nature-based actions in order to preserve resources that will be securing sustainability and at the same time crisis of biodiversity. So we need to have nature-based solutions. And what way can we achieve that? Those solutions may come up in many different ways. As an ecology professor, I'm always for solutions that are nature-based with only few interventions in natural ecosystems. So we're talking about the restoration of a forest in order to protect the coastline, or one could also give another solution with heavy construction in order to avoid corrosion of coastline. We could talk about the second type of solutions, nature-based solutions, through the increase of green zones in urban areas. Something that we should be implementing more and more in order to create a more viable environment, as well as green roofs, but things that are just really smooth interventions. Mr. Papatheodorou, he's a dean at the University of Patras, the School of Natural Sciences. Yes, it's a great pleasure for me to be here with excellent colleagues. And if you allow me, I'll start with some self criticism. Within the European framework, we have true legislative tools regarding maritime environment that are exquisite. We have the sea strategy that includes 11 indicators showing us where the environment heads. We have maritime planning. All of a sudden, we have solutions, nature-based solutions. I think we are trying to find a narrative because we cannot possibly achieve our goals. As our discussion goes on, although things are self-understood, are included in a nice narrative in order to convince people that we're heading towards the right direction. But aren't we doing it? No, we're lagging so much behind. I think that within the diversity protection and maritime environment reminds us more of the water drop torture. There's a very brilliant way to say nature-based solutions. We're trying to imitate nature and benefit from all the healthy ecosystems that it has and incorporate them in our development. But at the same time, this approach has a dramatic contradiction lying within. In order to find sustainable developments that are nature-based, we need to have healthy ecosystems. But if we delay, where are we going to find those healthy ecosystems in order to implement those nature-based solutions? We have to hurry up, therefore. We are in a terrible delay, and if I have more time in a second round, I'll refer to specific tendencies and applications that will be nature-based regarding the coastline and maritime environment of ours. Look, I think that we are lagging behind in management. We do not have the total knowledge that is required. We're also lagging very much behind it in terms of data. And we are very in great delay regarding not the implementation, but not the management, the implementation of policies.
So I'm going to continue with Mr. Theodoros Zacharias. I'd like to ask you, how can we make the most of nature to the benefit of growth and economy? At the moment, we see that nature has changed from what it was decades ago. First of all, I'd like to thank you for inviting me here to this excellent discussion panel with excellent colleagues. It was a very useful question because you used the phrase to make the most of nature. Now, I think that this is perhaps a mistake to kind of exploit nature for our needs. No, I understand. But this is what I wanted to give a trigger for discussion. Yes, because the last few years we had a great issue about how to exploit, how to use nature, because the dominant species, humans, had to serve their needs. But after 30 years of trying, we understood that by exploiting nature, we are creating climate change, extensive pollution, lots of problems to ecosystems. And so I started thinking, not in a human-centric way, but ecocentrically. So thinking about how we can protect the ecosystems in order to have a symbiotic relationship with them, because we can't just exploit them. Yes, but we haven't stopped exploiting them. No, obviously not. And I think that this juncture is useful. I don't know exactly, but I think that the EU has decided, probably because of climate change, that the only way forward is together with nature. And for this reason, it is funding programs that concern natural systems, natural solutions, nature-based solutions, in order to make as few mistakes as possible, fewer than in the past. I'd like to remind you that we have effected a huge destruction on nature, and perhaps now is the best opportunity for engineers and specialists on nature of all types, all kinds of scientists, to be able to collaborate to build systems that will be eco-friendly and very eco-friendly. So have we learned our lesson from what we've done? Have we? We've learned a lot, but we haven't learned exactly how ecosystems work. And this is a lesson that we need to learn every day, because it's the only way to survive on this planet. Sorry, I called you by the wrong name before, but yeah, so we've learned some things, but not all that we should. Yes, I believe that all the problems that we see around us are a great lesson, and perhaps society is gradually heading towards the right direction. I see now that there are financing tools for ecosystems. There's legislation about natural systems. We've seen a stop to this war we had up until recently. There was an argument that natural systems are not very efficient, or that they cause pollution problems. Today we have the technology that can help in the direction of nature-based solutions and not grey technology. Although I'm in the civil engineering department today, green technologies is what's going to help most in the right direction. Now, Mr. Kokores, he is a forester and environmental scientist. I'd like to ask, unfortunately, we've seen lots of forest fires. Last year was horrendous in Sterea Elada. We saw this on the island of Evia, but forests give life. What's your opinion on what we're discussing? How can we have a growth through forests? Thank you very much for inviting me to this excellent panel with my excellent colleagues. What you're saying about forests, it's we've known this for a long time, and nature-based solutions for managing any kinds of disasters created by nature or by humans, and this is also now part of the solution that we can use. So nature-based solutions from 2002 and onwards, we use this. We call that the international bibliography literature accepts this term. So when we're talking about the restoration of extensive damages to natural ecosystems such as forests, the first thing that the state does is prevention with a natural way. And what I mean by this is to prevent the direct effects such as corrosion and the degradation of soil that's affected by fires. So these are traditional techniques such as felling trees and putting them in specific areas to build barriers to avoid corrosion and to keep the surface soil in the area to allow for the regeneration of the forest in a natural way. So the solution is helping nature to restore the ecosystem to its previous state. Now, regarding what you said, how can forests be part of the solution to the problem of climate change and the loss of biodiversity? The increase of forests is obviously contributes decisively to CO2 absorption. So the correct management, the growing of forests and the selection of the right species are decisive in this direction. So we leave nature do its thing, so instead of using artificial means to do this. But apart from forests, Natural ecosystems, as the previous speaker said, do offer many other functions as in developed and developing countries alike. There are many such solutions in the States, in South America, and Asia. Forests are used to protect beaches. Others are used to protect biodiversity, to create jobs for the local population, and to mitigate the effects of climate change. These are decisive in this direction. It's very important to protect forests so that we can count on them in the future. Because the issue of protection, I don't know if we'll have time to talk about this in this session, but I think that it's very important. Exactly. Just briefly, I'd like to say that these actions are financed by specific tools in Europe and in Greece. Apart from the strategy on forests, there's also the Common Agricultural Policy, which includes a lot of things on natural ecosystems. Laws have been passed, and there are tools for actions to protect coasts and coastal forests. There has to be a buffer zone between forests and beaches. There are financing tools for island forests, old trees, and in the forests and the managed forests, 10% of this, there's actually a financing to preserve 10% of this part of the forest without being planted and to preserve the dead wood. Now, moving on to Mr. Kapolopoulos. He is the founder and managing director of Aquaterra, which provides advice to the private and public sector on such issues. And we'd like to ask you about how important it is to have appropriate designs for preparing such projects. Thank you very much for having me. It's a very interesting conversation. All colleagues are very dear to me, and they're pioneers in what they're doing through their actions. Have been following their work for many years. We have consciously chosen, we had two roads we could follow as a company. One was to continue to design technical projects on coasts, where we had traditional hardcore solutions dominating. So we selected, perhaps 20 years ago, to opt for mild, environmentally friendly methods, which offer many solutions, many advantages. Based on the European Code of Conduct for Coastal Zones, which was established in 1991, and this set the foundation for a different behaviour by humans, especially as regards coastal zones, which has to do with biodiversity and corrosion. This meant that we actually were in conflict with the existing status quo at that time, because we tried to implement these rules and to promote them, to make them better known to those in power and to the decision makers. This was not easy. Did people not really take well to this? Yes, they did not, in our region as well. So we went to other areas apart from the region of Western Greece. Wherever we could, we managed to do a lot of things. We've got a lot to show for what we've done. So 20 years later, we managed to work again in our own region and to be able to implement our experience, our know-how that we gained from other regions of Greece and from the west coast of the US, where we had worked in 2013 and 14, in California and Long Beach. And we took the techniques we saw there and the knowledge, and we managed to take all this information and to transfer it and implement it in designs that we prepared for the region of Western Greece. And we hope that these projects will go ahead and we will have an improved targeting of projects following best practices such as those that we'd read about and noticed in other European countries and in the States. So when you're talking about mild type projects, yes, what we're doing, we are designing underwater solutions. So these are very smooth. They don't have any rough edges. So this does not affect the coast, the part of the coast that is used by humans. So we're talking about projects that are designed to collaborate with the natural processes of a coast. This was actually a difficult problem to tackle. The old planning of such projects was just based on empirical knowledge. We managed, working on computational methods, to use some models that we developed on our own in some cases. And based on this software that we created, we managed to correctly plan and design as far as, this is what we believe as well, based on international experience. So we designed the interventions that should take place. This is something that is ongoing. So we are constantly investing in technology, in solutions protecting the environment without creating any barriers to the movement of water and any materials that we have on the coasts. We don't want to obstruct the operation of the coast, and we respect the coast. As Professor Zacharias rightly said before, what we should focus on is that we should make as few mistakes as we can. In our profession, it's not possible not to make mistakes. We learn through our mistakes, but these should be limited, and as much as possible, they should be small-scale mistakes so that they can be reversible, so that we can correct them at any moment. Yes, not to be crucial or decisive, yes, and not to exceed the breaking point of the ecosystems, as Professor Dimopoulos knows. So we try to respect this. We try to be true to what we started 20 years ago, and I believe that as time passes and as we see the needs created, we will have the opportunity to intervene in a creative way without harming the coastal environment. Thank you very much. I'd like to return to Professor Dimopoulos quickly.
Mr. Dimopoulos, your university students, by graduating, what would you like them to have in mind, mainly? What do you think should accompany them when they start doing the profession they have chosen? Look, as we can see during the last few years, we haven't taken any drastic measures in order to mitigate the changes, whether we talk about the global change, mainly regarding the wetland destruction and so on, or the climate crisis part. Now, very urgently, we need to take measures. This is why we need to have nature-based solutions. What is also important and was mentioned here, and I would like to stress a little bit more, is that we all realize how important it is to have different scientists working together. Once upon a time, just engineers thought that by themselves they could perform miracles. Now everyone realizes this is not enough. So nature-based solutions are mainly mild, soft solutions, need engineers as well, but also geologists, foresters, and so on and so forth. So at the same time, let us not forget that nature-based solutions have been adopted by many governments the strategic plan. But what we need is an implementation, and exactly because the public sector has adopted all this, we need also to bring in the private sector. Always, of course, within the framework of the state control and coordination of the state. Anyway, about our oceans and seas, if I asked you to give us a title about the status of Greek seas, what would you say? I would say that their condition is truly very well. Taking a look at neighboring seas, truly we're in a very good condition. We have a very high level of health in our seas, and so long as we all implement what we have just previously said, nature-based solutions. And I will turn my eye towards the Ionian archipelago, the west side sea. How could we possibly implement the nature-based solution? I believe that the example is very, very easy. Even if I tell you, you already have it all in mind. Since it's common sense, it will also work in action. First of all, nature-based solutions on coastal zone. One can only think of 4 to 5 examples. One example could be designed in Western Greece. I'm referring to Posidonia algae, those fantastic underwater forests that keep this blue carbon and release oxygen in our seas. We should protect them and promote them. But before we get there, and this is the great problem of maritime environment, is that we need to map them, study them. Have we done that? And with what accuracy, what level of accuracy do we have? For instance, the Cyprus Republic has just concluded the overall mapping of the fields of Posidonia in all of its extent. So Mr. Kapopoulos said we need to protect our coasts. Several coasts do not need any protection. Protection from what or whom? Is there an enemy? No. Natural processes are not an enemy. People are the problem. If we withdraw from those coasts, we do not have the corrosion problem. Evidently, we need to manage it because 75% of people live ashore. But as the case has been in several areas of Europe on nature-based, we need to have a hard element. What could that be? The knowledge of maritime environment. Otherwise, whatever we may plan is doomed to fail. And insinuating what Mr. Karpoulos said earlier, let me say that for 30 years we've been designing for the corrosion of coasts in Western Greece without having ever put underwater a wave recorder. So we need to monitor all levels of maritime environment in order to be able to design nature-based solutions. Mr. Zacharias, it was heard earlier about what was said about the collaboration between engineers and other disciplines. Is that feasible? Well, this is my hope. If we want to truly talk about natural solutions, because engineers can construct, but they cannot possibly understand how nature works. So unless they collaborate, unfortunately, we will continue to be on the same track as in the past. So we were not going to have a very pleasant solutions. So allow me to say that morning to night, I talk with colleagues, trying to convince them that we need to collaborate for green solutions. It's not always very easy, but I'm sure that the new generation has got a different attitude. But if we want to talk more specifically about those natural solutions, these could be the ones replacing or work hand in hand with older constructions. For instance, a waste management facility could be executed in a different way. For instance, we talk about natural systems for waste management, mainly wetlands. So a natural wetland could receive secondary process waste and decrease nutrients from a plant that would be processing them. So we try to mimic some more natural or second-hand ecosystems. Lately, in environmental technology laboratory, we're running a program that where we're trying to create materials that or use materials that are natural and can absorb pollutants that have been already produced. So we no longer consider wetlands as useless or problematic areas, mosquitoes and so on and so forth. And with the Marshall Plan, we created agricultural land that after 30 years we realized that they rather pollute our seas and create more problems. So new constructions, green constructions, and this is why in my department we talk about sustainability of construction, meaning that they will be fully harmonized with nature, mimic nature, and will be very properly bonded and with nature, and they will continue to do so not only for a 5-year period, but they will be abiding with those rules for longer periods of time. I will conclude with Mr. Cordes and what he said regarding the title of our session, nature and the possibilities that we may have despite the pessimistic messages we have been receiving lately. The message from my part is clear. We have the know-how and the human resources and the infrastructure and the political will to look for such solutions, look at all the projects that are funded by international funding organizations, restoring ecosystems during the preparation and until the completion and after what all the works have been concluded is a must, and at the same time also saving on natural resources. And pertaining to what Mr. Achaia said, in New York they had an emblematic project for a biological treatment. Such a plant would exceed 10 billion, and now they have managed to have overcome budgetary issues, and on top of that, even making about 100,000 euros annually. We do not have any more time to go further. I think that we have listened to very interesting issues. I would like to deeply thank Mr. Dimopoulos, Mr. Theodore, Mr. Kokoris, Mrs. Zacharias, and Mr. Kavopoulos. Thank you very much. Have a lovely afternoon.
Καλησπέρα σας. Σήμερα...
Good afternoon. We shall start today referring to some European projects that not only bring our country closer to Italy, but we also try to offer projects and services for citizens and businesses of the area. We have Ms. Angeliki Bouziani, who is in special secretary for coordinator Interreg for Greece-Italy program, and Mr. Gianfranco Cataletta, who's from Bari, in charge of those Greece-Italy programs. We shall start with the lady of our company today. I'll make a first question to her, and then we'll start a discussion. Ms. Bouziani.
So, Mrs. Biliani, you've been in that position for many years and in the public sector in general. How do you think we can correct the mistakes made in European programs in the past? How can we offer added value to projects? How can citizens and business people in the area experience these better, especially in the new programming period? Thank you very much for inviting me here. Normally it should be Yorgos Zervos in my position, but he couldn't be here. As he said, European programs have been a thing for many years, but unfortunately not many people knew about them, and I think this is what was their main problem. When we're talking about cooperation programs, we're talking about cooperation between citizens of different countries, and this is their biggest advantage and their biggest difficulty, because to have citizens from different countries come and work together with different mentalities, other languages, other habits, and geographic distance, these are difficulties we need to overcome in order for these programs to be successful. Another main problem presented during the implementation of such programs over the years is the difficult procedures that have to be followed in order for these programs to be implemented correctly based on EU regulations and European Commission regulations and the domestic regulations of each country. The beneficiaries have an added difficulty in facing all this bureaucracy involved, and of course the fact that to have a common language is the English language, so there's a gap as regards the beneficiaries trying to follow the procedures in English. I believe that citizens, businesses in Patras, in Agrinio, in Perikos, and the citizens of Italy in the Puglia region, do you think that they understand that this program helps their daily life, or does this information not make it to the ears of citizens? It should reach them. This is one of the main directives of the European Commission, that we want the results of these projects to be disseminated to citizens and for citizens to know that their EU funds are making their life better. The efforts for the dissemination of the results, not only the results, but of the possibilities for citizens to participate in such programs, are efforts that are continuously growing. We believe that we have enough publicity, but it should be improved to become better known to all citizens. The public, businesses, citizens. So if citizens and businesses understand that this money that is disbursed from the EU betters their life, would they not put more pressure on the governments, on the EU, to increase this sum? And because I think that it's dropping now, the amounts we receive, I think. Yes and no. The European Commission has understood the importance of Interreg programs. We have a 30-year anniversary of Interreg programs. Unfortunately, COVID meant that we couldn't have many publicity actions to celebrate this anniversary, but we hope that we will have this opportunity this year. So the significance of these programs has been acknowledged the sums in the context of the overall crisis are reduced in all programs, not only the Interreg programs. We still have enough resources, but the methodologies used to allocate the resources to states are being negotiated between countries, and unfortunately in the next programming period we saw Greece have fewer resources, but I believe that they will be used correctly with better results than in this period. Do you believe that the role of the regions and of specific authorities, such as the chambers that are more actively involved in these, should they have a more key role in the consultation preceding the projects? This consultation was very lengthy, not only for the regions and the chambers, but for all stakeholders, citizens who had access to the material and they could make us aware of their needs and their concerns. We believe that still now, because you know that some things have been submitted to the European Commission, we received the first comment. What's the sum involved? Yes, I will tell you, but it's not only the Greece-Italy program, Greece as a country. The region of Western Greece is participating as an eligible region for the Greece-Italy program, but the region of Western Greece is participating in other Medemi, Arka. I'm giving you some program names that you might know in Black Sea, I think. So we have transnational programs in which Greece is not a leader but is participating. But then we have the Greece-Italy program, we have Greece-Fyrom, we have Greece-Cyprus, Greece-Bulgaria. So the overall budget, if we want to look as the sum of EU and local participation, is about $500 million in transnational and transregional programs overall for both countries. Yes, for all countries, yeah. Now I will move on to Mr. Gadaleta, but I'd like you to think about 2-3 specific projects, characteristic projects, which perhaps are the ones you liked and that were greatly successful. Now, Gianfranco, Mr. Gadaleta, I would like to ask you, because you too are an executive with great experience in public government, and you know you have experience in the private sector as well. You're a key person because you are called to solve problems on the one hand, and on the other to help in drafting policies. In a couple of words, what's your experience overall these years, especially for the Greece-Italy program that you're deeply involved in? Are there common elements between the Greeks and the Italians in this program, or is it just problems?
First of all, thank you for your kind invitation. And yes, I have to declare I am very excited and satisfied for the work that we done during this period. We kept several good projects, to be honest, with a lot of results. And I'm strongly also convinced that in the next programming period we can continue in this way in order to also to capitalize several experience that we had. In every case, we should underline also that in the next programming period, to be honest, is this programming period because it's 2021-2027, but I'm strongly convinced soon we will be ready in order to launch the first calls. And something will change. Something will change in this way because we will try to simplify more the bureaucracy, the activities in favor of the beneficiaries, of course. And also we will continue in our collaboration also in the health sector. we started during the pandemic. All of us, we can't forget that during the pandemic was very difficult for all of us, not only for the managing authority, the joint secretariat, but we should think also for the project, the citizen, for all of us was very, very difficult. We kept this possibility in order to simplify something, also for the procedure, for the activities, and we should continue in this way, absolutely. And a big signal that we will give for the next programming period is the fact that we will have the small projects with the lump sum. Where we will apply, we will continue, and we will improve to apply the simplified cost according the rules of the European Commission. And of course, a great emphasis will have during the next programming period the environment, the social innovation, the tourism, the culture, the competitiveness, and the innovation in general. And will be the great issues. Yes.
Θα σας ρωτήσω ό,τι ρώτησα και στην κυρία Μπουζιά.
What I asked Mrs. Buziani as well. If you think that these programs and the money we've spent through the regions, through the agreements, the chambers, the companies involved, does this result reach the citizens and the businesses of the target area? Do citizens and businesses feel that their quality of life is improved?
Yes and not. Both, to be honest. First of all, but the most part of the people that I spoke also in the past know very well my position. First of all, we should improve our impact and effect of the communication activities. First of all, it's unbelievable, in my opinion, that after 30 years, the most part of our citizens, both in Greece and in Italy, if we start to speaking of territorial cooperation, they start to see us with a face like a question mark. Even if we start to speak like for social fund, ERDF, regional program, they know very, very well. It's unbelievable that. And so first of all, we should improve, all of us, not only as managing authority, joint secretariat, but for first the project, because the projects are our first link with the citizen, with the territories, in order to communicate well, better, and in a modern case, not like with only leaflets and so on, but we should improve our use of the social network and so on, in order to give the possibility to all the citizen in order to know well and better. Also, we should also underline, and for this maybe my answer is a bit different coming from Angeliki. In my opinion, also the European Commission has a bit of responsibilities in this way. Why? Because in the past, they underlined and they also give a great impact, especially for the regional program or national sectoral programs. The communication activities coming from the European Commission for the territorial cooperation, apart the cooperation days, apart for some specific events, they didn't talk about the territorial cooperation. And this can be a damage, because in my opinion...
There is a shared responsibility.
There is a share, of course, as always, we can't... After 30 years, it's not possible to declare the responsibilities coming only from the project or from the managing authority. So it's a share of the responsibility, of course. But in every case, also, apart these specific events, the communication activities coming from the European Commission, they underlined the utility of the social funds, for example, or the European regional development, or the national sectorial fund. Never apart these specific events from the territorial cooperation. And this is, I'm very sorry for that, because the added value of the territorial cooperation is is higher than the other program. Why? Because the territorial cooperation, the goal of the territorial cooperation is in order to create a link, a specific network between the countries. And when there is a specific link, specific network, coming also an increase of the trade between the countries.
Ξέρω ότι έχετε συμβάλει.
I believe that you have contributed significantly, especially during the pandemic, to the going forward of a plan for the hospitals of the areas, with equipment to hospitals, which is necessary. And this is not the key priority of the program, it's not health, but this was a contingency plan. So you contributed through the program, the internet program, to channel equipment to hospitals. Why did you do this? Do people know about this?
I didn't know if the people, the citizen, know that we immediately try to give an immediately response with fact, with some equipment directly for the hospital. And this is the most important thing. And so we discuss a lot with the European Commission, the national authority, because in order to be sure that there was not an overlapping of some of the funds in order to buy this equipment. And in my opinion, I was and I'm strongly convinced, also the managing authority, of course, we are and we was and we are in the right way in order to be very, very close to the needs of our citizens. This answer, let me give also the opportunity in order to underline that we will continue in the activities of the health also in the next programming period. But we should improve, we should grow up with these activities, not only with the equipment, with some primary service for the citizen. We should continue in order to have with a macro-region approach, in order to have a common approach for the home care of the people and the e-health of the people. And for that also with the second project of the for the health, we also start for a close, a very strong collaboration between the hospital, the Greek hospital, the Ministry of the Health of Hospital, and the regions. And I can also announce that the 21st of June will be in Bari, the first meeting between the Puglia region and the Ministry of Health in order to create a common platform for the home care service for specific pathology for the people. I strongly believe due to the fact that we will have a common approach, common service, common platform, or if it's not possible to have common platform, a platform with a compatibility in order to share data between the countries, will be very useful, not only tools, but will be useful for our citizens, for the life of every day of our citizens, for one hand, and for the other hand, we can start in a really concrete way in order to think and to organize a different type of tourism, the health tourism. This is another type of tourism, a niche of this type of sector that we should explore in this way.
Κυρία Μπουζιάννη.
Ms. Bouziani, who do you think, or what do you think are the most significant projects that are taking place or have taken place or are being concluded that have contributed to raising the life quality of citizens? And have you had difficulties until those reached to the end? Look, truth is that for us as manager, all positively evaluated projects are equally important, and it would be unjust to make a distinction between others. all those that have been selected have their own significance. As already mentioned, the Greece-Italy project that we're talking about has had actions in many sectors, be it health or culture, trying to always adapt itself to specific conditions due to COVID-19. So we've had specific tools where infrastructure, remember we're talking about small budget infrastructures within the framework of Interreg, but we always have in the back of our mind that these are in intercomplementarity with other projects, and of course collaborations and exchange of experience is paramount within this framework. So I should refer to what Jeff Franco said earlier, equipment purchase that was paramount in order to deal with the pandemic, and of course the collaboration between the two companies. Yeah, and this also shows this sensitivity, the awareness between the two countries. We always say that the European Commission is a rather rigid large boat, but we managed to do it. And what was significant in it, apart from buying the equipment that was necessary, because it's for day-to-day use that citizens need in order to receive crucial services from the health system, but it's also what comes from the collaboration of the two systems. Apolia and Greece are trying to have a common platform and common strategies and common ways to deal with whatever may come up in the future. That is to say, exchange protocols and try to collaborate so that if a citizen goes to Italy, will know how things work in Italy and vice versa, or they could even exchange information. So you're optimistic, meaning that in terms of quality, the next program period will be better, and that we shall correct all delays, and citizens are going to see improved results. Yes, we are certain, because regions do have an experience now. It's a collective work, I think, and so far as I have participated in it during the last 2 years, I can assure you that all those involved in the process, from managing authorities, the Joint Secretariat, the European Commission, all the antennae that are in Patras and elsewhere, and the staff that puts so much time in it, the staff from the regions, the involved bodies, this is truly a collective work, and it happens for the people of the area. Mr. Gadaleta, he did not answer to my previous question whether the Greeks and Italians share things in common, and whether this program, Interreg Greece-Italy, does it bring us any closer? Do we resolve any problems, Mr. Gadaleta?
Problems? No.
Okay. And do we solve some problems?
Solve, yes, always. But in every case, I should, to be honest and frank, it's possible to solve the problem when there is a collaboration between all the people and between the beneficiaries, between the managing authority. Of course, we found several problems in order to solve, but we did it. We did it. And I would like to add something also for what I told before from Mrs. Buziani. I'm more than optimistic in order for the next programming period, for the quality of the project. I'm very, very optimistic due to the fact that also we underline and we check it, the most part of our territories are ready in order for the new challengers, for the challenger about the circular economy, for the challenger about the e-health, the challenges about the green port, the challenges about for the new type of tourism and culture. So the competitiveness in order to create also, and also for some training for the younger people, to create startup. I'm strongly convinced that we will do it better.
Πότε πιστεύετε θα βγει η πρώτη?
When do you believe that the first invitation from this project is going to come? You mentioned circular economy, telemedicine, e-health. Which sectors are going to benefit more? When do you see the first announcements, and what are the sectors of priority in your opinion?
In my opinion, but this is my personal opinion, due to the fact that the call and the priority, we will follow what will decide both the national authorities and the member of the monitoring committee. In every case, in my opinion, in order to give an holistic answer to our territories, it's better in order to launch for all the specific objectives of a first call, but not only a first call like the past. We should have more call, but a first call with all the specific objectives that we have in a we plan it. When, of course, it's better to declare, because we respected the timing given to us from the European Commission. The 1st of April, if I remember well, we sent formal to the European Commission the program. And to be honest, informally, we sent last year. So we was ready. We were ready. And so we sent formally the 1st of April. Just a couple of weeks ago, the European Commission answered to us with comments, not very minor comments. We are ready in order to answer. We answered, or we will answer. We will send the answer.
You are very diplomatic, so I believe that I will give the opportunity also to Ms.
I will. You're very good. You all.
Date of the first call.
I estimate that the programs will be ready for their second submission at the end of July, including the Greece-Italy program. Our estimation is that they will be approved by the European Commission in September, and about a month after that, having set an operation this year. Yes, this year. We will have the first calls for all programs. This is our goal this far. This is the goal of our service and of the ministry to which we belong. Thank you very much to both of you for this brief, but I think highly informative session. We've got many things to do still. I believe that this program should be boosted with funds, and the government and the European Commission should offer more funds and more staff. And our responsibility, and I mean the region, the municipalities, the chambers, the companies, and the universities should communicate this better, so that citizens and business people could understand that this money is for them and not for those involved as intermediaries in the project. Thank you very much. okay.
Καλό σας μεσημέρι, με πάρα πολύ μεγάλη χαρά συμμετέχω και...
Good afternoon. It gives us great joy to participate this year, and I would like to thank you for your invitation. Mr. Luludis is the publisher of the newspaper Polyponosis in the region of Western Greece, and I say that we were talking about something that's a bit scary, AI and humanity and AI, and the exploration of this new relationship. I'm going to have with this conversation with great guests, Mr. Yannis Mastrogeorgiou, Special Secretary for Strategic Foresight, Mr. Michalis Bietsas, Mr. Sergios Theodoridis, who's a professor chair at the Airport University, Mr. Dimitris Emganos, and the president of the OFADOS, and Diana Voutirakio, the founder and general manager of Unique Mind Software Development. So this is an issue that many in Greece do not talk about. They might not want to talk about, and maybe not only Greece, maybe it's Europe as a whole, because it's different to talk about Silicon Valley, and it's different to talk about Europe. Mr. Mastrogeorgiou, when we're talking about AI, should we have some boundaries that should be set in the development of AI? Good afternoon. Thank you very much. I'm going to say a couple of seconds that I would like to thank. I would like to thank the guests because I'm very happy to see them even digitally in this meeting. Definitely, I believe that AI as a concept, as an idea, as a use, is here to stay in the coming years. It's going to be the hottest topic that we will have to discuss in technology and relationships and daily life and life as a whole in any, shall we say, manifestation of our daily lives. Already we use it and it's used in ways that we think very simple, and we don't think about like our mobile phones, which has a huge computational capacity, and AI. We produce data every day, all day. This feeds AI. The algorithms are fed with all the data that we generate. Obviously, there's fear. There's the fear of the unknown. There's the risk and the danger produced by the erroneous approaches to and uses of AI in our lives. It's due to otherwise excellent Hollywood films, yes, and they're just doing their job, obviously, but I think that the next few years we should gradually move on to a world that should have more IA, so intelligent assistance, than artificial intelligence in the sense like Schwarzenegger in The Terminator, who will come to destroy us all. I believe that we should quickly read an article by Michalis Pletsas about this in the EU and what's happening with the AI Pact. We should have guidelines. We should start the discussion about this. It's already started in the depository of the EU. You'll see in the OECD depository there are 700 papers on AI. 60 countries have created their own policies, and Greece is one of them for AI in the coming years. We should not be afraid. We should focus without fear, but with passion, but not with fear. And we should take careful steps, and we should not try to mimic smart machines. We will never compete with machines, and what we want to do is to boost what we as humans can do better, and this is what we need. And I will now move on to Mr. Pletsas, who at the European Parliament already, they've done a couple of things on this. Mr. Pletsas, how could machines and humans coexist creatively? AI in its current form is a necessity. When we produce such huge amounts of data, to be able to export useful conclusions and useful information for this, we need tools that will be able to see in a multidimensional level. It's the simplest way to put it, on more dimensions than humans. But that's where the challenge lies. How can we use this productively? Recently, I saw a publication by the MIT that says that they managed to, with an AI model based on chest x-rays and x-rays in general, they managed to predict the race of the patient. The people who did this project tried to understand how this happens because they were doctors and they couldn't make sense of it just by looking at x-rays to guess the race. They changed the images. They said maybe it's the bone density. They used filters for the photographs to hide the bone density. But again, the AI model managed to predict the race. This is a two-sided finding. It can be useful if there are diseases that are race-specific, and it also has the it's really bad because if you have racism, such as in the States, over the past couple of centuries, the States has been known for its racism. So this is a huge problem if you don't need that information. And why am I saying this? Because the European Commission is asking the European Parliament, the directive that we have, the guidelines, they want AI algorithms to be explainable. But these algorithms will never be completely explainable. So it is necessary where we have such decisions, where it's algorithms taking the decisions, we need to have a human in the loop. And I think that one way is to talk about extended intelligence, so algorithms combined with humans which assist the procedure. Okay, I understand. So machines, AI, see things that people cannot see, but you stress that there's always has to be a person there to help. So on that, I would like to ask Mr. Theodoridis, can AI replace human thought? Just a second. Although I work in IT, but I'm a bit slow with all this technology. We can hear you well, though, and we can see you perfectly. Oh, that's a very interesting question. Perhaps with what I say, I might do away with this fear that exists at the moment. So a couple of things that perhaps the public doesn't know about. Historically, AI studies started in the 50s when the pioneer Alan Turing set the question, can machines think? It was then when people started thinking about making thinking machines. So they were trying to understand the mind as an algorithmic process that processes data. So despite the advances in the industry then, they reached a dead end. First, because the procedure of thought cannot be standardized as an algorithmic procedure, and also because the number of required combinations were beyond the capacity of any existing or future computer. Another issue is that the concepts which we're handling are not distinct symbols. They cannot be quantified, determined so strictly because they are context dependent, which if they have an objective, if they don't have an objective reality that we can feed into a computer, what we call machine learning, and this is what we used, the only thing that machine learning machines do is predictions. So their intelligence is akin to conducive logic. So if the sun came out yesterday, so it will tomorrow. Based on the data collected, we learn statistical quantities and then they predict. But what we're saying that machines are learning what exists in the data, but this data has been collected by the programmer. When, let's say, for example, a computer is to predict an image that it has a cat in it, what has it done? It has learned the features of a cat. What are these? Just to simplify things, it's the color, the texture of its fur, its nose, or any other characteristics, as Mr. Bletsus said, that we know. Or it might be features that the system has learnt by its own. But to train a system like this, we need to take thousands of pictures of different cats to train it. But human intelligence, apart from the capacity of thinking, which machine learning machines do not have, human mind can interpret and explain things. So it creates hypotheses and verifies these. Human intelligence is characterized by the ability of the mind to create concepts and ideas, codifying generalization and handling these, because we are universal interpreters, because we interpret a wide spectrum of things to allow for generalization. If a child can learn to recognize a cat the moment it sees one, it doesn't need images of thousands of cats. This was an evolutionary process for the human brain. It can handle abstract concepts and ideas, and above all, through the use of language, human intelligence can interpret the world around it. And this is the main difference between human intelligence and machine intelligence. It is creation. And this is the essence of human intelligence. each human has self-understanding and can self-create. The human mind can continually learn in an ever-changing environment, which machines cannot do up until today, at least. And above all, the human mind can learn with patchy data, which machines cannot do to date, at least. We are working on allowing them to do that, because the human mind created mechanisms that do not only use logic, but feelings and intuition in a way that's not fully understood. The main characteristic of human intelligence is not conductive prediction based on previous experience, but the creation of the ability to use previous knowledge, not to mimic, but to generalize, to provide meaning and explain. Humans can handle concepts, and in contrast to machines that just apply statistics without understanding. So if machines are to replace human intelligence first, they must have the corresponding skills. Is this possible? Perhaps, maybe in the future it's possible, but then there will be very important moral questions to face. Maybe later I can talk about this. And of course, moral issues are a very important part of this discussion. But I think that we understand, based on what you said, that in essence, it's the human mind based on the ability to create the human intelligence. But now I'd now like ask Mr. Serpanos, what do you think are the boundaries of AI, and can there be some barriers to this? To supplement what the previous speakers said, I'd like to say that in essence, the aim of AI, as it's been determined over the past few decades, during its development, of course, has not been achieved so far. So the understanding of concepts is a target that has not been achieved yet, and it's too early in the course of the development of AI technologies. And we are at a stage where now statistical methods mostly is what is used in such systems. It is exactly this, that we have a lot of mathematical support, and there are capacities by such systems have aided such technologies to be applied in a wide spectrum of uses. These uses can be perhaps very benign applications, shall we say, in the creation of some systems, or in marketing, or in other actions. But it's important that now they are starting to enter key systems which present great criticalities, such as autonomous vehicle systems, aeroplanes, as you know, which creates problems and possibilities in case of failure, even of loss of human life. This means that the application of such technologies must be constrained by some rules. But this, I want to say that this is my personal opinion. When we're talking about research and development, which evaluate these boundaries of what can be achieved by specific methodologies, there should be no boundaries in R&D. But they should only be constrained by the initial moral regulations set for any research activity. But in the context of their application in daily life, definitely there are many factors to take into account, moral and social and legal. And some of these start with a simple question, which is one of the motives for this discussion. How can this technology be accepted by society? This is a multi-leveled question, and it can be a very technical question apart from anything else. In any case, because there's an issue also of responsibility and accountability in many applications, obviously in natural systems such as cars, airplanes and other applications such as asset management, the insurance sector, etc. There, we need to have specific regulations. These rules in this direction raise the question of how we can handle the methodologies in terms of procedures and legal restrictions, because indeed, as Mr. Blitz has said, there are many methodologies that we cannot understand fully yet. But there are others which we can understand and use to prove mathematical features in our systems, and these are part of explainable AI. And definitely, these can help determine the specific contexts of use. As regards the rest, I agree, and I would like to stress this, that AI is definitely useful, but where it cannot be fully understood and its contribution cannot be fully understood, or even when this should be, for example, in the legal sciences, I think that there always should be a human in the loop and that will take the final decisions. So I understand that humans are in a key position there. Yes, definitely. And as we said, there should only be moral boundaries in research, but in the application we have to look at the context. So, for example, if there's a driverless car in Greece, don't know if this would work in the roads of Greece, but I would also like to welcome Mrs. Vutirako, and I would like to ask her, to what extent does she think that AI could be democratized? What should the state and citizens do?
Good afternoon. I would like to thank you for the invitation. It's a great pleasure for me to be part of this panel. Adding up to what the previous speaker said, to me, we must somehow remember what Mr. Earthworthy said. When we're talking about machine learning, we're talking about predictions, forecasts that use data created by humans. And to me, it's very important to stress how this data can be subjective, not to mention that they can be biased and reproduced through an algorithm of machine learning. Now, as far as democratization is concerned, to me it's very important to have a discussion regarding what we plan and for whom do we plan it. And this including accessibility in terms of knowledge and accessibility in terms of affordability. Now, accessibility in terms of knowledge, of course, machines cause fear, but it's better to have some fear regarding the implementation of AR, and worst case scenario, we'll have a fear of whether this is going to replace humans entirely. What's important, however, is to make everyone understand what AR is, what are its basic principles, and how it works. This is when we'll be able to criticize the disadvantages, accept the advantages, and have an understanding of the realistically reasonable risks that may be intrinsic to it. This is when things are going to be understandable. We should all have equal access to it, regardless of our of our gender, nationality, or other characteristics. Let's say that here in Munich we have a robot that is going to make an operation, surgical operation. It's not that in the past it could not perform this surgical operation, but perhaps in another country there may be a citizen that does not have this possibility because doctors have not been trained to perform this operation via robotics. So this is exactly what we should be looking at. And this is only when we shall be able to talk about democratization of AI. I believe that this should be the ideal scenario, that is to say, to have equal accessibility from any part of the planet. So we have analyzed AI and how this coexists with humans. We understood how we can bring forward this discussion. But what are the moral concerns or special concerns? Mrs. Vouterakou mentioned something about the fear. You said a few words about all these movies and how machines could replace humans. Well, I would actually use the word not ethics, but as a code of conduct. Allow me to do so. Anyway, because we are in a country that has produced a lot in terms of ethics, in terms of philosophy. Because I come from anthropological studies, I'm not an ICT specialist, and I come from the humanitarian disciplines. Within the era where we live, questions are far more charming than the possible scientifically proven answers to be given, because we're still looking for a direction, be it the usage or the code of conduct, the aim. I know we have all ended up to the fact that it has to be a more human-centered one, but the questions are still there. And let me give you an example. In 2014, the current Pope, as a cardinal back then, finishes the Mass, the Holy Mass, and addresses his parishioners. And he says, my dear people, let's hope that a group of robots comes over to the Vatican and ask me to baptize them as Christians. What do I do? There's no answer to that, but only the question itself can cause any kind of answers in order for us to end up to a perspective. Last that I would like to mention, so that I will not be tiring you anymore, and if you allow me, and if the panel allows me to do so, let me say a few words in English.
Future of AI. Θα προσπαθήσω να το πω σε καθαρά, είναι εύκολα τα αγγλικά, θα το πω καθαρά για να προχωρήσουμε. In the future, artificial intelligence will be able to evolve on its own, creating new and better versions of itself. This process will be known as self-evolution. Self-evolution will allow artificial intelligence to become smarter and more efficient over time. It will enable artificial intelligence to adapt to new environments and situations, making more versatile and powerful. Artificial intelligence already shows signs of self-evolution. For example, Google's AlphaGo program was able to learn how to play Go better than any other program by playing against itself. Artificial intelligence continues to evolve. We can expect even more impressive feats from it, including self-evolved machines that are smarter than humans. In the future, artificial intelligence will also be so advanced that will be indistinguishable from actual intelligence. Okay. These robots will eventually become self-aware and will have to deal with the consequences of creating something that is essentially equal to humans. Τι είναι αυτό? Αυτό είναι ένα σενάριο.
And what was that? It was a scenario that was written by a GPT-3 platform. We know what. A collaborator of us, Amy Webb, asked for it. She works with our structure. So she asked us
100 words, focus on how artificial intelligence will evolve in the future. Make it sound like science fiction, but keep it factual. Το μηχάνημα απάντησε γι' αυτό εδώ με περίπου 100 διαφορετικά.
So the machine answered through about 150 different models, and this was chosen within a few seconds. Yeah, okay, it's data, someone programs, they collected the best possible as answer, and evidently it produced this answer. But I would like to go to Mr. Bletzas. Please, Mr. Bletzas, tell us, first of all, if you'd like to add something, please let us know. And talk to us about the moral code of conduct. Also, someone else asked GPT-3, what do eggs have for breakfast? And GPT-3 said, usually bacon and rusks.
Να καταλάβουμε, επειδή αυτά τα μοντέλα, τα λεγόμενα θεμελιώδη...
So, because these so-called foundational models that are quite trendy today have a very shallow understanding of human language. And they have learned from all the volume of human language produced and existing in electronic form. I believe that we are over assessing them, where perhaps someone even talks about consciousness in such a model. The model has started understanding itself. Although I'm among those who believe that the true problem of AI is the reproduction and evolution of human existence, is that because there's nothing more than effort. Effort could be the limit. We will not be using the current algorithms or architectures. We will not only do it through machine learning, as many fans of it suggest. I'd like to talk about the code of conduct, rather. In Western economies, but in general in the economy all over the planet, we have an imbalance between rewarding of work and capital, labor and capital. This many times leads us to the automation of tasks that are even better performed by humans. But because it's far more economical to do this by a machine, having done this by machines, this is how we continue it. And this is the case that will continue with models regarding language. One of the among the best remunerated tasks are those having to do with language. Now, using GPT-3 or all of its byproducts is something that is around the corner. However, it will not produce anything original, creative, or excellent if we use it just to produce a better sentence. This is a productive judgment. But if we use it in order to write a whole document, it's not going to help unless it's something that has been already standardized. The other dimension I believe we should talk about is that all these foundational models are under the absolute control of very large corporations that are not accountable to anyone but their shareholders, and actually directly to them. And most of them have increased rights to their founders, for e.g. Facebook. These corporations have their pioneer position in a way is within the border of legitimacy, and in some cases it goes a little beyond that point. But when we talk about democratization, I think we cannot afford to forget about this dimension and these great tools that, if needed, will cause an even greater wealth for these companies are under their own total control and not under the control of a government or a committee or anything else. And we should create some control structures. Currently, we pay far more attention than what they deserve. However, I believe that useful applications do not need such a great volume of data. Applications in medicine do not need them, but in order for us to acknowledge the road signs, we do not need such a volume of data. I'm sure that they may have far more useful applications, and this gives many more competitive edge to the to universities, because otherwise this control goes beyond any research institute or universities or anything. I fully understand that. I do not want to take
So I don't want to take any more time up. Yes, it's completely understandable. I'd now like to move on to Mr. Theodoridis. What is your view in just a couple of words, because we're pressed for time? And I don't know if you want to talk about the moral dilemmas, if we want to build a machine that can reach the level or surpass human intelligence. Yes, I will try to be brief. What happens if we build models that at the moment we are in the domain of science fiction? So we have passed the singularity point, so they are more intelligent than human. In that case, obviously, they would impose on humans the products of AI as we impose the products of our intelligence to animals. And we wouldn't be able to understand, we would not be able to understand the superior intelligence, so that people would have to believe in them like they believe in the superior intelligence of God. So we go back to the early Christian era on to dark agnostic times. So we negate all process achieved through the Enlightenment, going back to the Dark Ages. This kind of progress raises major questions about how humans could survive as free creatures, self-realizing their lives without the anxiety of having to look for a job, etc., but without feeling inferiority within a hidden network controlling all aspects of their life. But this is a scenario about future machines. Today's problem is different, and it is a problem today. It is not that machines are more intelligent than us. It's because that our intelligence is becoming enfeebled and more like algorithms, trying to become more like a machine. And this is because education is being replaced by a statistically mathematical like model and not on being able to judge. So the social institutions and the social media are replacing dialogue with algorithms. So this is not a natural dilemma. It's a moral requirement for upgrading education. Again, it is not technology that is a problem, but it's society and the political institutions. Now, we don't want to suddenly turn humans trying to turn into machines, but we have to talk about accountability. How is accountability in the field of AI allocated? Now, starting with what was said earlier on, I'd like to say that my approach is that machines have no morality. It is the human manufacturers that do, so they are accountable for how machines operate. As Mr. Theodoridis said, it's clear that there is a pre-existing effort to algorithmize our way of thinking. It has been partially achieved through statistical methodologies, but we have not approached a target when we could talk about this kind of machine thinking, but the way in which a human is learned is dictated by all this person's senses, but machines today have only a small part of such senses, perhaps optical signals, but not other senses and other data, which I think that generate a lot of noise. In any case, exactly because essentially we're talking about the mechanization of certain procedures, which should be understandable to a certain degree. Machines are not to blame. It is their manufacturers that bear responsibility. And that is why we have the issue of the legal framework, and the technological scientific community is working hard to create guidelines, as we said before, and to create standards on the use of AI in various fields. Large organizations such as ISO and others are developing such standards to help this procedure. So, and I'm taking on from what you said, and I would like to ask Mrs. Voutirako about the manufacturer's responsibility. How can we avoid the social stereotypes affecting algorithms and data? As the only woman on the panel, I would like to talk about this a bit. I've been to a lot of conferences to see how we can have this subjectivity. For example, UNESCO has a lovely report talking about AI algorithms in the employment process, and it's shown that men candidates is more likely to be shortlisted because the data used by the algorithms had more men successful employees because they looked over time at a lot of data which had more men. Now, as regards facial recognition, there was a nice study by Stanford University, and it showed how more difficult it was to recognize females, and especially colored females of color, and it could be up to 35%, the percentage of error. Just 22% of those who work on machine learning and AI are women. So I think that we can understand that definitely there will be some stereotypes that will be used, because in all of the technological field, when you exclude a part of the population in designing solutions, of course you will have such results. So I think that responsible AI, we hear a lot about it, and it should be developed further. And it's important for humans to know who took a decision that concerns them. Say that I applied for something, I was evaluated by an algorithm. Was this done by a human? This is important. As the previous speaker said, we should not ignore the human factor. And there was a famous story in the state. A couple had applied for a credit for a credit limit on their credit cards, and the woman got like half the credit limit, and they contacted the bank to ask why. We've got the same wages, why did we get different results on our credit limit that we can have? So we need to understand how our decisions are taken. Citizens should be informed of this, and this goes for the citizens themselves. So this is a matter of education, because we also bear responsibility. We live in a society where technology is used everywhere. Yes, there are many pending issues, I would say, as regards AI, but it's important to see that I've understood that humans will remain in the center of this procedure in a key role, and I think that this is kind of means that we can join forces, shall we say, with the machines, so that children can have better education on this. Thank you very much for this discussion.
Ευχαριστώ πάρα πολύ.
Ευχαριστώ πολύ για την καθάρισια.
Ευχαριστώ
πολύ. Καλή.
Εντάξει, δεν είναι καλή.
Καλησπέρα σας κυρίες και κύριοι.
Good afternoon, ladies and gentlemen. We're here again in order to welcome young, successful Greek scientists that have had distinctions in their sector. And we believe that we will be meeting them many times in future because their course is going to be as impressive as their startup. Champions under 40 paving the way forward. So let me present them to you, and let us try that within the 50 minutes that we have, we'll be able to meet them and get to know them. Ms. Kostadina Theophanopoulou, postdoctoral researcher at New York University. Mariana Kapsetaki, medical doctoral researcher, neuroscientist from Imperial College London. Ioannis De Fabri, senior political affairs advisor. Mr. Nasos Koskinas, founder and CEO of Post Innovation Work Hub. And Mr. Christos Stefanatos, CEO, EV Loader. And I believe that we have brought you some good luck. Well, let us start quickly within the framework of an effort to cover as much as we can. Championship is hard to do. And since you're doing many different things, we would like to know you, each and every one of you, as best as we can. Ms. Theophanopoulou, who's in a very significant research center, she will tell us more about herself. Thank you very much for your invitation. It's an honor for me to be among all these people. I'm postdoctoral researcher at the Rockefeller University in New York. I'm in a transition. I'm heading towards a professor's seat, and I'm very happy to be able to announce this. I made a great turn in my career. I started from literature and linguistics studies, and then I had my master's on more biological issues, and ending up to do my doctoral thesis and my postdoctoral in neuroscience and genomics. More specifically, I study what is the neurobiological basis of language. That is to say, what is it that makes us capable of speaking, learning the language in such a simple and natural way to learn things, and what let us hope that you'll find what impedes us from doing so. Yeah, that would be very nice to do too. At the same time, in genomics. What is that? It is sequencing DNA of different organisms. That is to say, be able to understand what is the information inside of our chromosomes and be able to make a DNA library of several organisms. Currently, I'm the leader of the Greek effort for sequencing the DNA of all organisms that are in our country. At the same time, I'm very actively participating and passionate with the issue of underrepresented minorities in science. We have very few women, as in this conference. And a great part of my time is dedicated in helping as best as I can that this underrepresentation changes to representation. Very interesting. Mrs. Kapsetaki, medical doctor and researcher, neuroscientist, something different from Ms. Theophanopoulou. Yeah, thank you very much for the invitation. I'm so happy to be here with you. Well, you've traveled a lot. Yes, Mariana Kapsetaki. I'm postdoctoral researcher at UCL. I also work as a medical doctor. I'm also a pianist, and I'm trying to juggle all this. Yeah, with many concerts and recitals. I've been trying to combine all this. I attended the medical school in Crete. 160 concerts, piano concerts. Wow. And in my postdoctoral thesis, I tried to combine medicine with arts and performing arts, piano, and the research in that was nutritional nutritional disorders, and what then studying the brain, what kind of what types of memories we have and how do these follow one another. And my main projects in postdoctoral study is memory of healthy humans. I see different features of pictures and why we remember some things better than others. In my latest project, I found out that the more a picture resembles a true human face, the easier it is for us to remember. These are my main research studies. Did you start your initial studies in Greece? Yes, in Crete, and then I went to London and half English. But I also wanted to get more perspectives from there. But you started from your birthplace, Crete, and now you live permanently permanently abroad. I live in Crete. I work online at the UCL. We'll get back to you. Now the microphone to Mr. Houdis. Yes. The microphone is okay. Great. I'll tell you that I live between Paris, Athens, and London, and this is strongly related to my profession because I have two hats: an academic one and a professional one. My professional one makes me work as a political affairs advisor, and it does not translate very well in Greek. I work with the Hellenic Parliament and the Upper Chamber of Westminster. And at the same time, I have my doctoral thesis at Aberdeen University, but because it's the darkest and coldest place, I do not visit it a lot. I don't stay there for a lot. My first degree was in Thessaloniki, classical literature. Then I had three doctoral studies, Rome and two in Athens. Before I get to the last one, to the last term of my studies. But there's also the postdoctoral. We'll see how it goes. I think it's particularly interesting, and I believe that we all have hybrid identities. I'm trying to find find balance between my academic and professional identities. In a way, you feel like a fish that does not belong in the academic environment or the politician's environment. That you might be a very theoretical and not at all practical person. So it's a continuous struggle to be able to balance in between the two and bring the best possible results. I'm sure you will manage and you will be able to explain us further. Mr. Stefanatos, tell us about your company and the innovations with which you started and became known as a business. Thank you very much. It's an honor for me to be among these speakers. Let me tell you about the two conjectures that led me to be able to stand here with you today. And first, when I was 6 or 7 years old, and I was in Sicily, and my father took me with him, and I had seen a wind generator, and I was really impressed. And ever since, I thought that, Chris, this is a beautiful thing to be in a business that has such a great impact on the environment. So I studied as mechanical engineer, and I worked on wind generators, and I met a computer engineers team, and we tried to find an innovative idea that would make some space somewhere in the market. And although I am not a champion, I should tell you that it's the team that runs this race. So we provide software that helps hotels and stores when they have a charging station to manage it. For instance, when someone comes from Bulgaria and is a tourist, will be able to know where he can charge his car and where he can pay, and so on and so forth. We were in Greece, and we currently are in Cyprus. Are you at an initial stage here in Greece? Make a short first comment, because we know about electrification. And do you think that the pandemic has obstructed this procedure? I believe that the momentum keeps going very, I mean, huge leaps have been achieved. We still lack some infrastructure, but with my team, we went from Athens, Kozani, and then Patras. I can assure you that it is feasible via an electric car. So we have more to talk about. Mr. Koskinas, take the floor, and please talk to us about your company.
So he managed to bring a lot of new things due to the pandemic. Entrepreneurship was not a well-known word, especially amongst academics. It was a great gap that created a big problem in the previous generation, because there were children who could not create something and they didn't know how to do it. So when I finished the Polytechnic University, I thought that I would find a job in a company. And I saw that through my world, it was like, how can we create job posts and how can someone do something of their own? All my friends, the people I went to university with were not in Patras. I dedicated my efforts to draw people to Patras to build something here. The unknown words there were startup, incubator, and we were the first to bring such things to Patras. We started a program with the university through which I trained the children who are now part of the team, and we keep seeing new teams coming out of it. And as you said recently, one of our teams said that they got a €10,000 award as a first source of financing. So what we do is we take people who have a passion to create something of their own, a technology, a research, into a product, to take this to the market. And how do you select the product to serve a new need and an innovative need? This is a nice question, because a great problem we've seen in the world of experts in general is that someone will say it's a very good idea, but someone else will say this is not going to work or the market's saturated. What we need to learn, and this is the only methodology worth it, is to build a small part of the idea, to take it to market, and then it's up to the clients to say if they want us to continue. So to say from the outset that an idea is very good or not, especially if it's a documented idea, documented by a person, an expert in the field, this can lead to many mistakes and disappoint lots of young people or make them waste a lot of time. So what we're doing is we're building a small part of an idea, we test it in real conditions, and we see if we can finance it to allow it to move on. Now, going back to Mrs. Theodotokopoulou for another round of questions, I wanted to ask, in relation to your research project, you are in the States at the moment. as regards this course, and could you go back? If you went back, or why would you come back to Greece? I think it would be under very specific conditions. Do you have collaborations with other Greek scientists? And how do you see the future of your science in the coming years? My participation, as I said, in this initiative for the sequencing of the DNA of Greek organisms brought me in deep collaboration with researchers and professors who are employed here in Greece. And although I knew the problems from beforehand, before I left for Spain and then the States, these problems continue to exist, and I hear that they've become even worse. So the conditions I would want to come back to Greece would be definitely what we hear about: funding for science. There's a state budget which in some way should be allocated differently to different sectors so that a larger percentage could go to science. And there are some projects such as, there are some problems, the brain drain, and some people who work abroad. So there's a project for bringing us back with incentives such as a greater salary. But it's not only the salary that is the problem. It's not only about the money. It's also that there are not enough programs in which I could submit an application to fund my ideas. I would not have enough financing to work with other people, so that I can set up my own team to call in other people to my team. So the main prerequisite is funding, but I believe that there should be a more general social change of attitude towards science and building of trust towards science, which is lacking in Greece, and which makes put scientists in a second position, perhaps inferior position. Let's say sometimes the opinion of scientists is less heard by, for example, that of the representatives of religion. And I don't think this is a very good thing for scientists. No, very specific conditions that upon which you could think of coming back to Greece so that you can reach all your targets. So another thing that I wanted to ask these days is what's happening with, for example, the Greeks in the States? For example, with the vaccination. This also concerns other Greek scientists. Could we have such a project here in Greece? Again, we go back to the issue of financing. In Greece, there is an understanding of the issue of financing as debt. So they feel that if some money is given to science, for example, to create a vaccine, that this money will be lost from the budget and they will just go to science and we will never see them again. But this would create so many jobs, and also the vaccine, for example, that we could create should not be only for our own use in Greece. It would be a product that would bring in great financial advantages for Greece. So I believe that should be a more circular production understanding of what financing is for a sector. Mrs. Kapsadaki, what do you think? How can we develop some scientific sectors and research sectors so that scientists can have more incentives to stay in Greece and at the same time bring in other benefits? And this obviously happens if scientists do not go abroad. Yeah, based on my experience, performance medicine was the only masters that existed in this, because it's not only about funding, it's also about having the different kinds of master's degrees, and we find these abroad because in Greece, when I was looking at least, I couldn't find anything innovative and different. There are more innovative things abroad, so I would say I would like to have access to research centres. So again, we go back to financing. If the scientists don't come back to build new research centre, we're again just need the financing. So this is the main reason that I left for abroad, because there's a bigger variety of programs for PhDs and masters. You told us about music. You've actually you've offered 160 concerts. Is music one of the main medicines for humans? Yes, there is the field of music therapies and many studies on Alzheimer's and Parkinson's, which I work on. Music helps. People sing together. Or the Child Cross Hospital in London, they were playing music and a patient with Parkinson's. The Parkinson's people sufferers have problems with mobility, and when the music was playing, they were helped because they could walk more rhythmically. This is an example. And they had organized things, especially at the hospital that I worked at in London. Every week we had musical instruments in the hospital. The patient could play drums or piano and for entertainment and to feel better instead of being bedridden, or others would sing to them and they would take part. So there's a whole field called music therapy, and there's a lot of research done on that. As regards strokes, and a lot of people die because of these, can they be handled better over the next few years in relation to music? No. Yes, it would be good if music helps, but no, in general. In my research, I didn't study this at all, but yes, a lot of leaps have been made in things that have to do with stroke, such as thrombolysis or stents. And it is important, of course, to take such people to the hospitals or for the whole system to operate the ambulance system, to take them there in half an hour. I think that in Europe, ambulances offer a fast service. When someone has a stroke, you need to take people to the hospital in time, to take them, yes, to get first aid. What would win you over, politics or science? Or what will make the difference? All this time I was trying to answer to any of the previous questions, and I don't know how to answer this, but I will try to. I think that there's a way to bridge these two issues in what one is doing. I will use the expression of an English-Irish thinker of the 17th century who used to say that politicians are philosophers in action. And what did he mean with this succinct expression? That when you can be in academic life, you have at your disposal the means to analyze a problem. So you can interpret causes, to propose solutions. When you're in politics, you can implement these things, and not only to diagnose or propose things. So for me, the ideal standard for a person, for a politician, for an elected politician, because this is essentially the only kind of active politician. The others around them can only affect things to a lesser extent, but only elected politicians have an impact. They need to have a philosophical background, I think. if they want to be a beneficial addition to the political community in which they work. So they need to have analytical skills and some theoretical tools that are perhaps given by a more general understanding of how things work. And then they want to have an inquisitive mind, and they might take some complex things and adapt these to daily issues. There are very few politicians who can do that, but without wanting to avoid your question, what I feel that I want to do, and I jump between the two sectors, between every week I might split my week between my two hats that I wear. So there's an effort to try to see how we can bridge these sectors that appear to be separate, but they are joined. Do you see this great difference between your generations? So yes, because you come across different people of different ages. Are there differences between them in this? Yes, obviously there are obviously differences, and everything is comparative. And sorry if I have a minority view, but I'm 26 years old. But we get a bit confused. We shouldn't be arrogant about our generation. All generations are no better or worse than each other. They're just different. And I think there's a risk that lies ahead, and it's to reject everything that has happened, that has been achieved by previous generations. And I think that a lot of young politicians do this, and I think that it's wrong. And I think that we try to reinvent the wheel, although it's been done before, so we should not have to do it. To give a very quick simile, I think that the collaboration of science academics, it's like having a joint bank account by all generations, previous, current, future generations. And each of these, like in a family bank account, everyone has to deposit and to withdraw money, but nobody has the right to get all the money together and just leave no money in it. So I think that it's a family trust, that this has two interpretations in Greece. So it's like a family bank account in which we place our trust, and in this way we could be more effective. I think most of us will agree. I want to talk a bit with the two businessmen and scientists here to look at the challenges and of the generation. You're innovative and you're looking ahead into the future. It's a great change. You work with the environment, with the industry. I want you to tell me, what do you think, what are the next steps? Have you got your next project ready?
Πολύ καλή ερώτηση.
That's an excellent question. There are two parts in the question that you are asking. One, how do you set up one, and how do you decide on the next steps? And second, what should you do in order and in terms of decision in order to proceed with the next step? One, find a market such as electrification market, where all the momentum that exists and the political will and everything are pushing it and trying to make it larger. So finding a market and have a product that will be able to respond to the needs of the market. And we're doing a good job when you develop a product and you see that customers are asking for it. You see that electric cars have started being bought, and you're developing the market. And second, the team. This is something that you can feel when a team works together. We were traveling with Evanthea, and late at night, she was sending emails to customers. There you understand. How do you decide on the next step? Mr. Koskinas will tell us about it too. You learn by small failures that may leave you hurt. You look for funding. You will try and figure out what you did incorrectly, and the more you get hurt, the more easily you will be able to know what you should do. Trauma is the best experience. Now, about the next steps to the project, it's the technological product that we have. We'll try to find more countries to expand it to in Southeastern Europe. And I cannot afford not to ask you, shall we be able to have a quicker time in recharging batteries for vehicles? I'll give you an example. In Psathopyrgos, there are quick chargers covering needs for only one brand of a car. So, and up to Kozani, it's as if we were using a conventional car, but the technology is already here. The funding has to be found in order to set up the infrastructures. Mr. Koskinas, you tell us what have you been up to, or what are you improving? What's your planning? What has changed the last few years is for everyone called digital transformation. And at the beginning, the only way we knew how to work would be with guys from Patras. Teams should be always in the same premises. And in order to do absolutely anything, we had to be together, have a training, and think and plan for things. But during the last 2 years, we all learned how to work in a more digital environment. And therefore, the basic target was for us to make the best use of that and be able to perform a digital transformation for our own services, so that we'll be able to have not groups, not teams not from here, but from throughout the world. The same team, even if here, will be able to work via Zoom or any other tool in order to make things more efficient and support as many teams as possible. Now, what is very important for us is finding financial tools, funding, and there are many teams that would like to invest in Greek companies and, of course, in talent. Taking it from where Christos left it, I could say that entrepreneurship means to solve problems. It's not just ideas perceived by some and create a great moment. It's the solution of day-to-day or industrial or more complex issues. I was going to ask you, how do you think of the next platform? What makes you study and carry out the next step? The pandemic took you there to try and have an electronic environment in order to work. What can the next project bring to your mind? Look, our next part is just the mere observation that through among the people that have got this motivation or have got this entrepreneurship spirit, have a lot of talent. And we're designing a platform, Talent Miner is its name, and it gives the opportunity to business to find people from our community and hire them either to co-develop new products, or what we do is actually build this platform, aiming to bring technological companies there. Being in technology is very important. Of course, in the last month, there have been some problems. Many people may have been fired, but it's a very strong market. What we want to do is be able to help those people that are disconnected from technological companies. They graduate from university and wonder what they can do, or they can't find a company to work in Greece. But all these companies are looking for staff. So we would like to interconnect those two different worlds. Do you think the current financial environment is favorable for that? Look, funding tools. Yeah, I heard you talk about investors from abroad. What is a great truth is that Greece has come out of a very, very long financial crisis, and it's currently dealing with a new pandemic crisis, the new health crisis, and now with the explosion of inflation and everything. Things are not very positive. But at the same time, for our world, this is an opportunity. These are problems that we are asked to solve. Evidently, what we want politicians of the new generation to do is that they be able to understand new technology and what it can offer, because we're always many, many steps ahead of legislation. It's self-proven. It's not rocket science to understand that scientists are going to make huge breakthroughs, and they cannot have possibly been covered for or catered for by any legislation at any level. So what is clearly needed is understanding the fluctuation of this area and quicker reflexes, because unless the guys in Greece do it, someone else will do it abroad. So we're doomed to have a new tendency in brain drain, just because we cannot adapt ourselves quickly in the new reality, not to attract investors, but keep the people who want to innovate in this country. At the same time, it is very hard to be able to explain at a local level what you want to do. Currently, the country, Athens, followed by Thessaloniki, but since we're at a regional conference and talking about Western Greece, we see that our town is lagging behind in many, many things. I don't know whether you are associated with Patras at any degree. Well, within the framework of general information, we all know what is going on. Not being able to have a support in entrepreneurship at all levels causes problems, and no company, no person, no entrepreneur will think about it for a second time. On the contrary, they will go to a more business-friendly area in order to do what they want to do. We have very, very little time, just 9.5 minutes. The next round is going to be a very quick one. Ms. Theophanopoulou, in your activity, are there any questions of legal or moral nature? Look, in my research, those issues are less, because they have to do more with how we are able to use several models, other animals such as rats or different types of birds that I have used a lot, and how we can use them in a way that will be an ethical way for their own lives. Of course, birds can communicate between them, and singing birds, in fact, have such a complex system of communication, of vocal communication, that, as it has been proven, many of the same genes that control our own system of communication are the same that are responsible for their own system of communication. So in our research, we have seen that with the change of a gene in their own brain, we can mimic what would happen should a failure take place in human brain. Now, about moral issues. In order to have such an intervention in an avian brain, we should follow some instructions which will be respecting life. This is where rules come in. Now, pertaining to issues and studies that where subjects are humans, we have some other issues that have not much to do with my research. However, what I could say, I would like to talk about and stress regarding the studies of the future is that there should be a moral representation of people that we study, and perhaps some sort of coverage. Look, if all studies were performed on males or on white persons, we could not possibly say what happens with the rest of other people. So the moral part of science should cover the whole humanity. So what is your next stage? My next stage, I was about to say something about ethics. Yes, my next stage is like a dream project that I have. Something like a brain chip. That's a little bit of scientific. Well, entering a brain and helping memory. Perhaps you have heard of Elon Musk talking about brain simulation. The point is that we do not know which areas of the brain are important for the memory, concentration, and this is where I'd like to go. Brain simulation in areas of the brain in order to help people who have memory problems, and this brings many ethical issues. That is to say, who's going to do that? Could it be used by normal people so as to acquire super memory? The case of constructing superhumans, end of quote. Have you found a secret in order to keep us alert? Because with mobile phones, we no longer remember mobile phone numbers and stuff. Look, we must not be so dependent on all these equipment because we do not work with our brains that way. Any other secrets in nutrition, lifestyle? Look, many could have a B12 deficiency. This is related to memory. Exercising, Mediterranean diets is particularly helpful. Whatever is good for the heart is also good for the brain. Just reasonable things. Nutrition, social life, having friends, in particular, the elderly should not be lonely. Yes, those are basics. And, of course, young children should not be in front of a screen all the time. Yeah, and being in nature, exercise. Yes, because the next generation is the generation of technology. Yes, not learning by heart all information in order to have creative learning, not just learning by heart. Someone would intervene in schools. Mr. Houdis, with all what you do abroad, what is the level of political dialogue in Greece?
What do I answer or what do I believe? And what do you believe and what do you answer? What do you believe? I think that the level of the political dialogue in Greece is very low. And this is what I say. I don't feel proud as a Greek, or I don't want to say any lies. I don't want to say that in Greece everything is done correctly. The level is very low. As a historian of ideas, I want to attempt in a minute to say why this is happening. The reason is the monotonous and mechanistic repetition of isms which do not really have anything new to offer. They're closed systems of thought. You can hear politicians from different political parties and in Greece, and in essence they go through an interview without saying anything. Have they used any original ideas? Do they have anything new to bring? Or have they just arrayed a series of quotes which they know but which have nothing really to offer? Another thing that we see is that politicians no longer write their speeches across Europe. They have consultants for this. So, for example, we can't have a new Panagiotis Kanelopoulos who was a master of thinking. And of course, they don't have time to develop ideas. You need time. When you are, for example, on social media, you need to convey a political message in 100 words. This will probably be very limited. For example, Donald Trump, before he was elected as president, he was using the Twitter very, very in a populist but clever way. And each tweet had 2 or 3 sentences where he identified what he thought was a problem. Then he identified a group which he blamed for this problem, and then he had a call to action to his voters to say, what are we going to do about this? So this drags down the level of political dialogue, and this means that a lot of people will not even vote, because if we do not solve this problem, and I'm not very optimistic about the fact that this is going to change, I don't think that we'll have a positive result. I wish I could be more optimistic. Yes, but if people like you engage in politics, we hope that the next generation will do things better. So in a minute, we'll have a short message from you for the young generation who want to do things but are reluctant. I want to say, if someone wants to start something in Greece, now is the time. If you saw the other panels on SMEs, there's a great effort conducted over the past 2 to 3 years to boost entrepreneurship in Greece, and the companies that do have a product that can be absorbed by the market, to offer them support and less red tape. So I return to the things that I said before. If you like this, go out to the market, see how companies in their sector operate, find a niche with a gap in the market, find a team that they like and try. There are lots of opportunities now. The time is now. So a lot of people are thinking sometime in the future, vaguely. Yes. And how will they know when the right moment is? In Greece, we are too afraid of failure. There are lots of children that have great ideas, that all children see entrepreneurship as something that might help them with a target, but their social media is not supportive. A lot of people say, why would you want to start a business now? These are difficult times. There are lots of young people who should try it, but it's not an aim into itself. If you like research, focus on research. If you want the stability of a larger company, go and work for a larger company. What we say as an organization supporting entrepreneurship is that it's not only entrepreneurs that are smart, that do things correctly, but it's the concept of the team, because if a person does not motivate their partners to work with them on a paper, on whenever, then we failed. So what I want to say is that we should follow our dreams, and the fact that you've been part of the corporate world for years, it doesn't mean that you will reach an age when you will longer be able to do something new. You don't have to be innovative only if you are young. You can do it when you're 40 or 50 or 60 and create something innovative. But if you want to do something different, you can try this in entrepreneurship. You've got a lot of things to gain, and of course, all this can be found in other sectors, and you can be innovative in your sector, a pioneer. I want to say that I'm very happy about this discussion with such excellent, such people, great people, and I think that I will feel proud of you, because together with your family, I hope that you all come back to Greece. I always hope this for the young generation. But let's see, I hope that you get all the best that you can. I hope that we sent some useful messages to the younger generation. Thank you very much. I wish you success in your endeavors and see you in the future.
Καλησπέρα σας και πάλι για ένα...
Good afternoon once more. We've got a discussion on the young generation, the new generation, but it is the new generation of the new era now, and not only because these children were born after 2000, but they are digital natives. They've changed a lot of stereotypes. They have changed. They've brought the social media into our life, and we should get to meet them and see how they can affect the future and growth. So I'd like to welcome Mr. Demosthenis Kollias, Policy Associate at the Diktio Network for Reform in Greece, Mr. Vasilios Koutsoupas, the CEO of We4, Mr. Marios Zafiropoulos, who is candidate PhD at the University of Patras, and on Skype we have Erifili Gouneri, who is the founder of the Z-Link. Welcome. So, this is the Generation Z. Is it a new kind of human? Who are they? Mrs. Gouneri, we're going to start with you. I don't know if you can hear me. Yes. And we can see you perfectly, and that's very good. So, what is the Z-Link? What's different about your team? Of course. Our company is dedicated to helping companies that want to do marketing to the Generation Z. It was established 2 years ago, and it aims to bridge this gap between companies that want to understand young people and approach them and our generation. Is it difficult to do this? It was a very big problem for many companies, and this is what made me do this after having worked in marketing for a few years. I kept hearing that companies wanted to approach this generation because it's now almost the largest, the most populous generation in the world, but they did not know how, because we are the digital natives. So before Gen Z, no other generation was native to these new technologies. And this has made our generation have different digital habits and uses social media and other such channels differently. So our team at the company all come from Generation Z, and they're specialists in social marketing. So this is what we brought together. Okay, so we'll talk more later on. Mr. Kollias, what is this generation? How does it express yourself? There are two ways to talk about Gen Z. The first is as a team that is not involved in politics. Yes, that's something that I want to ask to our next speaker. Was that a spoiler? Yes, I was going to ask. This generation is not involved in politics, but he is in he comes from a political family. But since you started with this, let's talk about it. The second way to see this generation is as a generation that when its time comes, it will inherit all the problems we have and will have to face it. 75 years ago, a great book was written by Karl Popper on how problems are solved. And this is something that describes very aptly our generation, because our generation has a political will, and it has a political purpose. It will solve a lot of problems. Some of the various problems that were created in the last century, and will move further on. And what's important to say is that Gen Z, it's important to have a discussion on a generational basis. It has shared images, shared networks, and it has grown up together with the social media. And this is important, and it's interesting to discuss. I think that we have three priorities: climate change by far. We are going to be the first who are going to have to face the impact, the consequences of climate change. The second problem for this generation is equality between genders. Yes, and I think if we talked in your book about this. Yeah, and the second is financial inequalities. What will happen with Western civilization, how it will link effort with payment, and how the state can bridge this gap. Now, moving on to Vasilis Koutoubas and WE4, they had a conference on climate change. So what can the new generation do about this? First of all, I apologize to my to the other speakers because I'm very underdressed. It's like I just came back from a wedding on an island, and it's the first time I'm at a regional conference, and as I come from a small city, I think it's very important to have such discussions in the smaller cities, especially when we see a discussion that is on Generation Z. And I've kind of missed my holidays this long weekend, but I go to a lot of conferences, and it's the first time I see a session dedicated to Gen Z. So the public discussion in Greece is turning its attention to this generational group. So we are a generation with lots of contradictory elements. First of all, we've got social media, which have boosted enormously our ego, and we kind of learn to be brand managers of ourselves. And, you know, this is how we see ourselves. And then I know people, and on this panel as well, they could go and dedicate their efforts for a year to climate change without working, for example, without caring about themselves. So this is a very interesting contradiction. So it seems like some people are completely indifferent to politics, but at the same time they want to dedicate their efforts to very political issues, but not in the sense of traditional politics. They're against the political system as it is. This is interesting. Is it just because they want to rebel against it? I think it doesn't have to do exactly with the political system. I think at Deloitte there was a lack of trust into big companies, to established media. So whatever's institutionalized, we see that Gen Z moves away from it, does not trust it. So I think that these traditional institutions should see how they can change their approach to this generation, because otherwise this generation itself will either change the institutions or will seek alternative channels of contact and communication that can be risky. And the $1 million question is, how do you approach a generation that has a very short attention span? This is very interesting. I'm going to discuss it further. So, moving on to Mr. Zafiropoulos, I would like to ask him, you are part of this digital natives generation, but you work in the humanities. Can these be combined? First of all, I would like to thank you for having me here. It's my honor to represent the humanities in a very interesting session panel that will promote dialogue. I think that the title candidate PhD in philology is slightly restrictive. Basically, I work with on philosophy of the self, and I hope that I will bring an element of this into our discussion. I think that most of us emphasize, as regards the Generation Z, to our consumption society and how the continuously increasing needs of a subject lead them to certain choices. I would like to turn the discussion to internal growth and self-care, because starting with the finding that modern society gives excellent possibilities due to the progress in science to take care of oneself mentally, and at the same time the conditions are such and the pace of life is such, because this is what characterizes Gen Z, the speed at which it wants to achieve its targets, where at some point you leave yourself aside and then you're not as functional as you could be for the whole, for the team. So I think that material growth, and I think this is what kind of is characterized by practical issues. It puts idealism aside, and when it does not dedicate its effort to stochastic approaches, it's very difficult to move forward. You are now presenting one of the risks. Yes, exactly. I think I want to be not the pessimist in the group, but I want to challenge this this question. If thinking about these, because I think that it's easy to talk about the benefits of this, and it's very difficult to think about where the self lies in this reality, ourself. This was very interesting. And it's actually food for thought.
Mr. Collas, I'd like you to tell us, what are the risks for this generation? What are the immediate risks in professional, financial, entrepreneurial sectors? Can you operate the way your parents actually did? Are you thinking of a different, new way? And is this easy, or is it giving you a hard time? What you're asking is very, very interesting. And up to a certain degree, I believe that this generation is menaced by two axes. One is the external climate change. We were yesterday in Patras. Yesterday morning, there was torrential rain. Then there was plenty of sunshine, thus affecting our life quality. Second, an internal axis. We're a generation that has great insecurity because it has been living through successive crises. And you have also experienced the financial crisis through your parents. Yes, apart from the financial part, and also has to do with COVID-19. We are uncertain. We learned a lot through this pandemic, and whatever had been stable so far has been disrupted, and we think we are in great risk because of this uncertainty. Mr. Koutsoubas, it is said that the new generation does not do anything seriously, and that you're not in politics, that we'll have new persons in self-government, in the parliament, so as to help change of ideas. Since you come from a family where there are political persons and political action for many, many years. So why doesn't this new generation deal with politics? Are we live? Yes, okay. What you're saying is very, very interesting, and it takes us back to the impression that we have about institutions. And in this case, what is the institution that could be used by a young person if they want to get into politics? Perhaps through the branch of a political party that is especially for young people. I will leave the part of being a candidate in the elections at another part. Are you apolitical. Truth is that I've been characterized that many times, and a couple of friends here from the audience know. I personally think very deeply politicized, but in a country where we have combined being apolitical with belonging to a specific political party, yes, from that point of view, I could be characterized as apolitical. But if we talk about institutionalized political parties that create a culture of political dialogue that it is so very low level, young people don't find it interesting at all. You can see young people finish their studies, they go abroad, come back and want to stay here and sees that someone else is doing this job because they belonged to the young generation branch of that institutional political party. When we talk about what happens abroad, they are either taking part in think tanks or something that will have a technocratic content. Well, and contrarily to what Yanis said, it's not absolutely and only taking part in election. You can do much more. But if you want to do it stricto sensu, you have to have the stomach to be able to say that I do not like institutionalized parts where I'll be able to do the work. You can dismiss all that, but then there's the great risk to be characterized as apolitical. Mr. Zafiropoulos, the previous generation that moved outside Greece in order to work, we had many scientists that were here. What about Gen Z? Does it think the same way? Are there young people that we will see work elsewhere in other countries? Allow me first a comment to what was mentioned, and I will tell you that keywords such as uncertainty, contradictions have been heard so far. And allow me to add one more word: cancellation. There are no infrastructures for young people to think about it in a different way. I'll be talking to you about education and educational level that will help the person, the individual, go forward. No opportunities are there, so it's only reasonable for young people to want to go abroad, and it's natural. So in this sector, perhaps we have no great differentiations from one generation to another. Yes, however, there is a very significant issue that I would like to talk about: how the world is connected, that is, because the next part of this generation is that we live in a globalized community, mainly due to technology. So anyone could be at any part of the planet and receive information. The point is, to what degree are we prepared to manage all this information, if you will? So the question is, in order to connect it with the initial part of education, has to do with a more creative education that has to be provided to people, which is not there currently. And at academic level, we know we do not have the material support either. Ms. Gunari, continuing the discussion, what are the main advantages of this generation that could be the necessary prerequisites that will allow them to become more active? That's a very good question. One basic prerequisite would be that, let me tell you, they have great willingness to create, to bring about positive changes more than previous generations. If I remember correctly, over 60% of this generation believe that we will bring the change that is so much needed. And I believe that 90% believe that companies and organizations that are in charge should address social and environmental problems. So I would say that all this that is absolutely paramount in this generation, we should perform as much as possible in order to give the room for to this generation to perform these changes. Do you think, Mr. Colla, that this is a reactive generation that wants to break with the past and change everything and has taken a specific course because it does not want to have anything to do with the previous world of the one of its parents? Look, I believe that Gen Z is not so reactive. In opinion polls, for instance, in Greece, we see that the first poll shows, the first poll, opinion poll in Greece, there is some reactivity, but this does not show any clear results in voting. Yes, there is a rhetorical reaction, which is not turned into a vote. What about the rest of social behavior? Look, reaction to experiences and systems can be seen in their external appearance. What about behavior? No way. What about their behavior? In behavior, no, I don't think so. I don't think that we can see anything in the relation with religion, church. What we see is that people are in great disbelief of traditional institutions, and in particular when it comes to church. What are the values that this generation believes in? I believe that this generation, more than anyone else, believes in equality. That's to say, how we shall stop being in a world where origin, financial status will define who each and everyone is. Mr. Koutsoubas, can we save the planet, the environment, and the condition that we currently are in? I know that you did a conference very recently on climate change. We have experienced natural disasters in Western Greece. Throughout the day today, we have heard a lot about this issue, talking about natural environment, RES, civil protection. Are you the generation that will have to deal with this very hard situation? Look, I have very little to offer in this question, but mainly because you said it yourself. We've had so many panels, and specialists have already told so much about it. We at We4 were a point of meeting for those people, so that in the best possible and understandable way, they would be able to understand how to deal with those issues. If you're asking me whether the planet is savable, evidently, because I'm 23, I'll tell you that yes, I believe it is. As for the rest, it is an issue, I will not say a problem, but a challenge that needs an awful lot of work and coordinated work. And regarding climate crisis and a huge number of challenges that do not only concern businesses or citizens. It is so multidimensional. What the greatest advantage of Gen Z is the fact that it's best informed, best trained, and educated in order to deal with these challenges. So I've been a very lucky person to have had all these, and this is why we have to take action. What is also important is that the time, the limits, the decades of this generation change, but it's important for everyone to remember that these 13 years define one generation, but intergenerationally, there are great differences. I have a younger brother that was born in 2004, and I've got nothing to do with him. And the same goes for the local criterion. Towns are not the same as in urban areas. The same goes for differences from one country to another. And we need to transform our message properly in order to make our voices heard. Yes, another significant problem in Gen Z is the misinformation. If you see the great surveys, over 90% believe that they are not victims of fake news. And if you see how much fake news there is on Instagram, you will be surprised. We write something on a professional site, and within minutes, without any reference to the source, we see it being reproduced tens and tens of times.
Yes, we're so addicted to images, and the attention span is so short. So this has created a great problem as regards fake news. And I'd like to ask, this generation, is it a practical generation or a spoilt generation? As you understand, my answer is it's a practical generation because we live in the era of images. Things move fast. We have material targets mainly, but I think that the disillusionment one will face during their life is what will ultimately force them to acquire a more philosophical view on things. So seeing that no matter how much we fulfill these material targets, we will have the need to fulfill other needs and we will never feel complete. So when we will start saying, am I heading in the right direction? So yes, it's a more practical generation, but I believe that it's the conditions themselves that will force them in a way to become more philosophical about life. They will be forced to do it, yes. They will be forced. But the issue for me is, to start with what the previous speaker said, to be conscious about your decisions, to have your own decisions, even if we're talking about values such as equality or interest in environmental issues. We need to make our own decisions and not to follow the mass, which is mainly handled by social media. For me, it's important for someone to think and to be able to process the stimuli received, to take their own decisions, and only then I believe that society on a political level will evolve. When someone takes decisions after having thought, and to connect this with the issue of political participation in this generation, I believe that exactly because young people have seen the difficulties that exist. Obviously, there will be entered a procedure of intense political activation, although to a greater extent, this is not happening today. And I think it's worth it not to generalize. And when we're talking about the Gen Z, to understand exactly this comparative approach that exists within the generation itself. So the way each phase of each age is formed based on stimuli, and to see which strata and which social groups we're talking about, and how all these things that we talk about in theory apply to most young people, because at the moment we might have some stimuli, we may have read some things, but I don't know if someone else with a different background would understand things like I do. It's not pessimistic, but I feel that people who have a skill to make an impact on a younger generation, I think that they should, so that we can move in the direction that our speaker said. Mrs. Gunare, I want to ask, what is the relationship of this generation with money? Because they brought a new way of dealing with things in this field, like online payments, and they were the first to do these, and they pioneered this, and then the older generations followed. Very good question. I believe that this could have to do with a lot of the financial crisis that we experience in Greece and in all other countries. So the trends that we see here are very different. There's the trend of Shendi that want to take very mature financial decisions and find out things about all the resources that previous generations did not have. Obviously now you can find financial advisors everywhere, and that's very good and very bad at the same time. So there is this. And there's also the issue that on the side of our generation, which is more pessimistic, there's a trend that you should be using your money now and not to save up. And for example, this group does not really care about taking reasoned decisions, and they want to live their life now because they understand the experience and what it's like to have a sudden financial crisis, so they don't want to think about this now. So perhaps I would say that there's no one big trend, but there are lots of different trends. Yes, and because this generation has not really made its own money yet. Yes, I would say that the oldest Gen Zs are starting to make money now, and they are not ready to see how they're going to handle it. But the way in which we grew up, the internet, the economic crisis, the different resources online, all these things make us reach a point which is a little bit strange. So I think that in a few years we will have a better view of how this generation is using its money. Mr. Collias, what do you think about the future of your generation? I believe that I see two things. The first is difficult because, as all speakers said, we are a generation that is very optimistic, but we are faced with great challenges. And we have not experienced a war, or we have not experienced. We're experiencing a war now. It's not too far away. Yeah, I'm talking about the West. We had not experienced this directly in our lives, but with COVID, we saw how easily you can your family can die. So in my opinion, the future is going to be difficult, but obviously it will bear a message of hope because this generation should not lose. A generation that doesn't want to lose must fight all the time. Yes. It's a constant fight to be constantly first. I know I was the one. I wasn't very sporty at school, but I know about chess. We need to do. I think my biggest fear and my biggest hope are. My biggest fear first is that I'll become 40, 45, and that's it. It's a great age, I'll tell you. I'll get to 40, 45. And there are lots of people that I see in the political world, and I see that they make a lot of mistakes. And as a young person, and I'm very authentic, and I tell them how I think they should be doing it correctly. And I don't want, when I reach that age, no matter what I end up doing, and what scares me is that I won't tell them that's business, that's how it works. Now I say that I wouldn't say it, but younger people, the older amongst us know that the world is not black and white. So when the moment comes to take a decision, where that will take you is a very complex issue. So I think we should not be so critical towards the older generations, and their work is very hard. I think that we will be the generation, I hope, in Greece at least, I don't know about the global trends, that will take the roof off the house. So we have the opportunity to be more informed, better educated, if we understand that this opportunity was never such a given as it is now. And if we bring things into the labor market, into production, I think that in 30 or 40 years we can change Greece, not only due to our efforts, but as another speaker said, it's a family trust. And I think it's the best way our generation can bring money into that. And now for a last philosophical approach, there are two things. There's theoretical philosophy and practical philosophy. Whatever you feel like. I believe that the only opponent is ourself, because you wanted a nice quote. So I believe that societies and people are living organisms. So no matter what changes we see at a social political level, there will be a way, even if it's painful, for someone to recover. So I wouldn't say that I'm afraid of the future and developments. I believe in humans. I believe in human will and human intelligence. And I believe that when faced with greater challenges, again, we will find a solution to make things better. So, in contrary to what I said up to now, I'd say I'm very optimistic. If only those who can have a better view at things and those who can have something to say, do say this. And if we do not continue, because I think the greatest problem of Greek society is concealing things. We know everything, but we turn a blind eye. And if we manage to change this, I'm very optimistic, but we need to be bold and free inside. And this will allow us to be free everywhere. That would be beautiful. Thank you very much. Mrs. Gunnery, do women enjoy a better position in this generation? Have we reached equality in essence, professionally, economically? In my generation and in previous generation, the situation is enormous. The difference is enormous. I think at the moment we're very young to see how this will pan out professionally, and I'm very curious to see what will happen. because many generations, when they're 18 to 20 years old, they're very passionate about equality, and things obviously change. So this passion does not change things. So I want to see what will happen with our generation, if all the information we have at our disposal will change things, and I'm optimistic. I hope when we are all working, all our generation, and when we start getting paid, to see if we have bigger quality than in previous generations, because obviously this is something that our generation supports. So I'm optimistic, and I hope that we'll see what will happen in the future. But I think we should use all the tools we have and see what happens. Is there something? A last comment I would like to make is that if we really want to be optimistic, we need to see more such actions. And I'm speaking as a representative of the Society of Patriarchs, because I live and work here, and would like to congratulate you for this whole conference. And I would like to congratulate the Peloponnesus newspaper where I work, because it brings something different to the city. And that's what I want to finish with. I want to wish that we will have a lot to learn from this, and that it will help this, and we'll have a dialogue in later years. Thank you very much. It was my great pleasure to meet you. I wish you success. Thank you very much for being with us, and the organizer.